the operation centers, the public health emergency operation centers, in a wise manner. The CIR will continue so that we can achieve joint exercise. We support
Madagascar, you have the
distinguished delegate 2026 leaves, as well as public. We typically deploy these to respond to crises. So report in our region, which has this is progress, national capacity finances, integration of this on and increase better support. Climate events and EMTs are an essential element of a rapid IHR financing that it is very important systems. Therefore, we also want EMTs in Angola 2026.
Followed by comes the proposed what's current that manage Congolese national joint problem that manage Congolese national joint problem sisters calls for for national. We also call not an improvised personnel.
Thank you. Sierra Leone, you have the floor.
Yeah, Mr. Chair, for the adoption of one rapidly and Sierra Leone is committed to as an integral part of our national emergency preparedness and response system. Initiative in collaboration include they also contributed to the deployment plan, defining surge platform, emergency health security.
Malawi welcomes emergency medical teams. Since March 2023, Malawi has taken deliberate steps to establish and with interest towards classification, procedures for boy, which has already launched in 2020. Which has already launched in 2020, including UK East, the Africa, where 140 have a strong one since 2030. Thank you, Chair.
Thank you, Malawi. Now we give the floor.
The United Republic of Chairperson fixed nations validation EMT members 2030. Although we'll send in EMT. We call for concerns, readiness and chairpersons, sustainable national
Zambia.
Framework on emergency experience catastrophic and financing. Disciplinary, we have strength centers and simulation to deployment financing mechanism. Regional cooperation resources. I thank you. Resources. I thank you.
Thank you, Zambia. Algeria, you have the floor. Thank you, Zambia. Algeria, you have the floor.
Thank you, Mr. President. My delegation welcomes the Region 30. Reflection on emergency is currently structured around care threatening emergency line of defense in the field, including rescue and pre-hospital medical evacuation to appropriate healthcare facilities. Third, universal medical surgical global issue effective care, particularly to greater number of patients. The most advanced CTT hospital for the management of critical
Zimbabwe, you have the floor.
Thank you. The hospital for the management of critical
Zimbabwe, you have the floor.
Thank you.
Regional framework clusters and within the public health emergency operations center, public health institutes and ears of the health is strong governing, collaboration and technical.
Thank you, Zimbabwe. We now give the floor to Kenya, followed by DRC.
Kenya, we take note. We also towards classification. We train an initial multidisciplinary following WHO surgical care. We dependable tribal referral system will undertake with Transcan region in which 80% of cardinal framework countries and
you have the floor.
See medical need basic trainings. Yes, thank you.
Guinea-Bissau.
Trainings. Yes, thank you.
Guinea-Bissau.
Of health, the 2020 trauma flood and confirms that providing rights. However, for frustration must be deployable in led by the disciplinary and an immense we call this is tailored support for clinical. This is tailored support for clinical
Sudan, thank you. Sudan, thank you.
Pathway to collective resilience.
Times Mauritania, you have the
pathway to collective resilience.
Times Mauritania, you have the
of Mauritania 26-2030 of Mauritania 26-2030, which is an important disciplinary has helped us. Is an important disciplinary has helped us to improve our one of the applies with a minimal to respond to training applies with a minimal to respond to training so that we technical support at standard recognition of its at standard recognition of its prove a resilience as has we have understand the importance 20 framework on emergency health period workshop for these teams are a first step toward that deals with emergency period workshop for these teams are a first step toward that deals with emergent tech and on the integration of track investment in emergencies in our
from other 1 minute.
For its casualty incidents and to support program, cross-border program.
Thank you. Non-state. I'll start with.
Thank you, Sir Indispensable members. Disciplinary and its preparedness also requires leadership. Preparedness also requires leadership. Nursing leadership requires leadership. Nursing leadership for crisis response and the recovery highlights our crisis leadership collaborative highlights our crisis leadership collaboration response improve
physical and
emergencies taken in for both neuter and mass patient and assist already site mortality emergency humanitarian.
Give the floor to
WFSA and our testing theaters and intensive care and perioperative full patient monitoring engage them in team design.
Thank you.
All right. Thank you. And member states in emergency. These professionals start
the floor to public
light of large scale and complex be over institutionalized resilience include intervention.
I give the floor to International Federation.
Thank you, Chair. Each year, and equitable finance national exercises to maintain retencies to be embedded in health exercises to maintain retencies to be embedded in health responder without waiting for
very much.
Thank you on right.
Very much.
Thank you on right of Ethiopia one has established dedicated responding as with Cameroon, Sierra Leone, and others up. We also the gap in the central area, and they call things for health security teams that are ready and double the 10-step teams that are ready and double the 10-step up, and also in Eastern borders of team the mini helping WPA. We have the global AMT hub. And
committee ready to adopt the priority interventions and the actions proposed in document AFRC 76/8 titled Regional Framework on Emergency Medical Teams 2026 to 2030. I see no objection. It is so decided.
Distinguished colleagues, let us now continue with Framework for Polio Transition and Sustainability in WHO African Region, 2026 up to 2035. Please refer to document AFR RC 769. I give the floor to Dr. Mohammed Gedi, polio coordinator, to present the document. Dr. Gedi, you have the floor. You have 10 minutes and you have the floor.
Thank you, Chair, honorable ministers, distinguished delegates. On behalf of the Secretariat, I have the privilege to introduce document AFR/RC76/9, agenda item 13, titled Framework of Polio Transition and Sustainability in the WHO Africa Region 2026 to 2035. The purpose of this framework is to provide a roadmap to safeguard polio eradication gains while strengthening national health systems and ensuring the long-term sustainability of essential polio functions. Next slide. The African region achieved a historic milestone in 2020 with its certification as a free of indigenous wild polio virus. 2 years later, in 2022, the importation of a new wild polio virus outbreak into Malawi and Mozambique, genetically linked to Pakistan, demonstrates that we are all at risk of polio as long as polio exists anywhere. Thanks to a swift and well-coordinated multi-country response then, and after vaccinating over 30 million children, the outbreak was halted promptly. Even though we officially closed 5 variant outbreaks in the last few weeks, including in Burundi, the Republic of Congo, in Guinea-Bissau, in Ghana, as well as in Uganda, circulating variant polioviruses continue to pose a threat. This framework also aligns with the global guidance, including the Polio Transition Strategic Framework and its global vision, the Sustaining Polio-Free World Strategy, and the GPI Polio Eradication Strategy. Next slide. The region continues to face a number of challenges that threaten the sustainability of polio eradication gains. These challenges include low immunization coverage, with 2/3 of the member states of the African region achieving below 90% of the required DPT3 coverage, and also existence of significant subnational disparities. There are also other challenges, including frequent outbreaks of variant polioviruses, despite declining external financing that hasn't been matched by an increase in domestic resources. Health disruptions as a result of insecurity, climate-related emergencies, and population displacement also remains a challenge in our region. And finally, vaccine supply constraints, cold chain issues, as well as workforce shortages is also a challenge. Next slide. The framework, therefore, outlines 9 priority intervention areas to guide member states through the transition and sustainability process. These include continued implementation of the polio eradication strategy, transition planning and governance, integration of polio assets into health systems, financing and resource mobilization, sustaining polio population immunity, as well as surveillance and outbreak response. Polio containment, community engagement, and civil society involvement, as well as monitoring, evaluation, and learning is also other priority areas. Of particular importance, the framework places strong emphasis on country ownership and leadership, recognizing that transition must be nationally driven and aligned with broader health priorities. It also highlights the need to institutionalize and integrate polio assets including workforce, surveillance system, laboratories, emergency response capacities, digital innovations, so that decades of investment continue to benefit broader health programs. Given the evolving financial landscape, the framework further stresses the importance of sustainable financing and resource mobilization to safeguard essential polio functions and reduce dependence on external resources. Finally, maintaining a sustained high population immunity, robust surveillance system, and strong outbreak preparedness and response is fundamental to protecting the region's polio-free status and strengthening overall health security. Next slide. In summary, this framework aims at preserving decades of investment and leveraging these assets to strengthen resilient, integrated, and sustainable health systems. The proposed actions are practical, they are country-led, and are aligned with the realities and priorities of the member states in the African region. This document is submitted to the Regional Committee for adoption. Thank you very much.
Thank you very much, Dr. Gedi. I now open the floor for member states' intervention. Gambia, followed by Burkina Faso. Gambia, you have the floor.
Just a minute, please. Chair, the Republic of the Gambia thanks the Secretariat for presenting the proposed framework for polio transition and sustainment in the WHO Afro region, 2026 to 2035. We commend WHO, the Global Polio Eradication Initiative, partners, health workers, and communities across Africa for their steadfast commitment to polio eradication, culminating in the certification of the African region as free of indigenous wild polio virus in 2020. The Gambia strongly supports the framework's focus on country ownership, integration of polio assets into national health systems, sustainable domestic financing, strengthened surveillance, and community engagement. These investments are essential for preserving polio-free status while advancing broader health security and resilient objectives. Nationally, the Gambia has strengthened routine immunization, acute flaccid paralysis surveillance, integrated disease surveillance and response, and community-based surveillance systems. The infrastructure, workforce, laboratory capacity, digital platforms, and operational expertise developed through polio eradication initiatives continue to support outbreak detection and response, routine immunization services, maternal and child programs, and emergency preparedness efforts. The Gambia welcomes the framework's emphasis on transitioning polio-funded assets, including human resources, surveillance networks, laboratories, emergency response capacities, and digital systems into national health systems. As regional polio funding declines, sustainable domestic investment, innovative financing mechanisms, and strong partnerships will be critical. In conclusion, the Gambia fully supports adoption of the framework and reaffirms its commitment to sustaining the legacy of polio eradication, strengthening health systems, and ensuring that these valuable public health assets continue to benefit future generations. Thank you.
Thank you, Zagambia. Burkina Faso, followed by Lesotho.
Thank you, Madam Chair. Delegation.
Burkina Faso thanks the Secretariat for this framework, and we agree that we should strive for a region that is free of polio. Certifying the African region as poliovirus free, that is wild poliovirus, is an historic landmark, but the fact that circulating vaccine-derived polioviruses continue to circulate is something that requires our attention. Therefore, Burkina Faso was declared free from the wild poliovirus in 2015. And the fight against polio remains a national priority. But I must admit that in 2025 we did detect type 2 in 2025. We have therefore aimed to scale up our efforts. This includes ensuring that millions of children are vaccinated, including in far-flung regions. In 2025, vaccine coverage achieved almost 95% for type 3 and 89.9% for the second dose of VPI. We welcome the guidelines that came out of WHA 79, namely the need to protect the immunity levels of the population. Burkina Faso supports the adoption of this framework and notes that progressive transition and adaptation to national realities is very important in order for us to safeguard progress made. Thank you.
Merci beaucoup, Burkina Faso. Lesotho, followed by Car.
Thank you very much, Chair. The Kingdom of Lesotho welcomes the framework for polio transmission and sustainability in our region. We remain encouraged by our polio-free status held since 2005 and alongside the rest of the African region by the historic certification as free of indigenous wild polio virus in 2020. However, we recognize that the achievement remains fragile. As a country faced with high level of cross-border movement and continued detections of circulating vaccine-derived poliovirus elsewhere on the continent, Lesotho remains at real and continuing risk of poliovirus importation. Dual-track polio surveillance system built on acute flaccid paralysis surveillance remains our stronghold, further complemented by our environmental surveillance. Non-polio AFP detection has stayed above threshold for 5 years. A recent joint review confirmed system functionality but identified gaps now being addressed. The government of Lesotho continues to treat polio eradication not as a completed task, but as a standing public health priority requiring sustained vigilance, financing, and technical support. Polio-related activities are implemented within the primary health care and assets are maintained within the EPI. This increases chances of smooth and timely transition of assets and sustaining essential polio functions as proposed by the framework. As I conclude, I wish to extend our gratitude to WHO, UNICEF, and the Global Polio Eradication Initiative for the technical guidance extended to Lesotho in this area. We reaffirm our commitment to closing the surveillance sensitivity gaps as identified. I thank you.
Thank you, Lesotho. Car, followed by Zambia.
Merci beaucoup.
Thank you, Madam Chair. Regional Director, CAR congratulates the Secretariat for this framework. Certification as virus-free in 2020 is a historic step, but the fact that CVDPVs remain is a source of concern because immunity levels are weak and many areas are hard to access. This requires a high-level response and surveillance. The CAR would like to highlight the role of national teams in the transition. We are calling for a census of human resources to be done, stock taking of human resources. In this way, we'll be able to ensure that we safeguard institutional learning and knowledge. For this purpose, we need data, and we need to ensure that community clinics and hospitals have what they need in terms of equipment. We would appreciate the support of the WHO and member states going forward, especially in order to achieve the key dates set out. We also call for increased cross-border cooperation and regional solidarity. This is vital because this virus does not know borders. The CAR recommits to fully contributing to the implementation of this framework. Thank you.
Merci beaucoup, Car. Zambia, followed by Mozambique.
Thank you, Madam Chairperson, honorable ministers and distinguished delegates. Zambia supports the adoption of the framework for polio transition and sustainability in the WHO Africa region 2026 to 2035. We commend the regional director and the secretariat for providing a strategic roadmap that seamlessly aligns regional priorities with the global strategy for sustaining a polio-free world. The polio eradication program in Zambia stands ready to actualize this regional framework into concrete, sustainable actions as follows: sustaining high population immunity to mitigate the threat of circulating vaccine-derived polioviruses. Zambia is strengthening routine immunization while executing high-quality supplementary vaccination campaigns to reach zero-dose children and under-immunized populations. Number two, systems integration and surveillance. In line with the framework's core pillars, Zambia is mainstreaming AFP and environmental surveillance into our integrated disease surveillance and response system. We have dedicated program human resources, laboratory networks, digital platforms that have been embedded in our PHC strategy to reinforce broader health security. Number three, country ownership and sustainable financing. Zambia recognizes that long-term sustainability is only attainable when this transition is government-led. Zambia will therefore align this transition framework into our national immunization strategy, as well as health sector financing mechanisms to safeguard the gains and resilience beyond the transitional GPEI support. Given the ongoing challenges of population mobility and cross-border vulnerabilities, humanitarian dynamics across sub-regions, Zambia recommends the critical need for synchronized cross-border surveillance, joint outbreak response capabilities, and continued technical support from WHO and regional partners. In conclusion, Zambia reaffirms its commitment to the adoption and implementation of this framework and stands ready to collaborate with member states to secure a healthy, resilient, and polio-free Africa. Thank you.
Thank you, Zambia. Mozambique, followed by Guinea.
Muito obrigada.
Thank you very much, Madam Chair. Thank you for giving me the floor. Mozambique welcomes the report. We congratulate the Secretariat for the framework. Our country is very busy. We have a strategy for the strategic vaccination of communities against WPV, but also AFP. We are in a transition phase. We are aiming to speed up our implementation of our policies and programs. We also want to involve stakeholders as much as possible. At the same time, we are going to be integrating vaccination efforts into vertical programs. This includes increasing technical expertise on the ground. We'll be working with partners in this particular aspect. We also want to ensure that we have management systems and information systems in place. We recommend the adoption of this framework, and we call for increased coordination amongst member states in order to safeguard our gains. Thank you very much.
Obrigado. Obrigada. Guinea, followed by Cameroon.
Transition priority countries in this region. We speak on this item not as observers, but as one of the countries whose systems this framework is written to protect. Kenya supports the framework for polio transition and sustainability in the African region and supports adoption of the actions proposed. Our position is clear. Polio transition must be a transition to sustainability, not a transition away from responsibility. Kenya has strengthened acute flaccid paralysis and environmental surveillance and has advanced our poliovirus containment obligations. We remain vigilant, but vigilance has a cost, and that cost is the subject of this framework. Kenya's approach is therefore to institutionalize, not to inherit, the assets built by the polio program, surveillance, laboratories, data systems, emergency response, community engagement, and above all, a skilled workforce are being progressively integrated into our national vaccines and immunization program, into integrated disease surveillance, into emergency preparedness, and into primary healthcare. Chairperson, Kenya has asked first to member states to strengthen domestic ownership and financing. We support the establishment of dedicated national budget lines for integrated surveillance. Secondly, we ask the GPEI and development partners to provide predictable transitional financing and ensure support strengthened national system rather than sustaining parallel structures. That to WHO and regional office to strengthen cross-border surveillance, information sharing, laboratory networks, and coordinated outbreak response, particularly for countries at high risk of backsliding. Poliovirus does not respect borders, and neither can our surveillance. Finally, population immunity must remain at the center of transition. We must use the program's proven capacity to reach 0 dose and other immunized children, particularly in pastoralist, mobile, border, and hard-to-reach communities. Kenya stands ready to work with member states, WHO, and partners for a responsible country-owned transition. Our objective is clear: a world free of polio, with the systems and capacities to ensure that polio never returns. I thank you.
Thank you, Kenya. Cameroon, followed by Guinea.
Madam Chairperson, Cameroon takes note of the progress made in the fight against polio. For the framework for polio transition and sustainability in the WHO African region, we consider that polio is a major public health concern in our region, particularly because of the circulating vaccine-derived poliovirus. It is a priority for our countries. Cameroon today has 15 months since the last detection of wild polio virus throughout the country. This result, thanks to the field teams and the constant support of our partners, should not let us lower our guard. There are still several challenges. The insecurity and inaccessibility in some zones, lack of routine immunization, and then cross-border transmission and efforts in vaccination campaigns. We want to increase preventive and response immunization campaigns using IPV, including IPV and Exala in the health system in line with 2030 guidelines. We are committed to eradicating polio and having an equitable and sustainable coverage for all children, including those who are in humanitarian settings. Thank you. Thank you, Cameroon.
Merci.
Thank you, Madam Chairperson. Guinea, commends and fully supports the framework for polio transition and sustainability in the WHO African region 2026-2035. Certification for a status of having no polio is something that we all strive for. This transition, particularly in West Africa, demands more vigilance and sustained commitment. Guinea organized 2 vaccination campaigns and launched a national awareness campaign to strengthen collective immunity and promote routine immunization. As part of our reforms, we would like to sustainably integrate this gains in the EPI, epidemiological surveillance, laboratories, and emergency management so that we have progress in our health systems for future generations. Our priority is a progressive transition that is successful, that will preserve the gains while consolidating our national capacities. We call the World Health Organization and partners. We call upon them to ensure that the transition is based on the risks and realities of each countries where you have a drastic drop in external funding, and this is affecting the operations. And yet we need continued and sustained action towards response. Thank you, Guinea. Ghana.
Chair, thanks so much for the opportunity to make a statement under Agenda 13. Ghana commends the Regional Director and the Secretariat for the development of a framework for polio transition and sustainability in the WHO African region 2026 to 2035. Ghana welcomes the framework and supports the objective of sustaining the regional polio-free status whilst ensuring that the valuable assets, capacities, and investment developed through the polio programs are effectively integrated into the broader national health systems. Madam Chair, Africa's certification as free of wild polio virus remains a major public health achievement. However, sustaining this progress requires continued vigilance and sustained investment in essential capacities, immunization, disease surveillance, and outbreak preparedness and response. Ghana, therefore, recognizes the importance of well-managed, sustainable transition that preserves the gain of polio eradication program and ensures that its infrastructure and expertise continue to support broader health priorities. The integration of these assets into routine immunization, surveillance, and primary health care systems will be critical to promoting and protecting the progress already achieved. We also underscore the importance of country ownership and sustainable domestic financing in ensuring that the transition does not result in gaps in essential public health functions. Continued technical and financial support from WHO and partners will equally be necessary to support member states through this transition. Ghana supports the framework and remains committed to working with WHO, member states, and partners to sustain our polio-free status, strengthen immunization and surveillance systems, and ensure that the gains of polio eradication continue to contribute to stronger and more resilient health systems across the African region. Thank you.
Thank you, Ghana. Namibia, followed by Ethiopia.
Thank you, Chair. Namibia welcomes this crucial framework. After nearly 20 years of being polio-free, Namibia declared an outbreak of circulating vaccine-derived poliovirus type 2 in April 2026. Following its detection through environmental surveillance, Namibia immediately launched nationwide NOPV2 immunization campaigns and synchronized efforts with Angola, Botswana, the DRC, and Zambia. Despite these efforts, we share the concerns raised in the report regarding the decline in global funding and the risk of diminished institutional capacity built over decades. Thus, as member states, we must integrate polio surveillance and routine immunization into our domestically financed primary health care systems, taking sovereign ownership of our health security. To better support member states, Namibia urges Secretariat to help member states establish robust, decentralized, in-country diagnostic laboratories, ensuring rapid genomic sequencing without waiting weeks for regional reference lab results. To this end, we request the Secretariat to include a mapping of member states' in-country diagnostic and genomic sequencing capacities within the framework's reporting matrix. Tracking this data is vital to identify critical infrastructure gaps, monitor our collective progress toward decentralized testing in-country, which is essential for rapid outbreak response. In closing, Namibia calls on Secretariat to advocate for an integrated disease intelligence grid, where polio funding and wastewater sampling capacities simultaneously strengthen the detection of other pathogens like measles and cholera through the IDSR system. Furthermore, we request Secretariat to include progress on this integration as a specific indicator in its reporting metrics. I thank you.
Thank you, Namibia. Ethiopia followed by Senegal.
Thank you, Madam Chair. Ethiopia welcomes the Framework for Polio, Transition and Sustainability in the WHO Africa Region 2026-2035 and aligns its implementation with the Immunization Agenda 2030, the Polio Transition Strategic Framework, and national health sector priorities. Ethiopia supports the framework's emphasis on country ownership and integration of polio assets into the national system, sustainable financing, and accountability. Although Ethiopia has remained free of indigenous wild polio virus for more than a decade, the continued risk of circulating vaccine-derived polio virus highlights the need to sustain high population immunity, sensitive surveillance systems, and rapid outbreak response capacities. Our roadmap for 2026-2035 focuses on institutionalizing essential polio functions within the primary healthcare system. Immunization services are integrated through the Health Extension Program and with targeted strategies to reach zero-dose under-immunized, displaced, and mobile populations. At the same time, Ethiopia is strengthening polio-funded workforce, surveillance platforms, laboratory networks, and data system into the national structure to preserve critical public health capacities. We are strengthening integrated acute flaccid paralysis and environmental surveillance, enhancing preparedness for outbreak response, and progressively increasing domestic investment in immunization and surveillance while maintaining our co-financing commitments. Ethiopia reaffirms its commitment to a polio-free Africa and calls for continued collaboration among member states, WHO, Gavi, UNICEF, and partners, particularly to strengthen cross-border surveillance, laboratory capacity, and transition financing, ensuring that the gains of polio eradication continues to strengthen resilient health system across the region. Thank you.
Thank you, Ethiopia. Senegal followed by Congo.
Merci.
Thank you, Madam Chairperson. Honorable Ministers, Regional Director, distinguished delegate, Senegal would like to congratulate the Secretariat for developing this framework and commends the Africa region for the progress made in eliminating polio. This framework would like to safeguard the gains made under the GPEI. Senegal has made some progress through improved polio surveillance, improvement of response strategies to outbreaks, and improved capacities within the polio program in the public health sector. However, the constant outbreaks of CVD-PV and the lack of external funding and the importance of having preparedness and response systems remain key challenges. Senegal considers that transition would be successful if you have these four pillars: leadership, the sustainable integration of polio initiatives in the national system, domestic resource mobilization, and the maintenance of immunization and environmental surveillance. We want to put in place a transition plan to ensure that we keep the assets inherited from programs. Madam Chairperson, Senegal reaffirms its commitment to ensure that Africa remains free of polio and supports the measures presented in the framework. Thank you. Thank you, Senegal. Congo.
Madame la Présidente,
Madam Chairperson, the Republic of Congo commends the framework for polio transition and sustainability in the WHO African region 2026-2035. Our country in 2010 had a major outbreak of polio with WPV type 1. We have last case was on 11th January 2011. So for over 15 years, we've not had wild poliovirus cases. This result is is thanks to routine immunization and the second dose of IPV in April 2025. In 2025, we attained 80% of OPV and IPV immunization. We have indicators that are higher than the regional standards. However, our gains are fragile because we still have zero dose children and the CVDPV. Congo wants to strengthen immunization, surveillance, and response. We would like continued regional support that is tailored to our needs so that we can preserve the gains and so that we guarantee an Africa that is free of polio. Thank you.
By Madagascar. Malawi remains firmly on track in implementing the framework for polio transition. Following the successful closure of the 2022-2024 World Polio Virus outbreak, the government launched a country-led polio transition plan in May 2024 after the withdrawal of JPA funding. Since then, the Ministry of Health and Sanitation has ensured the uninterrupted continuation of all essential polio functions, including immunization, surveillance, laboratory services, and emergency preparedness and response system. And through strong national leadership, Malawi has successfully integrated these critical functions into the broader health system. The Ministry of Health through the EPI and FIM have progressively assumed the leadership of polio essential functions, with polio technical working groups subcommittees oriented and providing oversight support. All polio assets, including surge staff, logistics, digital tools, laboratory capacity, were mapped for structured absorption into the national system. These capacities were critical in January 2026 when enhanced environmental surveillance detected a polio 2 outbreak. Malawi responded decisively within 24 hours, implemented a round zero campaign within 14 days, and conducted 4 additional high-quality rounds, reaching over 7 million children. The government of Malawi acknowledges the immense financial support we got from JPA partners. In line with regional polio transition milestone, routine immunization remains strong, with the 2025 WHO UNICEF estimates for immunization coverage showing high coverage, with BCG at 98%, DTP1 at 94%, and IPV1 at 94%, confirming a resilient routine immunization system. As we work to sustain these gains, Malawi prioritizes include maintaining high OPV, IPV coverage. Thank you, Chair.
Thank you, Malawi. Madagascar.
Madam Chairperson, Honorable Ministers, distinguished delegates, the delegation of Madagascar thanks the Secretariat for the quality of the report, and we support the framework for polio transition and sustainability in the WHO African Region 2026-2035. The certification of Africa's being free of WPV is historical. However, the presence of CVDPV reminds us of the need for remaining vigilant. In Madagascar, transition is really important because we are a priority country and we need to consolidate our gains as well as strengthen our national capacities. The current situation that is characterized by immunization coverage that is insufficient and the notification of CVDPV cases since April 26 push us to stepping up our efforts to target zero dose and under immunized children in the 5 regions in the southern part of Madagascar. We are going to have due rounds of immunization at the end of the year. We want to have active surveillance, and 2030 to 2035 we'll have sustainability, and we will have increased resources as well as more partners. We are calling upon all our technical and financial partners to continue with their support so that we continue with the transition and so that we sustainably increase national capacities. We want an Africa that is free of polio, so we transform the gains in this fight. Thank you.
Sierra Leone.
Thank you very much, Madam Chairperson. The delegation of Angola would like to thank the Secretariat for presenting the framework for polio transition and sustainability in the WHO African region 2026-2035 and manifests its support for the adoption of this document. Angola recognizes the historic importance of the certification of its country as being free of polio as historical, and demonstrates the importance of improving response capacity in the case of emergencies. We continue doing so, particularly with regard to CVDPV, through the organization of immunization campaigns and the use and involvement of the community members. The country has ensured that polio is included in the essential health package. Angola insists on the importance of data quality, the availability of digital platforms to record vaccine stocks, as well as the mapping of communities at risk and zero-dose children. The delegation of Angola calls upon the WHO and for technical support so that it strengthens its capacity in the area of surveillance and environmental surveillance. Angola supports the framework for polio transition and hopes that we will have an Africa that is free of polio. Thank you.
Obrigada. Sierra Leone, followed by Mauritania.
Thank you, Madam Chair. On behalf of the Honorable Minister, Sierra Leone is pleased to endorse the adoption of the framework for polio transition and sustainability. We recognize this framework as very critical to ensuring that our collective gains achieved through global polio eradication efforts are sustained. Sierra Leone is well aligned with the key guiding principles of the framework of country ownership and leadership, flexibility and contextual adaptation, gender equity and rights, transparency and accountability, and strong collaboration and integration across health programs. Sierra Leone is advancing along a strong and sustainable polio transition pathway. The country's 2025 unique immunization coverage of over 90% for both IPV1 and DPT3 demonstrates that the country is maintaining high and stable population immunity, one of the most critical benchmarks for long-term polio risk reduction. These achievements are anchored in the huge strength of the national immunization program that continues to provide reliable routine immunization services nationwide. Sierra Leone's AFP surveillance, expanding environmental surveillance, and well-functioning IDSR systems ensure that poliovirus detection remains sensitive, timely, and fully integrated into the broader national health security framework. This progress is also reinforced by the strong leadership of the Ministry of Health and the coordination capacity of the National Public Health Agency, which has become central to sustaining essential polio functions, outbreak preparedness, and rapid response capabilities. The combined elements of high immunization coverage, strong surveillance systems, and increasingly resilient public health structures demonstrates that Sierra Leone is not only maintaining its polio-free status, but is also building the long-term systems required for post-certification sustainability. We therefore fully support and endorse the framework and appeal for continued regional collaboration and sustainable financing to ensure that the hard-won gains against polio are sustained for future generations. Thank you.
Thank you. Mauritania.
Thank you, Madam Chairperson. Mauritania. Thanks the Secretariat of the WHO, AFRO, for developing this framework and agrees with preserving the assets. We are happy with the progress made, and we have been trying to strengthen our laboratory capacity and having catch-up vaccination campaigns and other immunization campaigns. We have been faced with WPV 3 in 2 regions. We had 2 national campaigns in 2022, and we then put in place environmental surveillance. We have not detected any new cases since 2023. On the 1st of January 2025, we introduced Exavolar. We want to have extension of environmental surveillance throughout the country. For the next years, our country will strengthen systematic vaccination, reduce the number of children that are not vaccinated, and keep monitoring AFP and ensure that our laboratory capacities are sustained. We ensure our commitment to ensuring that the country remains free of polio. Thank you, and we support the framework too.
Thank you. Mali, followed by Togo.
Madam Chairperson, thank you. Mali would like to congratulate the Secretariat for the quality of the report. We are faced with outbreaks of CVDPV, although we are free from WPV. We feel that we should focus on strengthening routine immunization, surveillance for AFP, environmental surveillance, the organization of immunization days. Despite the insecurity that we face, progress has been made to reduce the number of CVDPV cases, and there's improved surveillance for AFP. In 2026, there were 2 CVDPV cases detected, one in January 2026 and the second in June 2026. Given these cases, we did some mop-up exercises, and the results were satisfactory. We support the framework for polio transition and sustainability in the WHO African region 2026-2035. Mali would like to invite the regional committee to adopt the report. Thank you.
Merci. Togo, followed by Guinea-Bissau.
Merci, Madame.
Thank you, Madam Chair. We would like to thank the Secretariat for the support given, and we congratulate them for the framework for polio transition and sustainability in the African region. Togo has had cases of WPV, but when it comes to CVDPVs, we have seen those cases too, especially in border zones, border areas. Therefore, we need to strengthen national campaigns for vaccination, which we have done, and we have vaccinated at least 1 million children. We must not take our eyes off the prize. That is, we must not lose the progress that we've made. And so, in order to safeguard gains, we have targeted zero-dose children. We have maintained our surveillance levels, especially regarding AFP, and we've also ensured that the government is on top of the situation. We welcome this framework, and we would like to see more South-South cooperation so that we can pool our regional surveillance capacities. We recommit to an Africa free of polio. Thank you very much.
Merci. Guinea-Bissau, followed by Chad.
Guinea-Bissau fully supports the framework for polio transition and sustainability in the WHO African region 2026-2035. We achieved certification free of poliovirus, that is WPV, in 2019. In 2026, we confirmed that we had ended the transition period regarding type 2. We do note the importance of maintained surveillance. We also need to make sure that we maintain our response capacity. We reaffirm our commitment to the transition, a transition which is sustainable in the national healthcare system. And we also understand the importance of regional cooperation so that we can preserve the gains that we have achieved. And we can build an Africa which is definitively free of poliovirus by 2030. Thank you very much.
Obrigada, Chad.
Madam Chair, Chad would like to thank the Secretariat for the document on the framework for polio transition and sustainability in the WHO African region 2026-2035. We support its adoption. We are a priority country. That has been the case since 2017. Chad is still facing active circulation of CVDPVs, and the context is one of movement of populations and a lack of security. But also, given the fact that many regions are very remote, we depend on the support of our technical partners and the WHO. The President himself has declared himself to be the champion of the eradication of polio, and we will soon be holding a special ceremony in this regard. Chad would like to focus on a couple of priorities. For example, the transition needs to be progressive. It must adapt to the epidemiological situation of every country. In this way, we can preserve the gains related to surveillance. And then secondly, we would like to see continued technical support from the WHO and member states and other partners, especially when it comes to surveillance, outbreak response, and human resources, not to mention digital tools. Thirdly, Chad also prioritizes the increase in cross-border cooperation in the Lake Chad Basin. In this way, we can better combat localized outbreaks. Finally, we would appreciate the support of the WHO in order to update our national transition plan, and we would like to be able to strengthen our surveillance capacity. Thank you.
See, Chad. Thank you, distinguished delegates. Since I don't see any other requests for the floor from member states. Okay. S'il vous plaît, excuse me. South Sudan, followed by South Africa.
Thank you, Chair. South Sudan remains committed to sustaining the gains achieved through polio eradication investments by integrating essential functions into national health systems and strengthening domestic ownership. Continued collaboration with WHO, UNICEF, GPEI partners, donors, and development partners will be critical to ensure a sustainable transition and maintain essential public health capacities. South Sudan reaffirms its strong commitment to sustaining and institutionalizing the gains achieved through decades of polio eradication in investments. And the country is dedicated to integrating critical polio assets, capacities, functions into the national health system, while strengthening government leadership, ownership, and accountability to ensure long-term sustainability. Moving forward, continued strategic collaboration with WHO, UNICEF, and GPI partners, donors, and other development partners will be essential to support successful transition, safeguard hard-won achievements, and maintain resilient public health capacities that contribute to broader health security and improve health outcomes for all communities. I thank you.
Thank you. South Africa.
Chairperson, South Africa aligns itself with the Framework for Polio Transition and Sustainability 2026 to 2035. Our region has made historic strides, but recent events remind us that a polio-free status is fragile. Following regional importations and neighboring outbreaks, our national risk assessment initially underestimated our exposure, a miscalculation others must avoid. Recently, the detection of vaccine-derived poliovirus type 3 and NOPV2 through environmental surveillance triggered the immediate activation of our National Polio Outbreak Preparedness and Response Plan, backed up by our National Institute for Communicable Diseases and a dedicated vaccine-preventable diseases incident management team. However, we face critical vulnerabilities. Firstly, subnational surveillance gaps persist, with 3 provinces missing acute flaccid paralysis targets and stool adequacy dropping to 78.7%. Secondly, routine immunization challenges remain alongside regulatory hurdles such as oral polio vaccines currently lacking registration locally, which constrain rapid response flexibility. Third, DPT-3 coverage nationally stalled at 69.9%, with no province hitting the 80% benchmark. To secure our gains, South Africa urgently calls on the WHO for enhanced technical support in strengthening cross-border surveillance, laboratory networks, and environmental monitoring. We also urge robust backing for the polio transition framework to seamlessly institutionalize vital assets into our primary healthcare systems. Regional solidarity is not optional. Our collective health is interdependent. South Africa remains fully committed to safeguarding a polio-free Africa. I thank you.
Thank you. Since I don't see any other requests for the floor by member states, okay. Somali.
Thank you, Madam Chair. Somalia appreciates the opportunity to participate in these important discussions and commends WHO Afro region for developing this timely framework for polio transition and sustainability. Somalia remains free of world polio virus and is now in the verge of interrupting transmission of the circulating vaccine-derived polio virus type 2. We have already integrated polio into our national immunization program and routine immunization services. As we move towards sustainability, our priority is to institutionalize and protect the critical assets built through the polio program, including surveillance systems, laboratory networks, digital platforms, and skilled health workers within our national systems. As a GBEI funding is declining, we must ensure predictable domestic financing while maintaining strategic partner support to sustain essential polio function. Finally, Somalia calls for a strong collaboration between WHO, African and East Mediterranean region to enhance cross-border coordination in the Horn of Africa, including synchronized immunization campaigns, integrated surveillance, timely data sharing, and coordinated outbreak preparedness and response to prevent cross-border transmission. I thank you, Madam Chair.
Thank you. Since we have already opened the floor for non-member states, the floor is now open for other member states from the other regions. UN agencies, other IGOs, you may raise your nameplate, please. I remind you that you have 1 minute. UNICEF.
Yeah, thank you, Madam Chair. Excellencies, UNICEF commends member states, the GPEI, and partners for the historic achievement of certifying Africa free of indigenous wild poliovirus in 2020. However, the 2022 importation of variant poliovirus into 2 countries reminded us that these gains remain vulnerable. Polio transmission is therefore a defining test of whether we can convert eradication assets into resilient, country-owned health systems. The transmission must therefore be sequenced, financed, and managed as health system reform, not simply a handover. Our priority is to protect essential polio functions, which is high population immunity, surveillance, rapid response, and community engagement, while strengthening routine immunization and closing the zero-dose gap. Polio assets must be deliberately integrated into primary health care with clear accountability and sustainable financing. UNICEF fully supports the framework for polio transition and sustainability and renews its commitments to working with member states, WHO, Gavi, Africa CDC, and the entire GPEI and other partners to ensure every child, wherever they live, is protected not only from polio, but all vaccine-preventable diseases. Thank you.
Thank you. I understand that several non-state actors want to request, and they want to deliver statements, so I now invite you to do so. Rotary International, followed by World Federation of Neurology.
Thank you, Chair, Regional Director, distinguished delegates. On behalf of Rotary International and the Global Polio Eradication Initiative's Polio Oversight Board, I welcome the framework before you. The success of this framework is critical for preserving a polio-free Africa and for advancing WHO's goal of better protecting people from health emergencies. For decades, polio eradication investments have built surveillance systems, laboratory networks, emergency operations capacity, and a skilled public health workforce supporting countries in detecting and responding to a wide range of disease outbreaks and other health threats. As polio resources evolve, we must work together, ensuring these assets are sustained and continue to be integrated into national health systems. Doing so will strengthen preparedness, improve resilience, and help protect over 1 billion people across Africa from future health emergencies. Doing so will be an historic achievement. Thank you.
Thank you, Rotary. World Federation of Neurology, followed by International Federation of Medical Students Association. You have the floor.
Thank you, Chair.
The World Federation of Neurology is highly supportive of the framework for polio transition and sustainability in the WHO Africa region and calls on member states to prioritize transition and sustaining measures. Insufficient action can lead to a rise in long-term neurological disability burden. The WFN highlights that health personnel with neurological training are critical for accurately identifying and reporting acute flaccid paralysis, therefore ensuring timely detection of any polio outbreaks, including vaccine-derived cases. We maintain that healthcare systems should be fortified with neurological services and trained personnel while highlighting the importance of sustainability of essential polio functions. We urge all member states to prioritize efforts in line with the WHO recommendations for the framework for polio transition and sustainability so that the African region can remain free from polio. Thank you.
Honorable Chair, Your Excellencies, Africa's wild polio-free certification was historic, but transition must not become a retreat. In 2025 alone, 279 poliovirus detections were reported across 19 countries, with over 60% concentrated in the Lake Chad Basin and West Africa. We, as the IFMSA, representing over 133 NMOs and over 1.5 million students across the world, support the adoption of the framework and urge member states to protect polio essential functions through dedicated domestic budget lines for immunization, integrated surveillance, and rapid outbreak response. We emphasize the deliberate absorption of polio-funded workforce, laboratories, digital platforms into national health systems, while prioritizing zero-dose, displaced, and hard-to-reach children through tailored community engagement. Health professionals can strengthen vaccine confidence and community surveillance when meaningfully integrated into national efforts. The polio transition must preserve the system's trust and capacity that made eradication possible. I thank you, Chair.
Thank you. I see no more requests for the floor. Are there any comments from the Secretariat?
Thank you, Madam Chair. Thank you, member states. 27 member states have intervened, reaffirming support for the priority interventions. The Secretariat has taken note of your guidance, and especially the emphasis on integration, strengthening routine immunization and surveillance, including expansion of diagnostic and genomic capacity within the continent, robust outbreak preparedness, and strong cross-border collaboration, including with the Horn of Africa countries in the Emerald region, all through a government-led and sustainable system. Thank you, Madam Chair.
Thank you. The Secretariat has taken note of the comments raised, and is the Regional Committee ready to adopt priority interventions and the actions proposed in document AFR RC 769, titled Framework for Polio Transition and Sustainability in WHO African Region, 2026 to 2035? I see no objection, so it is decided. Excellencies, we will now continue with agenda item 14, Framework for Implementation of the International Health Regulation Amendment in the WHO African region under Goal 3, Protect Health. Please refer to document AFR RC 7610. I pass the floor to Dr. Maria Rosley, Regional Emergency Director, to present the document. Dr. Blazer, you have 10 minutes, and over to you.
Good morning. Honorable Chairperson, thank you for giving the floor. Honorable Ministers, distinguished delegates, colleagues, and partners. So it is my privilege to introduce you agenda item 14, document AFR/RC76/10, which is the framework for the implementation of the International Health Regulation Amendment in the WHO African Region 2026-2030. Next slide. So allow me to begin with some context. So the international health regulations are not new. Their story stretches back to the International Sanitary Regulation of 1951, which were renamed the International Health Regulation in 1969, first amended in the 1970s and 1980, and then comprehensively revised into the IHR of 2005. Further amendment followed, and the latest adopted in 2024, entered into force in September last year. So what does it matter? Because the IHR are the only legally binding framework spanning 196 state parties for managing epidemics and other public health emergencies together. So our goal for this framework is clear, that every African member state fully implement the amended regulations and achieves at least developed capacity across all core capacity. Next slide. The case for action is stark. Our regions carries the world's heaviest emergency burden. 2/3 of all global public health emergencies are reported here in Africa. In 2025 alone, we recorded more than 120 public health emergencies. 2/3 of them were disease outbreaks. Yet our average core capacity sits at a roughly 50%, below the global average and stalled since 2021. Only half of outbreaks were notified within the one-day benchmark. The past year illustrates the stakes: Marburg virus disease in Ethiopia for the first time, and the United Republic of Tanzania. Ebola in Bulape, in the Democratic Republic of the Congo, Rift Valley fever in Senegal and Mauritania, and mpox and cholera remain persistent and increasingly across our borders. Next slide. So where do we stand in the African region, in the Africa continent? The picture is one of strong reporting leadership, but stalled capacity. On the positive side, Africa leads the world on monitoring. We have achieved 100% mandatory state party annual report, we commonly call SPAR, for 8 years consecutively. And 41 of our 47 member states have completed a second round of joint external evaluation. 20 countries ran simulation exercise in 2025, up from then 10 in 2022. But domestication remains uneven. Our average core capacity rose only modestly, from 42% in 2018 to just over 50% in 2025, while the target is 80%, and still the lowest of all WHO regions. So national IHR authorities tell a similar story. Only one existed at the end of 2025, rising to 17 by July 2026, against a target of all 47 state parties. Next slide. So what is new? The 2024 amendment, adopted under Resolution WHA 77.17 and complemented by the Pandemic Agreement of 2025, introduced 4 key elements. First, the National IHR Authority, a central, legally empowered and resource body to coordinate implementation under Article 4. Second, a new definition of pandemic emergency, a higher tier of alert above public health emergency of international concern. And third, reinforce commitment to solidarity and equity, ensuring fairer access to medical countermeasures and mutual support. And fourth, stronger provision on governance and financing, covering sustainable financing, the workforce, and accountability. Next slide. So why does this framework set out to do? What does this framework set to do? In essence, it defines the priority action that member state and regional stakeholders should take to put the 2024 amendment into practice across our region. It pushes 5 aims. 1, to accelerate domestication by translating the amendment into national law, policy, and institutions. 2nd, to establish and empower national IHR authorities as central coordinating bodies. 3rd, to strengthen financing and governance. And 4th, to harmonize our arrangement with the pandemic agreement. And 5, to integrate IHR implementation into national preparedness and response plans. So our ambition by 2030 is that all 14 state parties have a functional national IHR authority and completed legal reviews with at least 80% reaching developed capacity across all core capacities. Next. From this vision, we propose 6 priority interventions. Transform IHR coordination, designate and empower national IHR authorities, and keep national focal person continuously accessible. 2nd, we adjust law and policy, review public health legislation, and harmonize it across the IHR and the pandemic emergency definition. 3rd, invest in core capacities, prioritizing larging areas such as legal, chemical, and radiation capacities, point of entry, workforce, infection prevention and control, and food safety, and also using artificial intelligence for early warning. And 4th, leverage communities, engaging grassroots and faith leaders and equipping community workers to detect and report events. And 5th, invest in the workforce, building an IHR roster of experts and a focal person community of practice. And 6th, secure sustainable financing, mobilizing domestic resources, drawing on the pandemic fund, and engaging the private sector. Next slide. So the regional committee is invited to take 4 actions. First, to adopt the framework, examining the technical paper, and endorsing the proposed action for 2026 to 2030. Second, to endorse a coordinated approach, harmonizing the IHR amendment with the pandemic agreement. Third, to prioritize national IHR authority, establishing and empowering them as central coordinating bodies. And fourth, to commit to sustainable financing, advancing predictable domestic funding of our core capacities. This document, RFR/LC76/10, is submitted to this 76th session for your review and adoption. Thank you.
Thank you, Dr. Belizer. Now I open the floor for member states for your intervention. Ghana, you have the floor.
Thank you, Chair. Ghana thanks you for the opportunity to take the floor under Agenda Item 14. We commend the Regional Director and then the Secretariat for the development of the framework for the implementation of the International Health Regulations Amendments in the WHO African Region 2026 to 2030. Ghana welcomes this timely framework, which provides an important regional approach to supporting member states in translating the amended international health regulations into strengthened national capacities for prevention, preparedness, detection, and response to public health emergencies. Chair, The recent public health emergencies experienced across the region have demonstrated the importance of strong and sustainable capacities for health security. The implementation of the IHR amendments therefore presents an opportunity for member states to strengthen national preparedness and response systems while reinforcing multi-sectoral coordination and ensuring that health security remains firmly anchored within broader health systems strengthening efforts. Ghana recognizes the effective implementation of the framework will require strong national ownership, coordinated action across sectors, and sustained investment in the core capacities required under the international health regulations. Continued technical support, capacity building, and predictable financing will also be essential to enable member states to translate the commitments under the amended regulations into concrete and sustainable actions. Chair, as we consider the framework before us, Ghana supports its review and adoption by this committee. We believe that the proposed framework provides a practical basis for accelerating the implementation of the IHR amendments across the region and strengthening collective preparedness for future public health threats. Thank you, Madam Chair.
Thank you, Ghana. Carr, followed by Guinea.
The Central African Republic thanks the Secretariat for the presentation of the framework for the implementation of IHR amendments in the WHO African region. The framework takes into account the key elements of amendments of RC 74. The results have shown that notification has improved by 60%, 83% in 2025. The National IHR Authority has been designated and the document has been shared with the WHO country office. The drop in funding of the health sector and the management of multiple epidemics and the fear of importation of Ebola virus are challenges for the country. We are using a pan-governmental and approach in the country that is indispensable. The Central African Republic is ready to play its role and work in close collaboration with the WHO office that will help the CAR and other member steps to continue with our share responsibility of ensuring that we are better prepared and better resilient for future crises. Thank you, Madam Chairperson. Ladies and gentlemen, the Republic of Guinea commends the drafting of the framework for the implementation of the IHR amendments in the WHO African region and supports its adoption. We designated the Ministry of Health and Public Hygiene as the line ministry to deal with multi-sectoral coordination. The Agency of National Health Security is the organ that is responsible for preparedness and response for emergencies. The order that was revised was submitted to the relevant authorities. There's a permanent coordination, notification, and a rapid sharing of information. The Public Health Code has been revised and is currently before the National Assembly for discussion and adoption. These efforts are going to set the anchorage for health security and the implementation of the IHR at the operational level. we have a framework for One Health, and we are going to have a simulation exercise with neighboring countries. And we would like support of WHO for legal harmonization and corrective measures after the simulation exercise. WHO and Africa CDC have clarified the public health emergency of international concern and continental concern so that we avoid overlaps. Thank you.
Merci.
Madam Chairperson, adopted at the last sitting, the IHR amendments are important for health security. They provide for the designation of a national IHR or authority and reinforce equity, solidarity, and governance. This revolution is really important for our region that is constantly faced by vulnerabilities due to emergencies, as you've seen with the public health emergency in 2025. Congo has designated a national IHR focal person, and we have the operationalization of PHEOCs. There are challenges, particularly with regard to sustainable financing, multi-sectoral coordination, availability of qualified human resources, and the strengthening of capacities of laboratories for surveillance and response. And this is why the Republic of Congo supports the framework for the implementation for 2026-2030 and urges other member states to also adopt it. We need to mobilize the requisite resources to consolidate the preparedness, surveillance, and response system and strengthen cooperation with the WHO, member states, as well as regional partners. Thank you.
Merci.
Thank you. Madagascar.
Merci, Madame la...
Thank you, Madam Chairperson. Excellencies, ladies and gentlemen, Madagascar would like to thank the Secretariat for the quality of the report presented and supports the adoption of the framework for the implementation of IHR amendments in the WHO African region 2026 to 2030. Our country has already made some progress. We had the JEE in November 2025, and we have continued with operationalizing the One Health approach of using a multi-sectoral platform that is under the authority of the Prime Minister's office for 2026-2030. Madagascar will give special priority to formalizing the national competent authority, the strengthening of the legislative framework, as well as the necessary capacities for staff, to mobilization of communities and multi-sectoral coordination with national sustainable funding that is previsible to ensure that its capacities are supported. We will accord special attention to surveillance of borders and entry points, as well as the preparation for health risks, so that we mitigate cross-border impacts. We reaffirm our commitment to implementing the IHR amendments within the spirit of continental solidarity, so that we have an Africa that is better prepared and more resilient in the face of health emergencies. Thank you. Thank you, Burundi. Thank you, Chairperson. Burundi lauds and supports the framework for the implementation of IHR amendments. It's an important step to strengthen the preparation and response for emergencies. This is part of national and collective responsibility. In this regard, I'd like to share two institutional steps that have been made by the country. Firstly, we have a national directorate of health security to improve governance of health security and ensure prevention, preparedness, and response for emergencies. Secondly, we have institutionalized the One Health. We're almost completing the institutionalization of the One Health platform, which would be essential for health emergencies that come across the borders. These milestones are part of our intention to ensure surveillance and be ready for response to emergencies and health risks. However, no country can manage its health security alone. We have the movement of people across the borders, and this poses a challenge and calls for coordinated responses, the sharing of data and information. We want to domesticate the IHR amendments with in a spirit of solidarity, trust, and shared responsibility. We fully support this regional framework, and we would like to actively contribute to its implementation to ensure that health security is a shared responsibility and a collective reality in Africa. Thank you.
Followed by Senegal.
Thank you, Honorable Chair. Ethiopia welcomes the framework for the implementation of the international health regulation amendments in the African region and supports its adoption. In 2025, the African region recorded over 120 public health emergencies. Despite these persistent threats, average core capacity scores in the region have increased only marginally. Cognizant of this reality, Ethiopia has anchored its health security reform and IHR implementation within the Ethiopian Public Health Institute, which serves as a national focal point and has integrated it with National One Health Coordination and National Public Health Emergency Management System. Following our first National Action Plan for Health Security, a joint external evaluation demonstrated an increase in our core capacity, squared to 61% in 2023. Under our second NAPS, we continue to report annually across all core capacity areas. Having accepted the 2024 amendments, we have begun aligning our domestic frameworks and emphasize four key principles. First, coherence over duplication. We support designating the National IHR Authority as a legally empowered coordinating body, emphasizing that it must strengthen existing structure rather than duplicate them, where a member state possesses a functioning focal point and emergency management flexibility to designate an existing institution with cross-sectional mandate is essential. Second, legal authority must accompany designation. Ethiopia supports reviewing and realigning public health law. We welcome the reference to WHO Interparliamentary Union outcome documents. Third, measurement of progress must account for subnational capacity. While the framework's targets are national, outbreaks begin and detected or missed at the district level. Ethiopia has extended public health emergency management structures to subnational levels and has developed a subnational tracker for core capacities. We offer this as a constructive suggestion and stand ready to share our learning. For the implementation required adequate resourcing. Honorable Chair, Ethiopia remains committed to support the establishment of the National IHR Authority, aligning our legal frameworks and sharing our operational experience. I thank you.
Thank you. Senegal, followed by South Sudan.
Merci.
Madam Chair, Ministers, Regional Director, distinguished delegates, Senegal welcomes the report of the Secretariat on the framework for the implementation of the IHR amendments in the African region 2026-2030. and we welcome the relevance of this framework in the context of climate shocks, health emergencies, and the need to sustainably build national capacity, especially when it comes to preparedness and response. Senegal has faced several health threats in the recent past, such as Rift Valley fever, dengue, and mpox, among others. And this shows how important it is to have a resilient system capable of responding, and it also shows how the One Health approach is beneficial. Senegal has therefore taken actions to strengthen its institutional structuring. This includes bolstering our NIA. We've also invested in surveillance, and out of that came annual reports. That is now the done thing in Senegal. We've also decided to prioritize several areas when it comes to IHR, and these include legal alignment, foreseeable measures, focus on communities, and entry posts. We will continue to depend on international and regional support. Senegal would like to reaffirm its commitment to strengthening regional and international health security. We also support, therefore, the framework, and we call for coordinated solidarity. Thank you.
Merci. South Sudan.
Thank you, Chair, Regional Director, the Honorable Ministers, and distinguished delegates. South Sudan supports adoption of the framework. The amendments are directly relevant to our recurrent outbreaks, cross-border threats, conflicts, flooding, displacement, and access constraints. The National IHR Authority should be legally empowered and multisectoral while building on the Ministry of Health, National Public Health Institute, IHR National Focal Point, and the Public Health Emergency Operations Center. Implementation must be judged by functioning capacities, from community detection and laboratory confirmation to rapid notification, field response, and continuity of essential services. South Sudan will work to designate the National IHR Authority, review national legislations, and integrate the amendments into the national action plans for health security. We request legal support, catalytic financing, cross-border operational assistance for fragile settings. We support equitable implementation, regional solidarity, and proportionate measures that avoid unnecessary disruption to travel and trade. I thank you.
Thank you. Eritrea, followed by Cameroon.
Thank you, Chair. The State of Eritrea commends WHO Regional Office for Africa developing this strategic framework to guide implementation of 2024 amendments to international health regulations. Eritrea particularly welcomes to the emphasis on establishing legally empowered and adequately resourced national IHR authorities and aligning national legislation, policy, and institutional arrangements. Eritrea further commends the prioritization of the One Health approach, multisectoral coordinations, community engagements, emergency workforce development, digital health, strengthening points of entry, and sustainable financing. Eritrea also supports the framework and its whole of government, whole of society, and One Health approach. Over the past years, Eritrea has completed several key HR monitoring and evaluation, including annual state party reporting and its second joint external evaluation in August 2025. Eritrea will give due consideration to the recommendations arising from IHR amendments, including reviewing legal and institutional arrangements. Finally, Eritrea supports the adoption of this framework and calls for continental WHO support to assist member states in translating these regional commitments into measurable and sustainable national capacity. Thank you.
Thank you. Cameroon, followed by Burundi.
Madam Chairperson, Cameroon congratulates the regional director for the quality of this report and would like to support the amendments. This framework, 2026-2030, is an important step in improving our health security and our preparedness for outbreaks. Given our health architecture and these new amendments, we have begun an in-depth reflection on its legal and institutional framework and wants to initiate the process of the creation of a national IHR authority. After its last JEE held in 2025, we would like to improve the technical domain and is progressively aligning itself with the other amendments proposed, including the strengthening of detection capacities at entry points that is critical with the ongoing Ebola virus, the digitization of health certificates and notifications, the strengthening of sustainable funding mechanisms for health security. We really support health multilateralism and we call for strengthened regional collaboration so that countries are not just surveillance actors but equal and equitable partners in international health responses. Thank you.
Followed by Tanzania.
Muito obrigada, Senhora Presidente, da presente sessão da Comitê Regional, pela cedência da palavra. Moçambique saúda o relatório apresentado.
Thank you, Madam Chair, for giving us the floor. We welcome this framework, and we are very glad to see that we are focusing on building national capacity and improving our ability to respond to health emergencies. Our country is continuing to implement the IHR. We intend to undertake a national evaluation from a legal point of view so that we can identify legal gaps. And this is following on from progress made in 2024. We are also building capacity in order to increase surveillance at borders, border posts. We have multi-sectoral teams, we have contingency plans, and we also intend to undertake JEEs. When it comes to early warning systems, this is also a priority. We're also looking at biosecurity, biosafety, food safety. So you can see that it is a multi-sectoral approach based on the One Health approach as well. All of this entails a large effort, and it is being pursued on a national and subnational level. We recommit to the framework for the implementation of the IHR. We recommend its approval, its adoption. Thank you.
Obrigada. Tanzania, followed by Zambia.
Thank you, Chair. The United Republic of Tanzania commends the Secretariat for the comprehensive report on the framework for implementing the amended International Health Regulation in the WHO African Region 2026-2030.
Tanzania supports the framework and its 6 strategic priorities, particularly strengthening IHR core capacities to improve preparedness and response to emerging and re-emerging diseases, climate-related emergencies, humanitarian crises, and zoonotic threats. While continuing to implement the IHR through the existing national IHR focal point, Tanzania is also reviewing the Public Health Act of 2009 to align it with the amendment and establishment of National IHR Authority. Chairperson, Tanzania continues to regularly conduct the State Part Self-Assessment Annual Reporting Tool, Joint External Evaluation, and Universal Health Preparedness Review. These assessments have guided the implementation of our National Action Plan for Health Security that aim to further strengthen our national preparedness and response capacities. With the African region bearing the greatest burden of WHO-reported health emergencies, it is important that Africans speak with one coordinated voice in the upcoming IHR State Parties Committee. We therefore encourage strengthened coordination, developing common African position on key implementation issues, while emphasizing the importance of a well-resourced coordinated financial mechanism that are in line with the member state national priorities. Tanzania adopted the framework and remain committed to implementing the amended international health regulation in collaboration with the WHO and partners to strengthen health security. I thank you.
Thank you. Zambia, followed by Sierra Leone.
Chairperson, Zambia welcomes the framework of implementation of the amended international health regulations and strongly supports its emphasis on translating commitments into functional national systems. Through the Zambian National Public Health Institute Act No. 19 of 2020, we established a clear foundation for health security. The Zambian National Public Health Institute has been designated as both the National IHR Authority and the National IHR Focal Point, strengthening national coordination and continuous communication with WHO. Implementation is supported through the IHR Technical Working Group, One Health Coordination Mechanisms, the National FIOC, and multi-sectoral emergency structures. SPA assessments have demonstrated progress in surveillance, laboratory systems, focal point functionality, and case management. Nonetheless, challenges remain. Financing is heavily dependent on external sources, subnational capacities are uneven, real-time multi-sectoral data sharing requires strengthening, and porous borders demand more effective collaboration. Zambia supports adoption of the framework and encourages WHO to provide member states with practical technical assistance for legal domestication, institutionalization of national IHR authorities, and sustainable financing. I thank you.
Thank you. Sierra Leone, followed by Burkina Faso.
Madam Chair, on behalf of the Honorable Minister, Sierra Leone endorses and supports the adoption of the framework and commits to accelerating its domestication and implementation. Sierra Leone has made important progress. We have established a national IHR authority and a national IHR focal point anchored in the National Public Health Agency with mechanisms for multi-sectoral and One Health collaboration across human and animal health, wildlife, and the environment. This commitment was demonstrated during our successful engagement with the Pandemic Fund, which is supporting national preparedness and response capacities across the 3 sectors. Our IHR capacities are also improving. The overall SPA score improved from 51% in 2024 to 55% in 2025, with progress in point of entry workforce development, infection prevention, and food safety. We recognize remaining gaps, particularly in chemical event and radiation emergencies, and will continue strengthening legislations and capacities in these areas. This aligns with the framework's emphasis on investing in lagging IHR capacities. Sierra Leone acknowledges that further work is required to harmonize legal and operational arrangements across the amended IHR and other relevant global and regional instruments, while strengthening governance and sustainable domestic financing for health security. These priorities are central to the framework. Sierra Leone therefore commits to working with WHO member states and the regional partners to address these gaps and fully operationalize the amended IHR in support of stronger national and regional health security. Thank you.
Thank you. Burkina Faso, followed by Angola.
Merci.
Thank you, Madam Chairperson. Burkina Faso would like to thank the Secretariat for presenting this framework for the implementation of IHR amendments in the African region. For Burkina Faso, this remains a priority in a context that is marked by zoonotic epidemics and movement of the population. In 2024, we formalized our national IHR focal point and is conducting its second joint evaluation. Burkina Faso has strengthened its One Health approach through a joint IHR PVS exercise, the designation of sectoral focal points, the mapping of legal texts and resources, as well as the annual SPAR assessment. At the same time, efforts are being deployed to strengthen event-based surveillance, laboratory capacities, and field epidemiology, and 12 priority points of entry with strengthened coordination and digitization of health data collection. Burkina Faso supports the adoption of this framework and emphasizes the importance of a gradual coordinated implementation tailored to national context based on state leadership, effective multi-sectoral collaboration, and predictable, sustainable funding. We encourage WHO to continue supporting member states so that new obligations arising from the IHR are transformed into strengthened and more equitable health security for our populations. We call for sincerity and international solidarity to effectively face pandemics in the region. Thank you.
Merci. Angola, followed by Zimbabwe.
Muito obrigado.
Thank you very much, Madam Chair. Angola would like to thank the Secretariat for this report on the framework for the implementation of the IHR amendments in the African region 2026-2030. We support this document. We would like to recognize that the region continues to face public health emergencies. This includes recurrent epidemics, climate events, humanitarian challenges. In this context, the amendments to the IHR are an opportunity to take a step forward when it comes to increasing preparedness and early warning systems, especially when it comes to the response to public health emergencies. Angola recommits to implementing the 2024 amendments, and we would like to see increased governance when it comes to the IHR's implementation. And we think that there is an opportunity here to increase dependence on the One Health approach and a multi-sectoral approach as well. We have created an NIA in Angola. We would like to highlight the importance of epidemiological surveillance, especially on the borders and entry posts. We need to ensure that we have predictable financing mechanisms, and we would appreciate ongoing support. Madam Chair, we believe that this framework is a solid basis for the acceleration of the harmonized implementation of IHR in the WHO African region. We think it will strengthen the One Health approach. For these reasons, Angola fully supports the framework for the implementation of the International Health Regulation amendments. Thank you very much.
Obrigada. Zimbabwe, followed by Lesotho.
Thank you, Madam Chairperson. Zimbabwe welcomes and endorses the framework for the implementation of the International Health Regulations amendments in the WHO African region 2026 to 2030, and thanks the WHO Regional Office for the comprehensive report. The amended International Health Regulations provide an important opportunity to strengthen collective health security while ensuring that implementation remains nationally owned and responsive to country priorities. Zimbabwe reaffirms its commitment to the full domestication and implementation of the amended regulations. Will strengthen national governance and coordination through the already designated national IHR focal point and the progressive establishment of an appropriate national authority to provide clear leadership, accountability, and effective multi-sectoral coordination. Our focus will be on building resilient systems for prevention, preparedness, detection, and response, investing in and retaining a multidisciplinary public health emergency workforce, and strengthening collaboration across sectors, including through a One Health approach. We also recognize that implementation cannot be sustained without predictable and adequate financing. Zimbabwe will therefore continue to prioritize domestic resource mobilization while calling for stronger international solidarity and sustainable support for countries with significant capacity and financing gaps. We call for practical implementation tools, technical assistance, peer learning, and stronger coordination among WHO, Africa CDC, member states, and regional institutions. Zimbabwe remains committed to working with all partners towards a safer, more resilient, and better prepared African region. I thank you.
Thank you. Lesotho, followed by Namibia.
Thank you, Chair. The Kingdom of Lesotho welcomes and endorses the international regulations as a vital instrument for strengthening global health security through prevention, preparedness, and response to public health threats and emergencies. We have implemented all 4 components of the IHR monitoring and evaluation framework, assessing the availability and functionality of capacities through state-party annual reporting, annual joint external evaluation, simulation exercises, and after-action reviews, including assessments at points of entry. Findings from these processes informed the development of the second National Action Plan for Health Security, including updated threat-specific action plans through strengthened collaboration. Lesotho has supported 4 countries in the African region to validate and cost the National Action Plan for Health Security. For the first time, Lesotho conducted the subnational multi-hazard risk assessments, enabling 3 districts to develop health emergency response plan. Through the field epidemiology training program, we continue to strengthen the workforce across all health sector, prioritizing frontline workers in hard-to-reach areas and points of entry. District emergency preparedness and response structures are being strengthened through simulation-based trainings for rapid response teams. Importantly, Lesotho is also progressing with the domestication of the international health regulations to strengthen implementation within countries' national frameworks. We thank WHO and all partners for continued support, and we look forward to continued collaboration. We thank you.
Thank you, Lesotho. Namibia, followed by Kenya.
Thank you, Chair. We commend the Secretariat for this framework. Namibia has proactively advanced implementation by establishing a multi-sectoral national IHR focal point network, as well as launching our national multi-hazard preparedness plan, utilizing JEE and SPAR metrics to identify as well as to bridge national health security gaps. However, noting that only 1 member state in the region has successfully established a national IHR authority, we urge the Secretariat to provide targeted legal and technical assistance. This support is crucial to help member states update and harmonize fragmented domestic legal frameworks to empower these authorities effectively. Furthermore, to ensure that Annex 2 monitoring matrix drives meaningful progress, Namibia proposes integrating 3 vital indicators. First, an indicator tracking dedicated financing for IHR implementation. New obligations without dedicated funding explain why African countries often score so poorly on JEE metrics compared to other regions. We cannot build core capacities on unfunded mandates. Second, considering the current lack of governance and operational clarity regarding the new coordinated financial mechanism, we request an indicator measuring the CFM's responsiveness to equitable financial assistance and its direct alignment with member states' domestic priorities. Third, and finally, an indicator to track equitable access to health products for African countries during outbreaks and PHEICs, measuring whether vaccines and countermeasures actually reach our population during crisis is essential to guarantee the equity principles enshrined in the amendments. Finally, Namibia emphasizes that the amended IHR, Pandemic Agreement, and Africa CDC Statute must remain deeply complementary, preventing the duplication of our limited resources. I thank you.
Thank you. Kenya, followed by Togo.
Thank you, Chairperson. Kenya welcomes the framework for implementation of the amended international regulations and supports its adoption. The amendments present an important opportunity for us to move from a model of health security that is heavily dependent on external response towards one founded on strong national institutions, preparedness, resilience, and African health sovereignty. For Kenya, 3 issues are particularly important. First, implementation must be nationally owned and sustainably financed. The IHR obligations cannot remain dependent on unpredictable external financing. We must progressively finance the core capacities that protect our populations. Surveillance, laboratories, our health workforce, points of entry, emergency operations, and resilient supply chains should serve as our essential national security investments. We therefore welcome the framework's emphasis on domestic financing while calling for new international financing arrangements to give African countries predictable and equitable access to complementary resources. Secondly, equity must become operational. Africa's experience during COVID-19 demonstrated that detecting threats without assured access to vaccines, diagnostics, therapeutics, and other medical countermeasures leaves countries vulnerable. Implementation of the amended IHR must therefore advance alongside the pandemic agreement, including arrangements that deliver timely access to health products and support regional manufacturing and strengthen African supply security. Third, we must avoid fragmented health security architecture. National IHR authorities should strengthen existing national institutions rather than create parallel structures. Kenya has established an NPHI, which will serve as national IHR authority, and plans are underway to anchor it through a legal instrument. At regional level, implementation must ensure complementarity between WHO and Africa CDC, particularly in surveillance, emergency declarations, information sharing, and response coordination. One threat must generate one coherent response. Kenya also stresses the importance of cross-border surveillance, interoperable and nationally covered health data, community-based detection, and a well-trained emergency workforce. These capacities must reach beyond national capitals to borders and communities where outbreaks are first detected.
Thank you, Kenya.
Chairperson, Kenya stands ready to work with WHO, Africa CDC, and member states to translate these amendments from international commitments into stronger sovereign national capacities and a safer, more resilient Africa.
Thank you, Kenya. Togo, followed by the Gambia.
Merci, Madame. Thank you, Madam Chair. Togo congratulates member states of the African region for their strong political commitment to the 2024 IHR amendments stemming from the relevant WHA. Now, this is a very important part of management of IHR requirements. But when it comes to the implementation of these amendments, the implementation is still unequal. This is why the framework is very timely. It's a timely intervention because it will help member states and stakeholders in our region to accelerate integration of the amendments into our national healthcare systems. It's also very important that we designate NIAs, that we develop cooperation between the relevant structures, that we strengthen governance and financing mechanisms, and that we integrate IHR amendments into national plans. This will only increase our preparedness and response capacity. We note with satisfaction that this framework proposes a coordinated approach, which is therefore in harmony with regional health legal instruments. Thank you very much. We support the adoption thereof.
The Gambia, followed by Algeria.
Chairperson, distinguished delegates, the Gambia welcomes the proposed framework for the implementation of the amended International Health Regulations, IHR 2005, in the WHO African region, and commends WHO for providing a clear roadmap to strengthen preparedness, response, and resilience across the region. The framework comes at a critical time when Africa continues to face a high burden of outbreaks, humanitarian emergencies, and climate-related health threats. The Gambia continues to strengthen surveillance systems, emergency preparedness and response capacities, cross-border collaboration, and the implementation of the National Action Plan for Health Security. The country remains committed to the One Health approach and to integrating the amended IHR into national legal, policy, and operational frameworks. In line with the new amendments, we have established the National IHR Authority and the National IHR Focal Point, comprising senior representatives from all relevant stakeholders, including human, animal, and the environment sectors. The National IHR Authority and the National IHR Focal Point Secretariat are coordinated by the Ministry of Health. We urge the Assembly to note the report and encourage the WHO to continue supporting member states to strengthen IHR implementation, including the domestication of the new amendments. The Gambia therefore supports the adoption of this framework and reaffirms its commitment to working with WHO, Africa's CDC, and partners to achieve full implementation of the amended IHR and strengthen health security across the African region by 2030. Thank you, Chair.
Thank you. Algeria, followed by South Africa.
Thank you, Madam Chair. The delegation of Algeria would like to thank the Secretariat for presenting this comprehensive report and for developing the framework for the implementation of the amendments to the international health regulations in the WHO African region. Algeria welcomes this timely initiative. Our region continues to face a disproportionate burden of public health emergencies, making the strengthening of preparedness, detection, and the response capacities an urgent priority. Algeria reaffirms its full adherence without reservation to the amendments to the International Health Regulation. We particularly welcome the strengthened emphasis on equity, solidarity, and transparency, as well as early warning, rapid notification, and enhanced coordination through the national international health regulation points. For Algeria, implementation should be country-driven, progressive, and adapted to national context and capacities, while being supported by adequate technical and financial assistance. We attach particular importance to empowering national and international health regulation authorities, strengthening national legal frameworks, surveillance, and early warning systems. We also stress the need for predictable and sustainable financing, particularly for developing countries, as well as concrete mechanisms to ensure equitable and timely access to essential health products during public health emergencies. Finally, we underline the importance of ensuring complementarity between the amended international health regulations and the WHO pandemic agreement, particularly regarding surveillance, information sharing, coordination, and financing. Algeria supports the proposed framework and remains committed to its effective implementation in a spirit of solidarity, equity, shared responsibility, and collective resilience. Thank you, Madam Chair.
Thank you. South Africa.
South Africa welcomes and supports the adoption of the framework for the implementation of the IHR. In taking note of the strategic priorities outlined in the framework, South Africa wishes to emphasize the following key national and regional imperatives. On governance and the National IHR Authority, South Africa strongly supports the designation of a central, legally empowered, and well-resourced National IHR Authority to effectively coordinate multi-sectoral implementation. We welcome the framework's focus on strengthening governance structures and ensuring that the national IHR focal point remains continuously accessible. To fully operationalize the amendments, South Africa is actively undertaking internal legislative processes to domesticate these provisions into national law. The domestic alignment will formally designate our national IHR authority, empower our IHR focal points, and reinforce core capacities, particularly at our points of entry, while safeguarding our constitutional principles. South Africa emphasizes the critical need for secure, predictable, and sustainable domestic and international financing mechanisms to support IHR core capacities and prevent over-reliance on vulnerable external aid. We stress the vital importance of translating commitments to solidarity and equity into concrete action, particularly regarding equitable access to relevant health products and countermeasures during public health emergencies. Recognizing that majority of high-threat pathogens are zoonotic, South Africa reaffirms its commitment to a whole-of-government and a whole-of-society approach. We fully endorse enhanced collaboration across human health, animal health, agriculture, and environmental sectors. We are also integrating IHR obligations into national health security frameworks. We have already established our National Action Plan for Health Security 2025 to 2029, mapping out clear objectives across 19 technical areas, supported by a robust monitoring and evaluation framework. Finally, South Africa remains steadfast in its commitment to regional solidarity, equity, and the continuous enhancement of our collective public emergency prevention, preparedness, and response capacities. I thank you.
Thank you. Distinguished delegates, since I don't see any other requests for a floor by the member states, I now invite representatives of member states of the other region, UN agencies, and other IGOs to raise your nameplates. I remind you that you have 1 minute. East Central and Southern African Health Community, you have the floor.
Thank you, Honorable Chair, Honorable Ministers, distinguished ladies and gentlemen. The East Central and Southern Africa Health Community commends WHO for the framework for the implementation of the IHR amendments and supports its adoption. We urge member states to anchor IHR implementation in domestic plans and budgets while partners align catalytic financing behind nationally identified gaps. Equity must be visible not only in global commitments, but also in timely access to diagnostics, countermeasures, and essential services for border, remote, fragile, and vulnerable communities. EXA Health Community commits to helping turn the amended IHR from legal obligations into everyday operational readiness. With national leadership, regional solidarity, and sustained investment, Africa can detect earlier, notify faster, and respond together while protecting lives, livelihoods, and international travel and trade. Thank you.
Thank you. I understand that several other non-state actors have requested to deliver a statement on this agenda item, so you are now invited to do so. Doctors Without Borders, Médecins Sans Frontières, you have the floor.
Médecins Sans Frontières welcomes the amendments to the international health regulations as an important step towards equity and access. We are encouraged by the recognition of the need to strengthen capacities in fragile and humanitarian settings, ensure equitable access to health products as a core capacity for emergency preparedness and response, and support countries in removing barriers to life-saving health products. WHO, regional organizations, and governments should work together and use the IHR's equity provisions to support these efforts through coordinated implementation. The ongoing Ebola disease outbreak reinforces the importance to do so. Full implementation of our IHR's already agreed access-related obligations aligned with the pandemic agreement and its pathogen access and benefit sharing system is essential to close preparedness gaps and better protect those most affected by outbreaks, and this both in peace and during crisis. Thank you.
Thank you. African Society for Laboratory Medicine, SLM, you have the floor. Public Service International, you have the floor.
PSI welcomes the implementation framework and hope it helps bridge the contradiction between near universal adoption of the IHR amendments and lag in constituting national IHR authorities. We urge member states to include the unions and professional associations of health emergency responders in the authorities' work. We appreciate the framework's recognition of the connections between health systems constraints, such as shortage of health workforce, limited infrastructure, and member states' capacities to meet IHR obligations. Thus, whilst we support One Health as a guiding principle, we note its insufficiency and urge member states to adopt a structural One Health approach. We also call on member states to optimize their community health worker programs to leverage communities for IHR implementation. This would entail decent work for CHWs in line with the 2018 WHO guidelines. Finally, we call on member states to sustain the needed solidarity and strong public services at the heart of effective IHR implementation. Thank you, Chair.
Thank you. International Federation of Medical Students Association.
Thank you, Chair. Health security is a shared responsibility. In 2025, our region recorded over 120 emergencies, yet Africa remains the least IHR prepared region. We commend member states for supporting the 2024 IHR amendments and maintaining 100% mandatory SPAR reporting for 8 consecutive years. However, despite this, implementation still remains a challenge. Only one of the 47 member states has established a national IHR authority. As members of the future health workforce, we, as the International Federation of Medical Students Association, representing the voice of over 1.5 million medical students worldwide, call upon member states and the WHO for 3 main things. 1, to integrate IHR, One Health, and emergency response into medical education. 2, to expand IHR training and mentorship for youth and health workers. And finally, 3, to increase financing for health workforce training. Africa cannot wait for one generation to retire before the next leads. We must build preparedness together across generations. Thank you.
Thank you. I see no more requests from the floor. IOM, you have the floor.
Thank you, Madam Chairperson. IOM welcomes the development of the framework for the implementation of the International Health Regulations amendments. The framework comes at a very critical time as increasing mobility, urbanization, climate-related events, displacement, and disease outbreaks continue to shape public health risks across borders. From IOM's perspective, effective implementation of the amended IHR requires greater attention to population mobility and cross-border health security, strengthening core capacities at POEs, enhancing cross-border surveillance and information sharing, ensuring that migrants, mobile populations, and border communities are meaningfully integrated into national preparedness and response systems. This is fully aligned with IOM's Health, Border, and Mobility Management Framework and our ongoing support to member states across the African region. In conclusion, IOM remains very committed to working closely with governments, WHO, Africa CDC, and regional partners to support the implementation of the amended IHR, strengthen cross-border collaboration, and building resilient health systems capable of preventing, detecting, and responding to public health threats wherever they emerge. Thank you.
Thank you, IOM. IGAD, you have the floor.
Thank you so much, Chair. So IGAD welcomes and strongly supports the framework for implementation
of the International Health Regulation Amendment in the WHO region. IGAD believes effective implementation must translate these amendments into stronger national capacities and coordinated regional and cross-border action. We particularly emphasize One Health and multi-sectoral coordination, collaborative surveillance, timely sharing of data, strong laboratory systems, workforce capacity, and joint preparedness and response across the borders. IGAD remains fully committed to leveraging its regional convening and coordination mandate and working closely with the member states, WHO, and partner organizations, as well as communities and other partners to ensure supporting effective implementation. Our collective priority must be to translate the amended IHR from commitments into action, building a more prepared, resilient, and health-secure Africa. Thank you.
Thank you, IGAD. So I see no more requests from the floor now. Are there any comments from the Secretariat?
Thank you, Madam Chair, honorable ministers, distinguished delegate. We have listened with great pride to your intervention, and we can see that across our region, the international health regulations are being brought to life. We really recognize the ongoing implementation of the IHR amendment by many member states, and we really encourage others to prioritize it. So reviewing outdated public health laws, empowering national focal points, and embedding the regulation within their preparedness and response system. This momentum is collective and it is real, and we really thank you for that. I also heard honestly the challenge that you face in some of the core capacity, and we will stand with you. We will follow up to strengthen the areas you name, the workforce, surveillance, legal, chemical event, point of entry, cross-border, and infection prevention and control. And we also help identify the resources that need to close on those gaps. I wish to humbly thank the 27 member states that took the floor today, and also all the partners who underscore the need for timely implementation of this framework. I also commend the 17 countries that have designated their national IHR authorities, and thank you for Namibia to stand for that. So the idea is that in 25, we have only one in December 25. But so far in 26, as of July, we have 17. And thank you because your voice shaped this outcome. Thank you so much. So it is therefore with deep appreciation that I congratulate you, all member states, for having adopted this framework to be implemented in the African region 2026-2030. We will work with our colleagues, with our partners, Africa CDC, and all the other partners that are supporting this implementation of IHR framework. Not a single partner can support countries in implementing IHR. IHR underscore all the capacity that we need for preparedness and response for health and security. So this is a landmark for health security, a common commitment to fully domesticating the amended regulation and reaching at least developed capacity across all core capacity before the next crisis and strikes. So the Secretariat took notes and commit to support you, member state, in 4 areas, as you requested. Technical support, helping establishing and empower national IHR authorities under Article 4, readjusting laws and policy, strengthening larging capacity, and secondly, resource mobilization. We really committed to support you, mobilizing predictable catalytic financing, supporting dedicated national budget line, and engaging partners, including the Pandemic Fund, the private sector, the UK Health Security Agency, through the IHR strengthening program. Third, the regional coordination and solidarity, strengthening peer learning, training and experience sharing, and fourth, better monitoring as it was required with the establishment of trackers for financing for IHR and more indicators to track whether resources reach the population in need during a crisis. I would like to acknowledge the strong partnership between AFO and the UK Health Security, whose sustained technical collaboration through the IHR strengthening program continues to support countries in our region to translate the regulation into practical, sustainable capacities for health security. Together, this collaboration has led to the foundation for advancing implementation and reinforcing the visibility of the IHR as a cornerstone of preparedness and response. It is therefore with great pleasure that I inform you that the first production of the Continental IHR report has been produced, and it is a milestone that reflects our shared commitment to strengthen health security across Africa. But mostly, it is a report to share data. The report has been distributed to all member states, and it is available in all the 3 languages of the region. So we look forward to better collaboration and partnership to advance IHR implementation in the African region. Dear member states, from a legally binding framework to a region prepared to act as one, this is our shared achievement. WHO, Africa CDC, all partners stand with you to detect, to notify, and to respond so that no community in our region is left exposed when the next public health emergency strikes. I thank you sincerely. Thank you.
Thank you. Thank you, Dr. Beleder. The Secretariat has taken note of the comments raised. Is the Regional Committee ready now to adopt the priority interventions and the actions proposed in the document AFR RC 7610, titled The Framework for Implementation of International Health Regulation Amendment in the WHO African Region? I see no objection. It is so decided. Honorable Ministers, distinguished delegates, ladies and gentlemen, before we break for lunch today, allow me to give the floor to WHO Regional Director, Professor Janabi, for a special announcement. Dr. Janabi, you have the floor.
Thank you, Madam Chair. Excellencies, today WHO officially declares Uganda free of Ebola disease after 42 consecutive days without a new confirmed case. This is a remarkable achievement and a testament to a strong leadership, dedicated health workers, vigilant communities, and the support of WHO, Africa CDC, and all partners who worked with the government of Uganda. As we celebrate, let us honor those we lost and salute the courage of frontline responders. While Uganda has reached this important milestone, continued vigilance remains essential as your neighbors are still having an active Ebola virus outbreak. Health security is a shared responsibility, and our solidarity must remain stronger than any virus. Excellencies, as a gentle reminder to all member states, our strength lies in consistent applying the guidelines we have collectively agreed upon. Where new evidence emerges, WHO stands ready to review and update its guidance through established processes. Such consistency and respect for science are fundamental to the credibility and integrity of our organization. I now invite the Honorable Minister of Health of Uganda to come forward and receive this certification commemorating this achievement. WHO will continue to accompany Uganda in line with its guidelines. For members of the media, the Honorable Minister and a team of WHO will be available immediately after this ceremony just outside the hall if there are any questions to be answered. Congratulations, Uganda, and thank you. So we'll meet just outside.
Okay. Thank you, Dr. Janabi, and I also second the congratulations to Uganda on this important achievement. The meeting is now adjourned for lunch. We will resume exactly at 14:00 hours sharp. Delegations from Cameroon, CAR, Chad, Niger, Nigeria, you're all invited to stay back for a closed-door meeting on polio starting now in conference room 5. Thank you all. Enjoy your lunch.
Les cliniques mobiles permettent d'observer les populations éloignées des centres de santé, améliorer ainsi la couverture sanitaire. Elle offre des services de santé reproductive tels que le soin maternel, la consultation nourrisson, le dépistage de la malnutrition, la vaccination et la consultation curative. Cela permet d'identifier les risques à temps et de fournir une prise en charge adéquate.
inji da doktor kwarara da aran makwai zama zanka kan man duken sa kubante aman dulak amman zanka kan duken sa kubante ba dori bunaka ngo aga kamba
Ika kanisino dori kusiye ko kiaga dori kusaiga lokotara imbono dirka kise ika newo
L'OMS fait partie de partenaires qui est toujours disponible pour pouvoir nous accompagner et nous appuyer dans le cadre de la mobilisation communautaire pour offrir à la population des soins et services de santé de qualité.
Toutes les populations qui sont dans les endroits assez difficiles, le projet clinique mobile a beaucoup contribué pour vraiment atteindre ces populations, pour approcher les soins à ces populations qui ont vraiment pu bénéficier des soins de qualité. Et tous les jours, on a les retours positifs
Lokutara ibumbono direka ki gari kwarara. Aine siyasin tinano ahiyong banda. Ine dori saga dori saiga. Ay maka ne bina go faraha.
Nous sommes ici à Bounia, dans l'enceinte des centres médicaux évangélistiques de Bounia. À notre arrivée, les collègues de l'hôpital étaient en train de gérer plusieurs patients suspects confirmés avec les moyens à disposition dans un bâtiment à l'intérieur de l'hôpital. On est arrivé à ouvrir les nouveaux centres de traitement de CME de Bounia. Les personnels de santé arrivent chaque matin ou chaque soir avec leur habit privé, personnel. Avant de rentrer, ils doivent passer à côté de la buanderie où nos collègues ils assurent que chaque jour, on a à disposition des tenues et des bottes propres et désinfectées pour faire notre travail. À l'intérieur aussi, on a une pharmacie où les pharmaciens et les infirmières ils préparent les médicaments prescrits par les médecins et à donner à notre patient. On a la salle d'habillage, là où les personnels sanitaires, avant de rentrer dans la zone des patients ou la zone à haut risque, ils doivent s'habiller en utilisant l'équipement de protection individuelle. Et ensuite, comme on peut voir, on a la porte d'accès transparent vers les chambres du malade. Une fois terminées nos activités au sein de la zone à haut risque, la zone des patients, on doit sortir par les déshabillages. Là, on a tous les matériels, les dispositifs techniques à disposition pour se déshabiller en toute sécurité. On a des solutions chlorées, de l'eau savonneuse, les seaux avec les déchets et tout ça. Et à part d'avoir un poster avec toutes les instructions détaillées pour la rémoction, on a aussi des collègues qui nous rappellent step by step ou étape par étape comment on se déshabille en sécurité. On espère de pouvoir contribuer à la réponse en offrant un endroit où les patients pourront recevoir des soins sécurisés, humanisés et de qualité pour eux et aussi sécurisés pour les prestataires de santé et pour les communautés autour.
Shida ni mingi sana kwa hapa, hatuna hospitali, chakula hakuna DEMS ya maana, hatupati chakula.
On walbo ajabte on walbona arfe misho sawa jirta ana ndurana kama sheda kama dadadan ten ertua baka wali marsum basito.
Most of the mothers, they only come when they are critical ill.
There's a need for collaboration between WHO and Tana River County or the Department of Health to ensure that they get access to these services, which are very critical, both for the mothers and also for the children.
So those mentorships have done a lot for us because they've been in the facility.
Sasa ikija hapa inatusaidia at least tunapata dawa za watoto na za zetu za ugonjwa at least mafua.
Kwanza mimi ninawapongeza na nawapatia asante WHO, nasema na washukuru shirika wote.
amena kwali asimingi titre muduna kodrombe chingangu akade kama perdre les amis mo so asanje na pe directement so mo gwe na hospital ani sara kwatmo ala kushe pendre na dungo shi kwala akiri pendre la ga muna wango keta la ga techi ala sana ishona pe
balopika yanga dans l'endotini atene ya tinyaso directement mi mulo na ita 1 heure mi gana l'hôpital atem so si azona muna yi titene ibembendo na ngota mama tingo so wala yatu wana ngbakete wala yatu wani akono titene ibembendo il faut zoni même terlation il faut le gana hôpital rapidement.
Avec le soutien des bailleurs engagés, nous avons déjà pu former et déployer 8000 agents de santé communautaire et 1200 matrones communautaires. Nous avons construit et réhabilité une centaine de maternités et renforcé les plateaux techniques en soins obstétricaux d'urgence. Nous avons aussi créé 4 nouvelles écoles régionales de formation de personnel paramédical, y compris des sages-femmes et des assistantes accoucheuses.
Ma fiti sensibiliser ala so ngeni tingangwa idankor ngape ama machango na mama cha bébé parce ala ke gagi na hôpital.
Betnjanje so ala undangana mara zon to so tena jingana ya chika cheni a iso ikingana vechi hôpital ngape so ala la gana tere chi si amunga na i conseil chi tene iganga na hôpital chi tene sauver vie chi so.
De nombreux accouchements se déroulent désormais dans de meilleures conditions et les soins deviennent progressivement plus accessibles. Bien que le chemin reste encore long, les actions sont en cours pour une bonne santé à la naissance, pour un avenir plein d'espoir en République centrafricaine.
le cadre de la réponse Ebola, nous avons organisé l'acheminement de 80 mètres cubes d'équipements, de matériel et de consommables médicaux de Kananga jusqu'à Boulapé. Nous avons sollicité l'appui de notre partenaire, le Programme alimentaire mondial, pour la mise à disposition de 4 camions. L'opération s'est déroulée dans un contexte géographique très complexe. Il n'existe pas de route praticable entre Kananga et Boulapé, ce qui rend l'accès particulièrement difficile, et notamment pour des volumes aussi importants.
La route n'est pas bonne. On est en train de se débrouiller pour passer. Il y a des arbres qui se coupent, des crevaisons d'épinets. Un humanitaire, il faut avoir du courage, l'amour envers les autres. Nous prenons ces risques-là pour sauver la population.
Ces intrants qui ont pu être livrés vont permettre d'assurer la continuité de nos activités dans le cadre de cette réponse, que ce soit les activités de prise en charge, de PCI et de surveillance. C'est un bel exemple de collaboration entre les agences des Nations Unies, notamment le PAM, qui nous ont permis ensemble d'assurer le maintien des opérations dans le cadre de cette réponse.
Premiera haseta botinida masheta
لبتنا أنا كنت أنا فيصل من فيصل خلا قالوا قال الصخير ده ما يقدر يمرق بيتيت الصخير ده قاعد فوق بس ما يقدر يمرق بيتيت كمان خلينا نجي شنوها هنا جيت شنوها هنا كمان خلاص قالوا لي قال خلينا نمشي نسوي عملية خلاص سووا عملية ومرقوا صخير الحمد لله ما منتونا قراتشي سوولينا قراتشي ساعدونا الحمد لله لكن أنا كان أول نقولة من دي نقدر النقول.
L'Organisation mondiale de la santé, avec l'appui de ses partenaires, a répondu à ces besoins prioritaires qui ont été exprimés, principalement l'aménagement de plateaux techniques, la disponibilité en médicaments essentiels, contribuant ainsi à l'amélioration graduelle de l'offre de services de soins et la prise en charge des urgences néonatales et obstétricales.
Les décès ou bien les retards même dans les prises en charge, quelquefois est lié par l'absence de certains produits qu'il faut aller courir de gauche à droite pour en trouver afin de sauver la femme. Donc certainement, ces produits ont contribué à la réduction de la mortalité, si j'ose le dire comme ça, de la mortalité maternelle dans nos informations sanitaires.
En janvier 2026, dans les 175 accouchements, on a 0 décès maternel. Sur ces faits, nous, on a reçu de matériel de l'OMS et ça entre vraiment dans la prise en charge de nos femmes.
L'OMS nous a aidés. Comme nous, on a des médicaments, les femmes ne payent pas.
L'OMS nous a offert les boîtes de césariennes. Bien avant, on a des boîtes de césariennes. Avec l'ajout de l'OMS, ça nous a aidé d'avoir plus de boîtes et ça veut dire la patiente sera opérée et plus sécurisée. La prise en charge, il faut que ça soit rapide et adéquate pour sauver la mère et l'enfant.
Les cliniques mobiles permettent d'observer les populations éloignées des centres de santé, améliorer ainsi la couverture sanitaire. Elles offrent des services de santé reproductive tels que le soin maternel, la consultation nourrisson, le dépistage de la malnutrition, la vaccination et la consultation curative. Cela permet d'identifier les risques à temps et de fournir une prise en charge adéquate.
Inji da doktor kwarara da aran makoi zama zanka kan man duken sa kubante aman dulakkal amman zanka kan duken sa kubante ba dori bunaka an ga aga kan ba
Ika kanisino dori kusiye ko kiaga dori kusaiga lokotara imbono dirka kise ika newo.
L'OMS fait partie de partenaires qui est toujours disponible pour pouvoir nous accompagner et nous appuyer dans le cadre de la mobilisation communautaire pour offrir à la population des soins et services de santé de qualité.
Toutes les populations qui sont dans les endroits assez difficiles, le projet clinique mobile a beaucoup contribué pour vraiment atteindre ces populations, pour approcher les soins à ces populations qui ont vraiment pu bénéficier des soins de qualité. Et tous les jours, on a les retours positifs.
Lokotara ibumbono dirka ki gari kwarara Aine siyasin tinano a hiyong banda. Ine dori saga dori saiga. Ay maka na ibinago faraha.
J'avais discuté avec les jeunes et les mamans par rapport à l'âge des filles et des jeunes garçons dans la période de puberté. Dans ces moments, la jeune fille peut avoir certains signes comme les premières règles. En plus, on a parlé de PF, les méthodes contraceptives.
Konjitwa autonomie no kuro mi obe nemi di hihea eleke nyo no fiona mi be mi ado do bubuan do mi nyanti o ba autonomie le kwea maso kwero de kienji e ava kwero nji le so mi.
L'implication des agents de santé communautaires qualifiés, des relais communautaires, est un levier essentiel pour améliorer l'accès des services de santé sexuelle reproductive. L'adolescence et la jeunesse constituent une période clé pour acquérir des informations fiables pour éviter que les jeunes n'adoptent des comportements à risque.
Les soins de santé sexuelle et reproductive, par exemple la planification familiale. Les femmes n'y accédaient pas par peur, mais avec les sensibilisations, elles viennent. Donc quand elles viennent, il suffit juste qu'on puisse les mettre en confiance, qu'on leur parle bien et puis elles arrivent à se confier et on peut trouver une solution à leur mot.
Demi sa ifango edo hosi planning nyoleton bunumi ede collier jeton ojo e no ha monotun asale dia amo ayi sunu gan pama amo kwa ono pelo mo mizan collier bu pon we.
Over the years, my 13 years working experience in Zanton Research Center has seen TB testing revolutionized, which has helped the country as a whole improve case detection and also reduce the turnaround time from when patients produce samples to when they receive their result.
Before it was 72 hours, but now it's 24 hours. Like TB lamp is just within 3 hours, they get their result and we commence them on their drugs.
Once you are on drugs, you complete your drugs and the exact dose that the doctor asks you to take. By the grace of God, everything will be okay.
That is still a lot of work to do. And when you are even doing so well, sustaining those efforts requires a lot of energy, a lot of engaging everyone that needs to be engaged, so that we are all working towards the same direction.
WHO commends the efforts of Nigeria to expand TB testing and close the gap on undetected cases. We will continue to support the country every step of the way.
As a facility, we have a design system which aids also in the training and the training of staffs on the various work fronts to ensure that quality and efficiency is maintained.
I was physically, mentally, spiritually down, thinking maybe that is the end of the world. But as for now, I thank God I'm free now, and my life has changed.
I feel motivated actually, working on this client. And then number two, I have to feel bad not having the full set of the service here.
We are investing quite a lot in terms of trying to support the country build its health system so that people can actually access and use these services. We're also investing directly in uptake of a lot of these services.
أنا مرتاحين شديد ب WHO. هو بيشيلنا في training أو كمان بيعمل support supervision ودوايات بيجيبوا لنا. Sala kun delta sabaiko kansari ajen sunude kulu muni agejibu sarain. Daiman anna bori le umahade min productive age lakade fi 40 anna bena dumon kedo mauja rangeren na screen mon.
أنا قاشر حر لي أنا ده الشهر بتاعي أنا بشتغل لسن أجل تومون أنا بكون فرحان لما النسوان الحامل ده كان أنا جرا سلومون جيجا في كيشف بيشيلوا علاجات أنا جيكون مرتاح.
Quand je vois une femme en travail, bien une femme enceinte, je l'oriente pour les serpentines, le travail a commencé. Il faut aller à l'hôpital parce que maintenant, les accouchements de la maison avec les complications, là, c'est pas bien.
Dans le cadre de ce programme, ces accoucheuses traditionnelles ont été formées sur la détection des signes des dangers et également sur l'orientation précoce de ces femmes. Et donc, cela permet en fait d'agir sur les retards. notamment le premier retard qui est celui de la décision pour pouvoir se rendre au centre de santé, et également sur le troisième retard, la précocité de la prise en charge.
La plupart des accouchements en communauté se passent à domicile. Le MES, avec le ministère, essaie de travailler avec ces accoucheuses traditionnelles. Grâce à cette collaboration, les femmes accouchent maintenant dans les formations sanitaires par un professionnel qualifié, d'où la qualité des soins que nous recherchons.
Par jour, on fait au moins 30 à 35 femmes qui viennent à la CFN, les accoucheuses traditionnelles. Ça nous aide beaucoup parce qu'avant, il y avait beaucoup de perdus de vue pour les femmes enceintes. Donc, ces AT suivent les femmes dans les quartiers et on les oriente pour ne pas que la femme reste à la maison et elle accouche à domicile.
L'accouchement à la maison, c'est un risque. Du fait que tu vas accoucher à la maison, tu ne sais pas ce qui va t'arriver. Toi, la femme, quand tu sais le temps de venir à l'hôpital, déjà, c'est déjà trop tard. Donc, c'est mieux d'accoucher à l'hôpital et être en sécurité.
Une fois accouché dans de très bonnes conditions, le bébé se porte bien, la maman se porte bien. C'est un plaisir pour moi.
Faire les pratiques sur les mannequins avant de pratiquer sur les humains. Et ça nous a beaucoup aidé. L'apport des mannequins nous a donné beaucoup de confiance en nous. Ça nous a aidé à être très sûrs et quand on fait nos pratiques sur les êtres humains.
Nous avons aujourd'hui des mannequins qui sont même couplés à des ordinateurs pour nous faire simuler des anesthésies générales sur les patients, des arrêts cardiaques sur les lits des patients. J'ai plus de 25 ans dans l'anesthésie, mais depuis là, j'ai senti un changement. Et mes étudiants aussi sont toujours très contents parce qu'après chaque fois, on fait un débriefing.
Depuis la reprise de cette formation sur mannequin, les compétences de région vraiment ont été améliorées. Ils savent mieux prendre en charge les patients. C'est ce qu'on appelle les soins humanisés. Et c'est vraiment indispensable pour réduire le pronostic maternel et périnatal en nombre de décès.
La formation SONU nous a permis de renforcer nos compétences et enfin d'améliorer la prise en charge de la mère et du nouveau-né. Avec les mannequins, ça nous permet d'éviter certaines erreurs qu'on pouvait faire sur les mères.
La création de la salle de simulation SONU a été motivée par le besoin d'amélioration de la qualité de la formation des apprenants, de sécuriser les patientes qui viennent en consultation pour qu'il y ait moins d'incidents.
We need to be concerned about severe acute malnutrition simply because of the burden that it contributes to. Currently, globally, we know that close to 42 million children are affected by child wasting.
Ethiopia is striving to reduce the burden of malnutrition in the past decades, even though some regions remain still high in burden of wasting.
The importance of the training is to create national capacity on the WHO global training package for the management of acute malnutrition. And Ethiopia has been advanced in the revisions, and now we are working on the 19 training materials. This training helps us to align the Ethiopian revisions with the global tool of WHO in the prevention and in the management of severe acute malnutrition with medical problems.
In 2023, WHO released new guidelines on the prevention and management of wasting, and for the first time, those guidelines include infants less than 6 months old as a priority focus group. And so that has meant including new, more detailed guidance for the management of wasting in those infants, because those infants need as a priority to establish or re-establish exclusive breastfeeding as the cornerstone of their best treatment.
እነዚህን አዳዲስ ጥናቶችና ግኝቶች ለሀገር ውስጥም ወይም ደግሞ እዚህ ኢትዮጵያ ውስጥ ለምሰራቸው ስራዎች እንደ ኢንፑት ይሆናሉ። ትሬኒንጉ የሚሰጠው የግሎባል ስታንዳርድ ነው የደብሊውኤችኦ ስታንዳርድን የጠበቀ ስለሆነ በጣም ጥሩ ልምድና እውቀትና ስኪል ወይም ክህሎት እንድናዳብር አድርጎናል ብዬ አስባለሁ። ያለውን የኑትሪሽን ሰፕላይ እጥረት አድረስ በሚያደርግ መልኩ በአግባቡ ደግሞ ህፃናት የምግብ እጥረት ያላቸው ህፃናት በአግባቡ የሚታከሙበት ሁኔታ አላይን ያደረገ ሁለቱን ዓላማ አድረስ ያደረገ ስለሆነ እሱ አዲስ አፕዴት ነው ብዬ አስባለሁ።
So our institution hosting this training, we are benefiting a lot. One thing, our professionals are getting a hands-on training. There is update on the guideline. So these updates will help our health professionals.
I want to really appreciate the government of Ethiopia for showing us the leadership that is required when it comes to addressing issues to do with malnutrition. Secondly, we are not doing this alone as WHO. We are working together with various UN agencies. We have UNICEF, WFP, UNHCR as part of the Global Action Plan on Wasting Partners, and also the implementing partners who are on the ground to ensure that the services are delivered for the children. In a special way, we have received support from Irish Aid to first of all develop the guidelines themselves, develop the training manuals, and then move ahead to cascade the trainings at the country level.
Over the past 3 years, Ethiopia has made important progress in improving the prevention and management of child wasting in line with the 2023 WHO Global Recommendation. These efforts are helping in strengthening Ethiopia's nutrition system and improve outcomes of vulnerable children and communities.
Shida ni mingi sana kwa hapa, hatuna hospitali, skuli hakuna DEMS ya maana, hatupati chakula.
wan walbo aan jabte wan walbana aan rafay meesha soo jirta anaad ndur ana kama sheeda qamna dadadan teen dheertuwa baka wali mar soo baasito
Most of the mothers, they only come when they are critical ill.
There's a need for collaboration between WHO and Tana River County or the Department of Health to ensure that they get access to these services, which are very critical, both for the mothers and also for the children.
So those mentorships have done a lot for us because they've been in the facility.
Sasa ikija hapa inatusaidia, at least tunapata dawa za watoto na za zetu za ugonjwa, at least mafua.
Kwanza mimi ninawapongeza na nawapatia asante WHO, nasema na washukuru shirika wote.
C'est une activité de renforcement de capacité par rapport avec la surveillance épidémiologique de la maladie à virus Ebola. Partant des alertes jusqu'aux investigations, comment faire le listage des contacts, comment s'assurer que tous les contacts listés autour d'un cas confirmé sont suivis pendant 21 jours. Mais nous avons eu aussi le temps de discuter de comment faire la recherche active dans les établissements de soins de santé et dans la communauté. C'est une activité critique pour nous.
Cette formation nous apprend comment nous devons surveiller la maladie épidémiologique Ebola dans le milieu où nous sommes. C'est important pour moi. D'abord, c'est pour me protéger moi-même et protéger aussi la communauté que je suis en train de vivre.
My name is pharmacist Sherifat Omini. I'm a mother of 2. My second child is 7 months. Right now, I want to prepare him to receive a malaria vaccination at the health facility. I am glad that he falls within the age brackets, which happens to be 5 to 11 months. And I would like to advise all mothers which their children falls within this age bracket of 5 to 11 months to also bring their children to the health facility to benefit from this malaria vaccine. So any child that happens to fall with this is a great privilege and opportunity for them to minimize the spread of the malaria. I want to appreciate the governments and partners like WHO, UNICEF, Gavi, for giving us this opportunity for Kebbi to be one of the states that is found to rule out the malaria vaccine.
My name is Nathan John. I'm 43 years old. I'm a regular donor. It has been so wonderful. I feel fulfilled because it's something that I can do it single-handedly. Single-handedly in the sense that nobody pushed me to do it. I do it willingly. Blood is something that science cannot create it. Money cannot buy it. So in that aspect, I see that if I have it to give, especially to those who are in dire need, it has been fulfilled life for me to see that everything I'm doing is is on the policy of National Blood Service Agency, accepted by WHO and accepted by Nigerian government. To commemorate the World Blood Donor Day, I will be donating to save life and keep humanity alive.
Avec cet avènement de la maladie à virus Ebola, tout le monde craignait l'hôpital. C'était difficile pour le fonctionnement de l'hôpital. Un soulagement, pas seulement pour nous les prestataires, mais aussi pour la communauté. La décontamination et bio-nettoyage a été faite dans le nord. Et toutes les salles de l'hôpital doivent être utilisés sans peur ni crainte. Il y a eu reprise d'activité. La fréquentation continue à augmenter chaque jour.
This context in particular, it's important to do IPC because what IPC does is it tries to mitigate, to control transmission by the measures and standards that it basically implements. And those measures and standards are called the standard precautions and transmission-based precautions. And they focus around things that are very practical, like hand hygiene, the PPE that people wear, the environment that they're in, the ensuring that triage is in place, that there's isolation capacity, and that patients are placed in a place where they do not affect or can infect other patients.
Fragile right away in physics in Popoto when Gabriel facing problem with this time where I can.
Before we had this maternal waiting home, we had a lot of problem with our pregnant women reaching to the facility. Some of them, they would come from far distances.
It's all about partnership. It's all about working together towards the SDG goal of achieving reduction in maternal mortality.
We've invested in training. We have ensured that the midwives and nurses at the health facilities have the skills necessary to provide care. We have skilled birth attendants in almost all of our health facilities.
And yeah, and Lola will give birth safely because I'll be giving birth in Kuwait.
Avoir un laboratoire au cœur de l'épidémie permet à ce qu'il y ait une prise en charge plus rapide, dans le sens où plus tôt on reçoit un échantillon, plus tôt on l'analyse et on sait prendre en charge les cas.
Lorsqu'on prélevait les échantillons ici à Boulapé pour les acheminer jusqu'à Kinshasa, vu l'état des routes et les difficultés que nous avons, ça faisait autour de 2 à 3 jours pour arriver à Kinshasa. Alors actuellement, avec l'installation du laboratoire sur place, les rendus des résultats qui sont rapides, en 2 heures, on a déjà les résultats et la prise en charge nous est facile.
Lorsqu'on nous amène les échantillons, nous devons d'abord déballer, nous allons amener ça pour identifier. Après, nous allons inactiver. On ne peut pas lancer échantillon sans l'inactivation. Nous allons mettre ça dans les cartouches d'une experte pour lancer ça directement. Ça peut nous prendre au moins des heures du temps.
L'apport de l'OMS dans cette riposte a consisté à faciliter le transport des machines, des gene experts et tous les outils dont nous avons besoin pour le diagnostic et le suivi de malades, mais aussi La formation de personnel de laboratoire sur la biosécurité, la biosécurité au laboratoire a permis à ce que nous ayons rapidement la main-d'œuvre sur place. Et cette main-d'œuvre sera utilisée à Boulabé, à Moïka, mais également à Tchitapa.
L'hôpital n'avait pas la capacité de réaliser de PCR. Nous avons eu à installer une machine CP GeneXpert qui nous permet de faire le diagnostic Ebola Zaïre en moins 1 heure et demie. On a les résultats. Et aussi, on a eu à installer des machines de biochimie Piccolo qui nous permet aussi d'avoir des résultats biochimiques pour suivre aussi l'état des patients.
La proximité des laboratoires avec les centres de traitement permet la promptitude dans l'obtention des résultats et donc ça améliore rapidement la prise de décision. Nous n'avons pas fait traîner les malades comme cas suspect dans les centres de traitement parce que s'il est suspect, il peut sortir non cas et s'il traîne, il peut s'exposer.
amena kwali asimingi titre muduna kodrombe chingangu akadi kama perdre tamingi moso na sanje na pe tereti maso mogwe na hospital ani sara kwatmo ala kushe pendre na dungo chi kwala akiri penda la ga muna wango keta la ga techi ala sana ishona pe
Balopika yanga dans la détenu atene ya chinya son directement mi mulo na ita 1 heure mi gana l'hôpital atem so si azona muna yi titene I bembendo na ngota mama tingo so wala yatu wana ngbakete wala yatu wani akono titene I bembendo il faut zoni même terlo son il faut le gana hôpital rapidement.
Avec le soutien des bailleurs engagés, nous avons déjà pu former et déployer 8000 agents de santé communautaire et 1200 matrones communautaires. Nous avons construit et réhabilité une centaine de maternités et renforcé les plateaux techniques en soins obstétricaux d'urgence. Nous avons aussi créé 4 nouvelles écoles régionales de formation de personnel paramédical, y compris des sages-femmes et des assistantes accoucheuses.
masiti sensibiliser ala so mbeni tingangwa idankor ngape ama machango na mama cha bébé parce ala ke gagi na hôpital.
Betnjanje so ala undangana mara zonto so tena jingana yashi ka cheni a iso ikingana vechi hôpital ngape so ala la gana tere chi si amunga na I conseil chi tene iganga na hôpital chi tene sauver vie chi so.
De nombreux accouchements se déroulent désormais dans de meilleures conditions et les soins deviennent progressivement plus accessibles. Bien que le chemin reste encore long, les actions sont en cours pour une bonne santé à la naissance, pour un avenir plein d'espoir en République centrafricaine.
Over years, my 13 years working experience in Zantrin Research Center has seen TB testing revolutionized, which has helped the country as a whole improve case detection and also reduce the turnaround time from when patients produce samples to when they receive their result.
Before it was 72 hours, but now it's 24 hours. Like TB lamp is just within 3 hours, they get their result and we commence them on their drugs.
Once you are on drugs, you complete your drugs and the exact dose that the doctor asks you to take. By the grace of God, everything will be okay.
That is still a lot of work to do. And when you are even doing so well, sustaining those efforts requires a lot of energy, a lot of engaging everyone that needs to be engaged, so that we are all working towards the same direction.
WHO commends the efforts of Nigeria to expand TB testing and close the gap on undetected cases. We will continue to support the country every step of the way.
As a facility, we have a design system which aids also in the training and the training of staffs on the various work fronts to ensure that quality and efficiency is maintained.
I was physically, mentally, spiritually down, thinking maybe that is the end of the world. But as for now, I thank God I'm free now, and my life has changed.
Aujourd'hui, ça a été une journée clé pour la réponse à l'épidémie de Ebola en Ituri. L'Organisation mondiale de la santé, aujourd'hui, a amené plus de 5 tonnes de matériel sur le terrain. Des kits de prévention et de contrôle des infections. Nous avons des kits de transport d'échantillons, des tentes, des lits, du matériel de laboratoire, où nous avons amené tous les premiers éléments qui sont essentiels à débuter cette réponse. Et nous avons enfin aujourd'hui sur le terrain une quarantaine d'experts de l'OMS et du ministère de la Santé pour travailler sur les différents piliers de la réponse. La prise en charge des cas, l'information et l'épidémiologie, la surveillance, la communication des risques, la logistique, l'administration, les finances, la planification.
Les sites sont déjà choisis. À Rampara et puis à Mongwalu et ici à Bunia, les sites sont déjà choisis. Pour la population, je voudrais d'abord dire que, et je l'ai dit hier à Kinshasa, je le répète aujourd'hui, ce n'est pas une maladie mystique. Plus vite on va prendre le malade en charge, plus vite on va le soigner, mais plus vite on va arrêter la propagation du virus. Le traitement est gratuit, venez vous faire prendre en charge, qu'on sache que c'est telle maladie et qu'on vous donne les médicaments adaptés.
Les mesures que les populations devraient observer pour nous aider à lutter contre cette maladie à virus Ebola, c'est surtout de se laver régulièrement les mains, d'éviter de se saluer en se serrant les mains ou en faisant les accolades, d'éviter d'organiser des cérémonies où il y a des grands attroupements, où il y a un grand rassemblement des populations, et surtout d'éviter de manipuler les cadavres, de laisser les cadavres être pris en charge par des personnels qui ont été formés pour pouvoir assurer des enterrements dits et sécurisés.
ambayo tulikuwa tunaitumia mwanzoni haikuwa inatoa taarifa nyingi zaidi, kiasi ambacho kuna vitu vingi watoa huduma walikuwa na miss kuvifanya.
Tunajua kwamba leba ya guide inamsaidia mtoa huduma aweze kumfuatilia mama anapokuwa katika uchungu wa kweli mpaka anapokuwa amejifungua.
Tunashukuru kwamba ushirikiano ulikuwa ni mzuri na tunaendelea kulishukuru Shirika la Afya Ulimwenguni kwa ushirikiano wao ambao wameonyesha ndani ya mkoa wa Kigoma, lakini bado maboresho mengi, vituo vingi vinajengwa.
Tukapata kitu kipya ambacho ni tool mpya Labour Care Guide, tukaelekezwa namna ya kuitumia na kwa nini imeletwa. Basi tukaipokea, tukaifanyia kazi na sasa hivi tumezoea.
Nilikuwa na hali mbaya kwa kweli, sababu nguvu tena zilikuwa zishaniishia, lakini kwa dawa zile nilizoandikiwa hapa naweza hata nikakimbizana na mtu na amani, mimi na mwanangu naona sote tuko sawa.
Sur le terrain comme dans la vie, le respect est notre première règle du jeu.
Là, c'est le capitaine de l'équipe, Mori Keita, du côté de l'OMS.
L'esprit sportif, c'est aussi protéger les autres.
Tolérance zéro contre abus, exploitation et harcèlement sexuel.
Il donne la passe au chef de pilier de la surveillance Tengue Tengue. Tengue Tengue qui avance, malheureusement, il tombe.
Chaque match est une leçon. Respect, égalité et protection pour tous.
Nous sommes au stade de Boulapé où nous assistons à un match de football entre deux équipes.
Sur le terrain, tout le monde est capitaine du respect et de la dignité.
Mais voilà, l'arbitre vient de siffler. Je crois que c'est un penalty. Oui, je suis...
Courir pour la victoire, oui.
Fermer les yeux sur les habits, jamais.
Une dame qui se prépare justement pour tirer, c'est Sylvie qui gagne.
Ici, nous prenons la prévention contre les exploitations et abus sexuels pendant les interventions de santé publique. Tolérance zéro. Tolérance zéro.
As a response for the Ebola outbreak in Bulape, in close collaboration with the MSF, we built the new ETC of Bulape. Follow me, I will show you around. The treatment center is including like 14 patient tent plus the infection disease treatment module, and have the possibility to host a max of 32 patients. It divided in clearly into zones as for WHO recommendation and guideline. The first zone is the low risk area, called also green area, and the second area is the high risk area or red area. In between the green area and the red area, there are spaces like donning and doffing that are donning to enter, so to dress the PPE before to enter into the red area, and the doffing is to go out, so to remove like the PPE when you coming from the red area to the green area.
C'est vraiment une innovation. Ici, le circuit est tellement clair. Ça permet un bien-être pour les malades. Ils sont là dans des chambres individuelles et avec les installations individuelles. Mais nous, les prestataires, pour le bien faire, nous savons distinguer facilement la zone verte de la zone rouge. Nous pouvons agir en étant dans la zone verte. Nous pouvons poser des questions, avoir les paramètres vitaux. Ça nous diminue aussi le travail dans la zone rouge sous les PPE. Nous diminuons le nombre d'actes à poser que nous posons dans la zone verte en étant dans une tenue telle que je suis.
here the healthcare worker can constantly monitor the patient, but at the same time can manipulate the patient through this what we call glove box.
It's also important that family members can come and see their patients. They can sit here and talk to their patient. We can also invite symptom-free community members to see what's going on in the treatment center. So that can altogether improve the trust of a community in the treatment response, in the outbreak response, therefore can facilitate early detection of patients with suspected Ebola viral disease, and therefore overall can improve a comprehensive approach to an outbreak response.
The patient liner is dividing an HPT 24 square meter in 2 individual rooms. And these 2 individual rooms have both, transparent screen that allow the visibility of the patient from the green area. As you can see, I don't need to dress the PP. And the second is this cable port. This cable port allow the possibility to have biomedical devices within the green area. That is, of course, much faster if you need to intervene from the green area, for example, for fluid submission. But at the same time, it's very important for the disinfection of the biomedical devices itself.
Oto ba bongisi moto na moto chambre na ye. Yangunde baguso kotisa yokuna. Woi hotelemi na fenêtre wana osololi. Ona omona baminga ngo bazo soigner biso ba bazo kota na kati. Tozalaki komona bango te. Awo eza en tout cas awo eza bien. Awo babongisi bien.
Meet Srauding, the mother of newborn triplets. Like any mother, she wants to see her babies grow healthy and strong. Today, we'll see how health workers use the supplemental suckling technique to support infants with severe acute malnutrition as they continue to breastfeed. Before starting the process, the health worker must follow proper hygiene practices by washing the feeding equipment. Next, the correct amount of therapeutic milk is measured into a cup labeled with the mother's name to prevent any mix-up. After the preparation...
Good afternoon, ladies and gentlemen. Can we start to take a seat? Thank you very much. Madame et Messieurs, on peut commencer s'asseoir. May I kindly ask the ushers also to encourage delegates to get in the room. Thank you very much.
A good latch ensures the baby can breastfeed easily and get the maximum benefit from the feed. While the mother and baby get settled, the health worker carefully prepares the feeding tube, ensuring it's ready for the technique. It's completely normal if the baby pulls away or rejects the tube at first. When this happens, the health worker gently guides the mother and tries again until the baby becomes comfortable. Once the tube is secured with tape, the baby receives the therapeutic milk through the tube. The flow of milk can be adjusted depending on the baby's needs. Lowering the cup slows the flow, while raising the cup increases it. With the support of health workers, mothers can gain the confidence and skills needed to use the supplemental suckling technique. After the feeding is complete, the tube is gently removed. This simple method ensures vulnerable infants get the proper nutrition they need, all while preserving the irreplaceable bond and benefits of breastfeeding.
Nous sommes ici à Bunia, dans l'enceinte des centres médicaux évangélistiques de Bunia. À notre arrivée, l'hôpital, les collègues de l'hôpital étaient en train de gérer plusieurs patients suspects confirmés avec les moyens à disposition dans un bâtiment à l'intérieur de l'hôpital. On est arrivé à ouvrir les nouveaux centres de traitement de CME de Bunia. les personnels de santé arrivent chaque matin ou chaque soir avec leur habit privé, personnel. Avant de rentrer, ils doivent passer à côté de la buanderie où nos collègues ils assurent que chaque jour, on a à disposition des tenues et des bottes propres et désinfectées pour faire notre travail. À l'intérieur aussi, on a une pharmacie où les pharmaciens et les infirmières ils préparent les médicaments prescrits par les médecins et à donner à notre patient. On a la salle d'habillage, là où les personnels sanitaires, avant de rentrer dans la zone des patients ou la zone à haut risque, ils doivent s'habiller en utilisant l'équipement de protection individuelle. Et ensuite, comme on peut voir, on a la porte d'accès transparent vers les chambres du malade. Une fois terminées nos activités au sein de la zone à haut risque, la zone des patients, on doit sortir par les déshabillages. Là, on a tous les matériels, les dispositifs techniques à disposition pour se déshabiller en toute sécurité. On a des solutions chlorées, de l'eau savonneuse, les seaux avec les déchets et tout ça. Et à part d'avoir un poster avec toutes les instructions détaillées pour la réduction, on a aussi des collègues qui nous rappellent step by step.
Distinguished delegates, ladies and gentlemen, please take your seat. Can we have also the video off? We are about to restart the session. Thank you.
Où les patients ils pourront recevoir des soins sécurisés, humanisés et de qualité pour eux et aussi sécurisés pour les prestataires de santé et pour les communautés autour.
Saratani ya mlango wa kizazi ni ugonjwa ambao hauji tu ghafla ukawa ni saratani. Lakini bahati nzuri kwamba mama akigundulika mapema, mama anatibika na anakuwa salama.
Every woman and girl deserves a future free from cervical cancer. And together, we can make elimination a reality within a generation.
Can we take our seats so that we can start our afternoon session? Honorable ministers, distinguished delegates, ladies and gentlemen, let us now continue with an agenda item under Goal 4, that is agenda item 16, which is the draft proposed program budget 2028 to 2029, which is contained in document AFR/RC76/12. I invite Dr. Diallo, Director of Program Management, to introduce agenda item 16. Over to you, Dr. Diallo.
Thank you very much, Chair. Excellencies, honorable ministers, distinguished delegates, colleagues, it is my pleasure to introduce agenda item 16 on the draft proposed program budget 2028-2029. Our discussions. Can we please stop the video? It's over there.
Les cliniques mobiles
There's no one there.
permettent d'observer les populations éloignées des centres de santé, améliorer ainsi la
Sorry, distinguished delegates, we just need to stop the video so that we can proceed.
Please just bear with us so that we deal with the video that is playing.
Cela permet d'identifier les risques à
Thank you, Dr. Diallo. You can continue.
Thank you, Chair. It is my pleasure to introduce agenda item 16 on the draft proposed program budget 2028-2029. Our discussions during this regional committee have underscored how rapidly the health and financing landscape in our region is changing. At Monday's ministerial dialogue, your message was clear. Member states must remain in the driver's seat in setting their national priorities and defining the support they expect from WHO. WHO's work must be guided by the priorities you set. On Tuesday, you also adopted our regional framework for implementing Vision 2035. We must now ensure that our shared vision for Africa is fully reflected in our statutory mandates. The program budget provides that opportunity. It translates our strategic direction into priorities, resources, and results for 2028-2029, and will guide the development of our future work plans. The draft before you is guided by three principles: consolidation, focus, and impact. It is being developed progressively through consultations with member states and across all levels of WHO. It also introduces clearer and more country-specific ways of presenting the support expected from WHO. Dr. Imre Holo, our Global Director for Planning, Resource Coordination and Performance Monitoring, will explain these proposed innovations in greater details. The draft also builds on the commitment initiated by member states at the 75th World Health Assembly in 2022 to make WHO more independent and sustainably financed through increased assessed contributions. The African region has played a leading role in championing this effort. Your continued support will be essential to translate this commitment into reality. Your support and guidance today will help shape the next iteration of the program budget. The first complete draft will be considered by the 168th session of the Executive Board in January 2027, and subsequently by the 80th World Health Assembly in May 2027. I am pleased to invite Dr. Imre to present the proposal and the key issues for your consideration. Imre, you have the floor.
Thank you very much, Dr. Diallo, and good afternoon, dear member states and honorable chair. I would like to present you the draft proposed program budget for 2028-29. Can we go to the next slide, please? This budget is the last program budget of GPW 14, which is our medium-term strategy. And this budget represents the last of the series of budgets that were developed under this GPW. And as Dr. Diallo mentioned, the program budget has three main themes: consolidation, focus, and impact. Consolidation, because it is about finding the pieces together and moving ahead after a very turbulent couple of years that we just had in the organization. You know that due to financial pressures and because one of the key donor member states left the organization, we had serious financial issues and reduced the program budget for 26-27 by close to 800 million from 24-25. So now this budget does not reduce the budget further for 28-29. We're proposing a flat program budget, so exactly the same budget as in 26-27. And we believe that this framework will give us the right possibility to consolidate all our work appropriately. We will also focus, and we are forced to focus much more on our core mandate in that smaller envelope and on the agreed priorities as set by EU member states and on areas where WHO has a comparative advantage. And lastly, we are committing to deliver measurable impact. This is also nothing new. We've been on this journey over many years, but we would like to improve the measurement of our impact and of our actual delivery as we go along. And in 28-29, we would like to continue this journey. Next one, please. In terms of numbers, you see that the program budget is exactly the same as in 26-27, which is $4.26 billion. And the breakdown among major offices will not change either. So the African region allocation will remain a little bit over 1.1 billion. And with that, it is one of the biggest major offices, continues to be one of the biggest major offices with one of the biggest investments in WHO. There has been quite a discussion about whether this is the right amount or whether potentially we should further reduce. But looking at 26-27, despite all the challenges, we are 95% funded at this point in the biennium. So we're quite optimistic that we will be able to find and fundraise the required resources also in 28-29. And the real challenges remain much more about the alignment of these resources, that they're not always in the right place, but that I will address when we come to sustainable financing. Next one, please. Again, Dr. Diallo mentioned that this is the first draft of the budget and it will go through several other iterations. So we will go to all the regional committees with the draft proposed program budget. We listen to the input that the regional committees give us. We will revise the budget based on that guidance, and we will represent it to the Executive Board in January. And then, building on the guidance of the Executive Board, we will present the final proposed budget to the World Health Assembly in May 27. This means that along the way, you will have plenty more opportunities to shape and guide the budget so that nothing is carved in stone yet. And if something maybe escaped your mind and you would like to add it later, there will be plenty of opportunities to do that, as this is quite a long process with a lot of consultations in between. Next one, please. So basically what we're trying to say is that this budget is not trying to reinvent the wheel. It is trying to be very much based on 26-27, also because the budget envelope is the same. Having said that, there are some innovations in the budget, and I would like to highlight three of them from the list that you have in front of you. One, and I will go into that a little bit more detail, we will increase the focus on country offices by giving more information on the prioritization and the delivery in country offices through dedicated country pages as a digital annex to this program budget. The other element is related to UNAT and the global health architecture discussion. Clearly, the development of the program budget and the discussion on GHA are happening parallel, and we will have to reflect if there are any major implications or decisions emanating from that discussion. So right now we've created a placeholder. We don't know how it will impact the program budget, but we need to be nimble and able to adjust as we go along. And thirdly, there was one bookkeeping type of move. We moved the pre-qualification and the international non-preparatory names programs out of the base program and made it into the special programs budget segment as a separate line, which gives a little bit more flexibility to these programs, which are primarily financed through fees, and also gives more visibility to both of these programs. So it's a relatively small change, but nevertheless, just wanted to make sure that you're aware of that. Next one, please. Country pages. So we had country pages before, but they had just relatively basic information about the outcome of the prioritization process that happened between the WHO Secretariat and the partners in the countries. If you remember, the outcomes and the outputs which have been agreed to prioritize are indicated. Again, I have to say that these are not the same as the country priorities themselves. It is those priorities where you want to work with WHO. So you may have other priorities in health, but you think maybe other institutions or agencies are in a better place to address that. So it's really a reflection on where you want WHO's assistance and where you want WHO's collaboration. And what we're doing here now is we're trying to make this page a little bit more accessible and also easier to understand. So one of the key elements is that we would like to add a couple of bullet points in plain English or French or Portuguese of what are the key sort of strategic elements that you agreed with the Secretariat that you will focus on in 28-29. And of course, this can change. We understand that priorities change, but then we could constantly update that as we go along because it's a digital platform. Next one, please. The other important part is really from a smaller budget, we really need to focus on our core functions. And within the core functions, those areas where we believe we have comparative advantage. Based on discussions and on the results report in 24-25, we try to start this discussion, and we would welcome your input to that, on where WHO has the biggest advantage. And we found that convening role is one, the normative and technical role, and data and surveillance functions, which then all translate into a comparative advantage in country impact. And then in the country impact, all these elements form the technical assistance, the emergency response, and also health systems work. So we try to cut it in that way, and would be interested to hear what your thoughts are about that. Next one, please. In terms of financing, so as I said, we are cautiously optimistic that 28-29 4.2 billion can be funded. As of today, we are 49% funded of the base budget for 28-29, which is quite positive. There's 650 million volunteer contribution coming from the investment round pledges for 28-29, which are available. And there's $160 million in voluntary contributions in pipeline, which we hope has a good probability will materialize. But the biggest bulk of the funding from this 2.1 billion projected funding is 1.3 billion coming from SS contribution. So SS contribution is by far the biggest part of that available funding. And this 1.3 billion builds on the assumption, as Dr. Diallo mentioned, that the 20% AC increase, as was decided in 2022, continues. And that means that for 26-27, we will have another round of 20% AC increase, which will then make this budget financeable. The African region has played an unbelievably important and active role in making the AC increase happen already in 22. And I have some colleagues here in the room who were participating at that time in these discussions, and we're really grateful for that. But we cannot take it for granted that with every budget, this will happen. So I really would like to respectfully ask your continued support and your active push in all the global fora to make that AC increase a reality and have the next hurdle come again. And in that sense, I really think that this region particularly plays a very important role. Next one, please. So lastly, 3 questions for your considerations. Do you support the overall direction of the budget, meaning the flat budget and the no budget increase and no budget decrease? Second is that, do you have any comments now or maybe later about the comparative advantages of WHO? Especially, this is something we could use later in the UNAT GHA discussions. And can we count on your support on the 20% ACE increase? Thank you very much.
Thank you, Imre. Before opening the floor, allow me to briefly emphasize the importance of the ongoing prioritization process in the African region. This process gives member states the opportunity to shape WHO's agenda and focus of work for 2028-2029. Our objective is straightforward. The program budget must reflect countries' priorities and the areas in which member states believe WHO can add the greatest value, taking into account national context and the broader partner landscape. Consultation with member states to validate GPW 14 priorities are ongoing, but some clear signals are already emerging. We note that technical priorities have been largely maintained, reaffirming the areas in which countries continue to seek WHO's support. Communicable and non-communicable diseases remain important priorities alongside maternal and child health, primary health care, universal health coverage, and health security and preparedness. At the same time, countries are placing greater emphasis on strengthening the health workforce, ensuring sustainable health financing, building climate-resilient health systems, and making better use of data and digital technologies. Excellencies, as we open the floor, let me remind you of the questions that we have for you for discussion that Imre shared with you and that are still up on the screen. For our region, we would also welcome your guidance on the priorities that will define our work for the next biennium and to ensure that they reflect your most critical health needs and where you think that WHO can make the greatest contribution. With those questions in mind, I hand it back to the chair to open the floor for comments and discussion. Over to you, Chair. Thank you.
Thank you very much, Secretariat. I now open the floor to member states for interventions. You can raise your plates for observation. To start the ball rolling, we have Ghana, followed by the Gambia. Ghana, you have the floor.
Chair, Ghana thanks the Secretariat for the preparation of the draft proposed program, budget 2028 to 2029, and welcomes its emphasis on consolidation, accountability, impact, and sustainable financing. Ghana supports the overall direction of the proposed budget, particularly its continued focus on country priorities, UHC, health security, stronger health systems, and resource-based management. We are encouraged that the African region continues to receive the largest share of the base program budget, reflecting the significant health challenges and opportunities that exist across our continent. We also welcome the continued prioritization of health workforce development, health financing, digital transformation, emergency preparedness, and access to quality assured health products. For Ghana, these priorities align closely with our national health transformation agenda. Through the Accra Research Agenda, we are strengthening health systems, improving service delivery, and advancing digital innovation. We have also launched the Ghana Medical Trust Fund to improve access to care for persons living with chronic diseases and introduce the free primary healthcare program as a major step towards accelerating UHC and reducing financial barriers to essential services. Ghana knows with concern the significant financing gap that remains within the proposed budget. We therefore support continued efforts to strengthen sustainable financing, increase flexible funding, and ensure that resources are aligned with agreed priorities and country needs. A predictable and adequately financed WHO is essential to supporting member states in addressing both long-standing and emerging health challenges. We further encourage continued investment in areas that are critical to Africa's future, including health workforce development, emergency preparedness, local manufacturing, and digital health. These investments are indispensable for building resilient and self-resilient health systems. The Ghana supports proposed program budget 2028-29 and remains committed to working with WHO and member states.
Thank you, Ghana.
Thank you.
Let's stick to time, please. We give the floor to the Gambia. 2 minutes, please.
Thank you, Chair. The Gambia thanks the Secretariat for the comprehensive presentation of the draft proposed program budget 2028 to 2029 and commends the Regional Office for Africa for aligning regional priorities with the strategic direction of the 14th General Program of Work. We welcome the budget's emphasis on consolidation, focus, and impact, and support the Secretariat's effort to strengthen country-level delivery through the One WHO framework, guided by validated national priorities and WHO's comparative advantage. We appreciate that country priorities remain the primary driver of WHO's technical cooperation and note the ongoing light touch validation of priorities initially established in 2024 and validated during the 2025 alignment. In this regard, the Gambia wishes to inform the committee that its priorities for the program budget 2028 and to 2029 are being reviewed internally by the WHO Country Office in close consultation with the Ministry of Health and relevant national stakeholders. Following this review, we intend to formally validate these priorities to ensure that they reflect the Gambia's evolving health context. We encourage the Secretariat to ensure that the outcomes of the validation exercise across member states are transparently reflected in the Executive Board's version of the document, particularly in relation to resource allocation, country support, and expected results. The Gambia calls for continued support to strengthen national capacities, particularly in primary health care, sustainable health financing, and emergency preparedness, while reaffirming its commitment to closely working with the Secretariat to ensure successful implementation of the program budget. The Gambia takes note of the draft program budget and recommends that the Secretariat continue to finalize it through a consultative, transparent, and consensus-based approach. Thank you.
Thank you. We now give the floor to Ethiopia, followed by Tanzania. Ethiopia, you have the floor.
Thank you, Chair. Ethiopia thanks the Secretariat for the draft proposed program budget and welcomes its emphasis on consolidation, focus, and impact. We support the decision to retain the GPW14 results framework. Ethiopia attaches the greatest importance to the validation of country priorities. We welcome confirmation that these remain the primary basis for the program budget and that the validation now underway will inform outcome scopes, costing, and strategic resource allocation. Ethiopia will engage through the WHO Country Office. Our principal request concerns the financing outlook. Ethiopia asks that the Executive Board version provide a clearer indication of how financing gaps are expected to affect major offices, including the African region, so that member states can plan realistically. We also support continued efforts to increase flexible, unearmarked voluntary contributions, which are essential for allocating resources to areas of greatest need. Ethiopia requests envelope for the African region remains unchanged. In a region experiencing more than 100 significant public health events each year, We invite the Secretariat to confirm that an unchanged indicative envelope reflects the region's risk profile. Finally, Ethiopia as the future program budgets present the costed implications of regional frameworks alongside global mandates so that this committee can see what it commits to at the moment it commits. Ethiopia supports the direction of the draft and will contribute actively to its refinement through the consultation process. Thank you, Chair.
Thank you, Ethiopia. Tanzania, you have the floor, followed by Zambia and then Eswatini.
Thank you, Chair. The United Republic of Tanzania thanks the WHO Secretariat for presenting the draft proposed program budget for 2028-2029. Tanzania recognized that the program budget is one of the most important instruments for translating the priorities and commitment of our member states into concrete action. We also believe the program budget will adhere to principle of leaving no one behind by integrating equity, gender, human rights, and addressing social environmental determinant of health. It is noted that the assumption for the drafted proposal program budget for 2028 relies heavily on the approval by member states to increase the assessed contribution by 20%. Therefore, we welcome the opportunity to contribute to its further refinement to ensure that the final budget is responsive to the realities and priorities of the member states' country's needs. Chairperson, Tanzania believes that the drafted proposed program budget 2028-2029 provide an important opportunity to reinforce WHO as a strong, effective, and member state-driven organization. This is aligned with the developed health sector transformation plan for Tanzania. As we move toward finalization of the program budget, Tanzania encourages continue consultation of the member state to ensure that the final proposal reflects our collective priorities and reality. We reiterate on our commitment to our working constructive with WHO Secretariat and fellow member states to strengthen sustainable financing, improve efficiency and accountability, and ensure WHO resources generate maximum impact at a country level. The United Republic of Tanzania supports the drafted proposed program budget for 2028-2029 and looks forward to further refinement through continued member state engagement. Let us ensure that every investment made through the WHO contribute to stronger health system, greater equity, and better health outcomes for people we serve. I thank you, Honorable Chair.
Thank you. Can we have Zambia, followed by Eswatini?
Zambia would like to thank the Regional Director and the WHO Secretariat for presenting the draft proposed program budget for 2028-2029. We support a budget that translates member states' commitment into measurable health outcomes and strengthens WHO's response to the evolving health needs of the African region. For Zambia, the budget must focus on country ownership, equity, primary health care, and universal health coverage. The region faces significant health challenges, including non-communicable and infectious diseases, maternal and child mortality, and health emergencies. A well-financed and technically sound WHO is essential to address these issues. We welcome the focus on strengthening health systems, improving access to essential services, and addressing determinants of health. This aligns with Zambia's National Health Strategic Plan. We urge the Secretariat to ensure predictable financing, alignment with the national plans, and accountability for results. Zambia supports the draft program budget for 2028-2029, inclusive of the 20% increase. We look forward to its implementation for better health outcomes in the region. Thank you, Chairperson.
Thank you. Eswatini.
Honorable Chairperson, Excellencies, distinguished delegates, Eswatini welcomes the draft proposed program budget for 28-29 and thanks the Secretariat for its preparation. Chairperson, this budget matters to us directly. WHO's technical support underpins our efforts in universal health coverage, primary health care, workforce development, health information system, immunization, maternal and child health, HIV, tuberculosis, non-communicable disease, while strengthening surveillance laboratories climate resilient services, and emergency preparedness. For Eswatini, this support helps bridge the gap between policy and implementation, accelerating health outcomes. We have maintained a strong domestic commitment, allocating over 11% of the national budget to health on average over the medium term. With roughly 1/3 of health spending still coming from external partners, sustained WHO support remains critical, complement our domestic efforts and turn priorities into results. We therefore make 3 requests. First, that allocations to the African region and to country-level technical support be maintained and protected. Second, that financing be predictable and flexible. Highly earmarked funding may look generous on paper, but it constrains our ability to address identified priorities in given time period. Thirdly, that the differentiated support model be sustained so that small member states receive assistance shaped to their circumstances rather than to regional averages. We support the increase in assessed contributions as the most reliable route to a predictable resource organization, and we support strengthened performance monitoring and transparent reporting. Chairperson, the Minister of Health of the Kingdom of Eswatini affirms its full support for the adoption of the proposed program budget 28-29 and commits to working with WHO to ensure it delivers measurable results for our people. I thank you.
Thank you. We now give the floor to Mauritius, followed by Kenya, followed by Senegal. Mauritius, you have the floor.
Thank you, Honorable Chair. Mauritius welcomes the continued emphasis on outcome-driven delivery, country-level impact, and results-based management as the region moves to implementation. It is comforting that Africa's base program budget has been maintained at $1,139.6 million, the largest regional share, 27%, unchanged from 2026-2027. While the base programs, which underpin country-level cooperation, remain flat, we note that only 43% is funded from flexible earmarked sources. This is the funding category in which small upper-middle income states like Mauritius depend most heavily. As an upper-middle income sits, Mauritius finds itself with more limited access to earmarked and voluntary contributions. Our vulnerabilities persist and intensify nonetheless. Limited economies of scale and climate-related health risk. We are therefore disproportionately reliant on WHO's flexible resources. Mauritius reaffirms its support for the proposed 20% increase in assets contribution for 2028-2029. As predictable, flexible co-financing benefits SIDS disproportionately. We also welcome the continued prioritization of climate-resilient health systems, emergency preparedness, and financial protection, all directly relevant to SIDS realities. In this spirit, Mauritius honored its pledge to the WHO investment round for GPW 14, contributing $110,000 this year. As we move toward the last program budget of GPW 14, we find ourselves at a defining moment. We must demonstrate courage and vision, not only in how we fund health priorities, but also in how we lead transformative change across the sector. United in purpose and action, we can achieve this goal, and we will. I thank you for your attention.
Thank you. Kenya, you have the floor, followed by Senegal and then Namibia.
Thank you very much, Chair. Kenya thanks the Secretariat for the draft proposed program budget for 2028-29 and supports the emphasis on consolidation rather than the restructuring. After a period of considerable disruption, stability will be of great value to this region. Chairperson, let's speak arithmetic. The base program is $4.26 billion. Projected financing is $2.1 billion. That's 49%. The gap is therefore 2.15, more than half the budget before even the biennium has begun. The Africa region is allocated $1.1 billion for the base programs. That's 27% on the global base budget, and headquarters is allocated 26%. Kenya notes this without complaint. but with one observation, that even as we support and maintain the GP14 framework, this region continues to carry the highest burden of need and disease in the world, and its allocation remains unchanged for the current biennium, from the current biennium. We therefore have two asks. First is that flexibility matters just as much as volume. Most voluntary contributions remain earmarked, and earmarked money cannot be strategically allocated. Kenya asks the Executive Board's version report what proportion of the Africa region's allocation is expected to be flexible. Secondly, a budget approved is not a budget financed. Kenya asks the regional office to report to the 77th session the actual financing received against the regional allocation. If we are to plan honestly, at country level, where we require WHO support in country, we must know what is funded and not only what is budgeted. Kenya supports the transmission of this draft program, and we continue to work with the WHO country office and the regional office. I thank you.
Thank you, Kenya. Senegal, you have the floor.
Thank you, Chair. Chair, Honourable Ministers, distinguished delegates, Senegal congratulates the Secretariat on preparing the draft proposed programme budget for 28-29. We welcome the fact that the priorities and needs of countries have been taken into account in the draft proposed programme budget. To this end, we organised a consultation with all stakeholders in Senegal to incorporate the health priorities and reforms set out in the National Health System Transformation Strategy. Senegal recommends that the version to be submitted to the EB clearly set out how the approved national priorities translate into outcomes, outputs, deliverables, cost estimates, and budget allocations. It is also important to ensure equitable funding across countries through a transparent financing plan that illustrates by WHO region and by outcome the relationship between the approved budget, projected funding, flexible resources, shortfalls, and implementation capacity. With regard to funding flexibility, Senegal reaffirms its commitment to increasing its compulsory contributions by 20% and suggests that other member states do the same, ensure the prompt payment of dues, expand core and thematic voluntary funding, and contribute to diversifying the pool of contributors. Furthermore, the commitments made as part of the investment cycle must be fulfilled. Senegal calls for greater accountability and a clearer link between resources and results through the use of KPIs. In conclusion, Senegal takes note of the draft proposed programme budget and recommends that the Secretariat continue to draw it up using a consultative and consensus-based approach. The success of the programme budget must be judged on the merits of its measurable and equitable impact on countries and communities. Thank you.
Thank you, Senegal. Namibia, you have the floor, followed by Guinea.
Thank you, Chair. Namibia commends the Secretariat's efforts towards sustainable financing and for this draft program budget. We note with appreciation that the African region continues to receive the largest allocation of the base program budget, reflecting a good understanding of the scale of health needs and WHO's operational presence across our region. Namibia notes with concern, though, that headquarters continues to receive the largest overall financial allocation. It would be helpful to understand why headquarters is allocated over 50% of the funds earmarked for polio eradication. These critical resources must be decentralized and directed to the regional and country offices that are hardest hit and actively fighting these outbreaks on the front lines. Additionally, Namibia notes that the allocation for special programs in Africa remains strictly flat at $4.2 million, whereas headquarters sees a substantial increase from $143.5 million to $208.5 million. It would be helpful to understand what justifies this disparity and how does centralizing these funds serve country-level needs. Finally, Namibia supports the success of the investment round. We encourage all member states to make pledges to secure sustainable financing for WHO. Importantly, we urge those who have made pledges to convert these pledges into honored financial commitments. By aligning resources directly with country-level needs, we can ensure WHO is fully equipped to support resilient health systems across our region. In closing, we support the 20% increase in member state assessed contributions, along with voluntary contributions that must be predictable and flexible. I thank you.
Thank you. Guinea, you have the floor, followed by Mauritania.
Merci, Monsieur le Président.
Thank you, Chair. Ladies and gentlemen, ministers, delegates, we'd like to congratulate the Secretariat on the draft proposed program budget on its result-based approach. These reflect the reforms undertaken by our government. We have our national committee that, through a decree, is also working on different sectors thanks to a group that is thematic in nature. We want to have sustainability in performance and accountability across all health policy in accordance with GPW14. However, this means strengthening planning, capacity building, production of data, and a whole series of other areas that require investment for health. It is good to see the large allocation of the budget to Africa, but there is a shortfall of 51% that worries us in particular, because we know that there are lots of countries that face emergency situations and have budgetary constraints. For us, we cannot measure the results of the draft proposed program budget only on numbers, but also have to focus on sustainable progress for our populations. We hope that we will continue to have WHO be an agile partner that is close to national realities, helping us deal with health emergencies. Finally, we support the adoption of the draft program budget and will continue to help implement this draft proposed program budget in a spirit of transparency and collective effort on behalf of our citizens. Thank you.
Thank you, Guinea. Can we have Mauritania, followed by Lesotho?
Merci.
Thank you. Chair, Mauritania would like to thank the WHO Secretariat for the draft proposed program budget 2028-2029. We welcome the continuity with regards to the previous biennium and the results-based approach focusing on impact at country level and sustainability. We are satisfied to see that the priorities retained reflect the challenges we face, strengthening UHC, PHC, human resources, digital transformation, resilience in the face of climate change as well. It is good to see the allocation for Africa, 27% of the base program budget. At national level, we have undertaken important reforms to strengthen our health system. Progress has been achieved in PHC, capacity building of human resources, preparedness for emergencies, and progressive digitization of our systems. We are also making efforts to improve the financial protection of populations and step up implementation of UHC for the next few years, and our priorities will focus on capacity building in the health districts, improving our services to ensure quality, greater mobilization of domestic resources for health, strengthening of systems to deal with emergency situations and climate crises. And so we are aligned with the strategic objectives proposed by the draft proposed program budget. We want to continue seeing predictable, sustainable financing that is flexible. We encourage the institution to continue focusing on transparency, efficacy, and the focus on results-based approach. We ask WHO and partners to help us implement this proposed program budget for 2028-2029. Thank you.
Thank you. Lesotho, you have the floor.
Thank you very much, Chair. The Kingdom of Lesotho welcomes the proposed program budget for 2028-2029 and its focus on sustainable financing and measurable country-level impact. As a proud proponent of Resolution WHA 77.5, Lesotho welcomes the estimated 167 million US dollar allocation to accelerate progress in reducing maternal, newborn, and child mortality. Effective implementation is both a health priority and a moral imperative. No woman should lose her life while giving life, and no child's future should be determined by where that child is born. We also welcome the 617 million US dollars allocation to universal health coverage under Resolution WHA 76.4, the most highly costed mandate. This rightly reflects the importance of strong, resilient, and people-centered health systems. We further appreciate that the African region received the largest share of the base program budget, recognizing the scale of our health needs. However, equity must guide not only the language of the budget, but also resource allocation and implementation. Lesotho therefore calls for explicit recognition of geographically disadvantaged countries, particularly the landlocked and geographically dependent states. These realities must inform program planning, resource allocation, procurement, and supply chain support. Equity does not mean treating every country identically. It means providing differentiated support according to the barriers each country faces. Lesotho supports the proposed budget program and looks forward to its full, predictable, and equitable financing, translated into tangible improvements in the lives of women, newborns, children, and all the people across our region.
Thank you, Lesotho. Thank you. We now give the floor to Madagascar, followed by Togo, and followed by Sierra Leone. Madagascar have the floor.
Merci. Thank you, Chair. Excellencies, ladies and gentlemen, Madagascar would like to thank the Secretariat for preparing this draft proposed program budget 2028-2029. We applaud the accent on predictable financing and the results-based approach, but a 51% shortfall in the base program cannot be filled by goodwill. We need collective mobilization and an increase in flexible funds that are not fragmented. We urge the budget to give priority and more resources to prevention and the fight against communicable diseases in accordance with the decisions of WHO and the 2025 UN political decision. Communicable diseases represent an important increase in deaths in the region and increase the vulnerability of our health systems in the face of epidemics. We need to invest in prevention. That means investing in resilience and health security in Africa. We also request that particular attention be given to island nations and to vulnerable countries where there are specific needs that should be taken into account in the strategic allocation of resources. Chair, Madagascar supports the increase in assessed contributions and ask that our partners reduce exclusive attribution of voluntary contributions, so earmarked contributions. We need realistic, equitable financing that is country-focused, that is assessed based on real impacts and in accordance with the health index of our populations. Thank you.
Thank you. We now have RC.
Chair, Togo would like to thank the Secretariat for presenting this draft proposed program budget 2028-2029 and welcomes its results-oriented approach, which is aligned also with the region's health priorities. Togo supports the three strategic priorities, that is UHC, health emergencies, and the promotion of healthier populations. Against a backdrop of limited resources, inflationary pressures, and declining external funding, Togo emphasizes the importance of increased resource mobilization and the equitable, efficient, and transparent allocation of resources for the benefit of member states. Togo encourages the Secretariat to strengthen the mobilization of domestic and external resources, whilst ensuring equitable distribution that takes into account the specific needs of countries. Chair, Excellencies, Honourable Ministers, distinguished delegates, and guests at this august assembly, Togo takes this opportunity to reiterate its invitation to member states to attend the regional conference on UHC, which will be held in December 2026. The official invitation will be sent to you in the near future. We take note of this draft proposed programme budget and support its adoption. Thank you, Chair.
Thank you. Can we have Sierra Leone?
Thank you, Mr. Chair. Sierra Leone aligns itself with the African region's vision for sustainable, resilient, and equitable health systems. We welcome the draft program budget and the strategic directions outlined for the 2028 to 2029. For Sierra Leone, we aggressively drive down maternal and child mortality and build resilient health systems. This budget must translate into tangible impacts where it matters most. First and foremost, we will request the budget allocation aligns directly with our national priorities and plans, specifically strengthening primary health care, maternal, child, and adolescent survival, and local health security. The budget's allocation must actively support the institutionalization of sustainable health financing, operationalization of the health workforce investment chapter, to bridge critical shortages in frontline workers. We call for predictable, flexible funding that prioritizes high-burden, vulnerable contexts to build resilient systems. Sierra Leone remains fully committed to support the adoption of the draft budget, subject to transparent impact tracking and equitable country-level disbursement. Thank you.
Thank you. Can we have Democratic Republic of Congo?
Merci, Monsieur.
Thank you, Chair. We take the floor on behalf of His Excellency, the Minister of Public Health and Social Protection, who, for state reasons, could not attend. The Technical Secretariat of the Health Ministry would like to commend WHO for a very clear document, which is the draft proposed program budget 2028-2029. DRC has reviewed the draft PB 2028-2029 of the World Health Organization for the African region and notes that this budget amounts to 6.392 billion USD, and DRC accepts this draft proposed PB, which emphasizes sustainable and predictable funding. We note also the implementation of the decisions of member states for sustainable financing, the increase of contributions, and the strengthening on more flexible financing, alignment between priorities, resources, deliverables, and the goal being an effective implementation or execution of the budget for the 2028-2029 period. Finally, DRC approves this draft proposed program budget and would like to encourage member states to adopt it. Thank you.
Thank you very much for your valuable inputs. I now we move to non-state actors, and I give International Federation of Medical Students Association. You have the floor.
Honorable Chair, distinguished delegates,
A program budget is only as credible as its financing. WHO's proposed 2028-2029 base program is currently only 49% financed, leaving an estimated $2.159 billion gap. We ask member states and partners to contribute to closing this gap through mobilizing predictable and flexible financing while protecting equity-sensitive programs from underfunding. We further call for transparent resource allocation and public reporting that clearly links spending to measurable country-level outcomes, including progress on universal health coverage, health workforce capacity, and emergency preparedness. Young people and civil society should have meaningful opportunities to contribute to priority setting and accountability, especially where the budget decisions shape the future of health systems. A budget should not merely balance numbers, it should make agreed health commitments deliverables. Thank you.
Thank you. I see no more requests from the floor. Are there any comments from Secretariat?
Yes, Chair. We would like to provide some answers quickly before I come back and close. With your permission, I would like to invite Dr. Imre to summarize some answers on our behalf.
Thank you very much. I'll try to be brief. So first of all, I really would like to thank you for this incredibly active engagement and for the guidance that you have provided for the next iteration of the program budget. And we listened carefully, and we will try to implement your suggestions as much as possible. Secondly, also thank you for the strong support for the AC increase. This is incredibly important, and we do not take it for granted. So really, thank you for that support. Some reflection on some concrete elements. There was a question about why is half the budget of the polio program is sitting in HQ. The answer is that the outbreak and response envelopes, which are going to be distributed based on actual outbreaks, are sitting first in headquarters, and then as the outbreaks evolve, are distributed to the regions. So that's the reason for it. The second, there was a question about generally about the size of headquarters. And this is a little bit always a discussion, especially when we come to regional offices. And I don't want to judge what is the right size and whether it could not be further decreased. But I just would like to recall that headquarters together with Euro were the two major offices that went through the biggest realignment, where the biggest reductions both in budget and also in staffing happened over the past couple of years. So I think it's important to stop now, consolidate, relook, and then maybe further investigate whether some functions could be further distributed to the regions, or this could change. And the last point, you asked for more details for the program budget in January, which we are absolutely going to provide, particularly after the validation of the prioritization, when you will agree with the Secretariat on what will be the outcomes and outputs that will be supported. They will be costed out, and that will be reflected in further iterations of the program budget. However, no matter how useful it would be, the financing, especially at a lower level, we will not be able to show you either in January or at WHA, because most of the predicted funding, even when we have it, we do not know how it will break down to major offices or even to lower levels. However, the program budget is always discussed at the governing bodies together with a snapshot of how we're doing in 26-27. And there we can give you a lot of details about in this biennium where financing is going, how flexible funds have been allocated. So I think that discussion can really inform the debate of the program budget that happens after that. So we will do our best, but I would like to tell you in advance that if we don't have that data available, we will not be able to provide that. Thank you very much again for your support.
Thank you, Imre. Chair, Excellencies, Honorable Ministers, distinguished delegates, the Secretariat would like to thank you for your valuable guidance and contributions. We can assure you that your views today will inform the program budget 2028-2029 and help define the support that member states expect from WHO in the next biennium. The way forward is very clear for us. Together, we will complete the prioritization with member states in the driver's seat. You will review and refine the country pages to ensure they accurately reflect your priorities and expectations of WHO's support. We will consolidate the results of these consultations and present them on behalf of the region. Together, we will ensure that our priorities remain firmly grounded in country needs and aligned with the regional framework for implementing Vision 2035. Thank you once again for your engagement and guidance. Je vous remercie. Merci.
Thank you.
I note that the Secretariat has taken note of the comments raised. Is the Regional Committee ready to note the document AFR/RC76/12 titled Draft Proposed Program Budget? I see no objection. It is so decided.
The next item on our program of work today is Agenda Item 17, Draft Provisional Agenda, Place and Date of the 77th Session of the Regional Committee, Document AFR RC 7613. Firstly, we will consider the Draft Provisional Agenda of the 77th Session of the Regional Committee. Are there any comments from distinguished delegates? I now call for any comments from distinguished delegates on the dates of the 77th session. Finally, I invite comment on the place of the 77th session of the Regional Committee. Allow me to remind you that criteria for selection of a member state desirous of hosting a session of the Regional Committee was applied to determine that the place of the 77th session of the Regional Committee during the RC74, following the unprecedented use of a secret ballot to select the host of RC75, member states called for the establishment of a transparent, equitable, and predictable process for selecting fourth host country. This led to the adoption of RC75 in Lusaka of a formally eligibility of selection criteria as set out in Annex 2 of document AFR RC75-2 and adopted through AFR RC75 Decision 4, under which the Program Subcommittee reviews applications and makes recommendation to the Regional Committee for a final decision. In accordance with the approved process and timeline, for the Regional Director issued a call for expression of interest on the 21st May 2026, inviting member states to submit applications to host RC77 by the 25th of July 2026. Following the regional director's technical assessment and implementation of approved eligibility and selection criteria, including geographic rotation, and program subcommittee also held a virtual meeting on the 6th of August 2026 and agreed to recommend the Republic of Guinea to host the 77th session of WHO African Regional Committee for Africa RC 77. Are there any comments on the suggested proposal? I see no comment. That is, there are? Kenya, okay. Kenya, you have the floor.
Thank you very much, Honorable Chairperson. Kenya warmly supports the Republic of Guinea as a host of the 77th session of this regional committee. Guinea offer is very generous and timely, and Kenya pledges its full support and cooperation in making that session a success. We look forward to meeting in Conakry. Chairperson, Kenya also wishes to register an early interest of its own. Kenya would be honored to host a future session of the committee, either the 78th or the 79th session, in accordance with the rotation agreed among the sub-regions of this region. We shall adhere to the set out criteria of application to the regional committee. We say so now rather than later, so the Secretariat and the member states have time to plan, so that in whichever year the rotation indicates, Kenya is ready to host. I thank you.
Thank you, Kenya. Noted. I see no comments, so the decision as proposed is hereby adopted. Guinea, you have the floor.
Merci, Madame la Présidente.
Thank you, Madam Chairperson. Madam Chairperson, ladies and gentlemen, Excellencies, dear Ministers, I take the floor on behalf of the Minister of Health and Public Hygiene, who unfortunately faces a certain number of issues in country, or was prevented from coming due to some issues. I'm going to read her statement. Ladies and gentlemen, if distance is depriving me of the privilege of being with you physically today, let me at least say these words. Guinea is with you, is by your side, and it is with deep emotion and deep sense of responsibility that I speak before this assembly. What I have the honor of announcing here is not just a formality, it's not just a calendar issue, it is a sign of trust, the trust that our region is expressing towards our country, Guinea. You are entrusting us with the organization of the 77th session of the Regional Committee of WHO in Conakry in 2027. It's the very first time since in the past 50 years. On behalf of Mamadou Doumbia, President of the Republic, on behalf of the government, the people of Guinea, I'd like to express our deep, profound gratitude. Receiving our region is receiving Africa. It is solidarity, it's ambition, and we value this honor and the importance of this opportunity for Guinea. Let me explain further. A bit over 10 years ago, one of the worst Ebola outbreaks started in one of our provinces in Guinea. We saw families be decimated. We had to bury health workers who are at the front lines, respecting their hypocritical sermons or pledge. We have not forgotten what happened 10 years ago. We have not forgotten the solidarity. Many of your countries paid the price for solidarity back then. We are we built a conviction after this pain and set up a response following this outbreak. We established an emergency mechanism. We strengthened what needed to be. And we established competent institutions, early warning systems. And when in 2021, there was a new outbreak knocking at our doors, for the very first time, we also had Marburg in West Africa, and we were more prepared and faced this new outbreak with more resilience. And under the leadership of our President Mahmoud Doumbia, Guinea strived to go further through the Simandou 2040 program. Our country has placed health and the well-being of our population at the core of our national transformation. This ambition hopes to bring about a Guinean health system that will be closer to each Guinean. Simandou 2040 is not only to us development ambition, it's not only economic, it's also the hope of a Guinea where we'll be able to protect life, to prevent disease, and to guarantee access to quality healthcare to each citizen, because the true wealth of a nation is first and foremost the health of its peoples. Ladies and gentlemen, this is what it means to us that you chose Conakry. Where a tragedy started is also where the continent can get together to think about its health sovereignty or to reflect on it. Africa cannot be defined by the challenges it faces. It's defined by what it does. And resilience is not a mere word. It is the way to transformation and hope for Guinea. 2027, when we meet, will also be a turning point for our region. When traditional health financing is dwindling, when you have new demands for autonomy, more present than ever, our regional director is calling upon us, quite rightfully, to build more sovereign health, stronger institutions, and a more active African solidarity. Conakry 2017 will have to be the forum to express such ambition. Guinea commits to make it worthy of this honor. Let it be the opportunity for Africa to express its will to find solutions and become responsible for its health destiny. Dear ministers, delegates, Guinea awaits. It awaits with the warmth of its hospitality, the pride in its history, and also its new ambitions. Will do our utmost, and that is my personal commitment. I'll make sure that you feel not like guests, but that you feel at home in your African family. Ladies and gentlemen, we do not measure peoples by its challenges, but by its capacity to get up after it falls, capacity to transform and take others by the hand. We are transforming under the aegis of our president and with our Simandou program, and we're calling all of Africa. Let's meet from August 23rd to 27th, 2027 in Guinea-Conakry. Long live WHO, long live sovereign Africa, healthy Africa, long live the Republic of Guinea. Ladies and gentlemen, this is the speech of our Minister of Health and Public Hygiene. I spoke on her behalf during this very solemn occasion, and I'm very proud that I got to do so. Thank you very much.
I'm sorry. Condolences from us on the recent accident. Thank you, Guinea, again. Distinguished delegates and guests, we have now come to the section on the information document under Agenda Item 18. Given that there are 17 information documents that will need to be considered under 3 different goals, I would like to propose that we take the document in 3 different batches according to their goal, and kindly indicate which document you are commenting on when you take the floor. May I also remind you to please be brief on your comments. You are now invited to present your comments on the following agendas under Goal 1, Promoting Health, Agenda Item 18.1 to 18.2. I now invite member states wishing to provide comments to do so by raising their nameplate. The floor is now open. Goal 1, promoting health agenda item 18.1 and 18.2. Okay.
There's no request.
I see no requests from member states. I now pass the floor to observers, starting with member states from other region, UN and other IGOs to make their statement on the progress report. You can indicate on which agenda you're referring to, and you're allowed to raise your nameplate. Okay, Sierra Leone, you have the floor.
Thank you very much, Madam Chairperson. I'm making comments on 18.1. Honorable Ministers, Excellencies, distinguished delegates, ladies and gentlemen, Sierra Leone welcomes the progress report on the updated regional strategy for the management of environmental determinants of human health in the Africa region. We recognize that climate change, unsafe water and sanitation, poor hygiene, and other environmental risks continue to threaten the health and well-being of our population. We commend WHO and member states for advancing this important agenda. In Sierra Leone, we have made significant progress in institutionalizing climate health. We have completed and launched our climate health vulnerability assessment, established a dedicated climate health program, and created a multi-sectoral platform and technical working group. We have also strengthened climate-informed disease surveillance and early warning systems across all 16 districts and are advancing the development of a national health adaptation plan. We have also prioritized WASH in healthcare facilities through WASH fit model. We have assessed a significant number of facilities in some districts, developed improvement plans and costed investment plan, and issued national guidance to support standardized implementation. We are now expanding these interventions towards nationwide coverage. These achievements demonstrate the importance of strong leadership, multi-sectoral collaboration, evidence-based planning, local ownership, sustainable financing, and scaling up proven interventions. Sierra Leone calls for continued support and collaboration to strengthen resilient climate-informed health system and accelerate access to environmental health determinants in the country and the region as a whole. Thank you, Madam Chairperson.
Thank you, Sierra Leone. Now the floor is open for NGOs. Okay, still countries. Mozambique, you take the floor.
Muito obrigado.
Thank you very much, Chair, for giving us the floor. Mozambique welcomes the report presented and congratulates the Secretariat for the presentation of this document. We have been strengthening our response to the environmental determinants of health, and we are implementing the Health National Adaptation Plan, focusing on climate change and trying to strengthen our WASH services through WASH Fit in our health facilities, developing national rules as well. We're strengthening environmental vigilance, integrated monitoring systems, and EPR. We are also finalizing in our parliament the environmental health strategy that will help us strengthen governance, multi-sectoral coordination, and harmonization of action. We're focusing on sustainable finance, WASH infrastructure, environmental surveillance, air quality, good management of chemical products, and capacity building at a technical level. We adopt the report and commit to implementing the 2022-2032 regional strategy. We urge you to approve the report and to provide support, and that is both technical and finance, so we can step up implementation of these priorities in all member states. Thank you.
Thank you. The Gambia.
Madam Chair, on agenda item 18.1, the Gambia welcomes the progress report on the implementation of the updated regional strategy for the management of environmental determinants of human health and commends WHO and member states for advancing action on climate change, water, sanitation and hygiene, air quality and environmental health across the African region. Environmental determinants continue to contribute significantly to the burden of disease, underscoring the need for stronger multisectoral action. The Gambia is encouraged by the progress made in climate and health adaptation, surveillance, and WASH interventions. We are pleased that the Gambia is among the countries that have conducted climate change health vulnerability and adaptation assessments, mobilized commitments towards climate-resilient health systems, improved WASH services in health facilities through the WASH Fit approach, strengthened disease prevention efforts, and advanced environmental health actions. Despite these gains, challenges remain, including limited financing, air quality monitoring gaps, climate-related health risks, and the need for stronger integrated monitoring systems. The Gambia therefore supports sustained investment in climate-resilient health systems, safe water and sanitation, environmental surveillance, and multisectoral collaboration. We reaffirm our commitment to working with WHO and partners to accelerate implementation of the strategy and protect communities from environmental health threats. Thank you.
Thank you. Since I see no request for the floor from Lesotho.
Thank you, Chair. The Kingdom of Lesotho welcomes the progress report on the updated regional strategy for the management of environmental determinants of human health in the African region 2022-2032. We appreciate WHO's continued leadership and support and reaffirm our commitment to addressing environmental determinants that continue to affect the health and well-being of our population. While the region has made progress, environmental health challenges remain significant. Climate change is an increasing threat to health and sustainable development in Lesotho. Drought, floods, heavy snowfall, and other extreme events continue to affect communities, livelihoods, and the delivery of health services. Lesotho has recently strengthened national capacity on climate change and health, and our next priority is the development of a health national adaptation plan to guide a coordinated response to climate-related health risks. Environmental pollution is an important public health concern. Household air pollution remains widespread, with 88% of households relying on polluting fuels for cooking. This underscores the need for a stronger multi-sectoral approach to reduce exposure and promote cleaner household energy. Lesotho has made important progress in strengthening the policy and strategic framework for water, sanitation, and hygiene. The country has adopted WHO WASH Fit Guide and conducted a national assessment of WASH services in healthcare facilities. Key guidance documents include the National Health Hand Hygiene Strategy, Menstrual Health Hygiene Guidelines, and WASH in Healthcare Facility Guidelines. I thank you.
Thank you. Angola.
Thank you very much, Excellency, Chair. Angola recognizes that environmental determinants are central to health and the well-being of populations, particularly in the context of climate change, human population growth, and growing pressure on natural resources. Inadequate access to drinking water and sanitation, exposure to pollution, to hazardous chemical products, and other environmental risks still disproportionately affect the most vulnerable populations. The regional strategy 2022-2032 is aligned with our national priorities to focus on surveillance of environmental determinants, improve water and sanitation management, reduce and control exposure to pollution and to hazardous chemical products, and producing information on environmental risks, integrating it into our health system. We recognize the strategic role of education and of focusing on health to create more resilient, participative communities. The priorities are aligned with our national strategy for 2022-2050. We welcome the One Health approach, which focuses on man, the environment, and the animal world with an integrated approach to risks for health, so as to deal with these issues. I highlight our national plan, a strategic plan for 2025-2030. We consider it essential to focus on regional cooperation on matters pertaining to animal and human health. We support the adoption of the document being analyzed. Thank you.
Thank you, Angola. So now I will move to several non-state actors who have requested to deliver the statement on the agenda items 18.1 and 18.2. I'll start with World Heart Federation. World Heart Federation, you have the floor.
Honorable Chair, distinguished delegates, air pollution is now widely recognized as a leading cause of heart disease, with cardiovascular conditions accounting for nearly 70% of premature deaths attributable to outdoor air pollution. We also welcome the recognition of lead pollution as a significant contributor to cardiovascular disease. Alarmingly, over 90% of air pollution-related deaths occur in low and middle-income countries. In particular, ambient and household air pollution contributes to more than 600,000 deaths each year across the African region. Therefore, World Heart Federation urges member states to adopt and implement the WHO Air Quality Guidelines 2021, implement recommendations from World Heart Federation's World Heart Report 2024, especially strengthening air quality monitoring, phase out fossil fuel use and subsidies, and negotiate a fossil fuel non-proliferation treaty, and translate international agreements and initiatives on climate change and health, such as the UNFCCC and Libreville Declaration, into national and regional policies and strategies. Thank you, Madam Chair.
Thank you. Nigeria, you have the floor.
Progress report, Go 1, 18.2. Distinguished Chair, Honorable Ministers, Excellencies, and colleagues, Nigeria welcomes the progress report on the global strategy for women, children, and adolescent health, and reaffirm our strong commitment to the Thrive and Transform objectives. Our reproductive health and family planning programs are expanding, supported by interministerial platform that strengthens leadership, accountability, and domestic investment. Yet, challenges remain: high mortality rates, subnational inequities, malnutrition, financing gaps, workforce shortages, and weak health information systems. Nigeria therefore urges member states to accelerate equity-focused implementation, institutionalize gender mainstreaming, and improve data systems with disaggregated information. In conclusion, Nigeria remains steadfast in ensuring that every woman, child, and adolescent not only survives but thrives and transforms. Achieving the 2030 targets will require renewed commitment to equity, quality of care, sustainable financing, stronger health systems, and multi-sectoral collaboration. I thank you.
Thank you, Nigeria. Public Service International, you have the floor.
L'International des
Public Servants International congratulates the Secretariat's work on environmental determinants. In Africa, the climate crisis is also a true health crisis, but it's only part of the environmental issues we face on the continent. Over 1 million people don't have access to drinking water, and hygiene and sanitation still need to be focused on in health facilities. We need stronger political will to better integrate environmental determinant considerations into development in this field. Distinguished delegates, we need to focus on the urgency of these matters. We see what has just happened in Nepal, which is but an example of the dangers that lie ahead. We insist on the need to strengthen our public services so they become robust. We need to focus on environmental determinants of human health, and these cannot be only for a limited minority. Thank you.
Thank you. International Federation of Medical Students Association, you have the floor.
Thank you, Chair. Chair, Your Excellencies, environmental risks accounts for an estimated 23 to 25% of the disease burden in the WHO African region, while air pollution alone contributes to over 600 deaths annually. The IFMSA, representing 133 national member organizations and over 1.5 million medical students, welcomes the progress made under the 2022 to 2032 regional strategy, but urges member states to accelerate implementation through costed environmental health investment plans, stronger climate-resilient wash systems, and enforceable air quality standards. We further call for integrated climate health monitoring that links environmental exposure, wash, disease surveillance, and early warning data, particularly for vulnerable and climate-exposed communities. Additionally, health professionals should be equipped to recognize environmental determinants of disease and contribute to prevention, surveillance, and community engagement. Protecting health in Africa increasingly means protecting the environments in which health is made or lost. I thank you, Chair.
Thank you. NCD Alliance, followed by West African Alcohol Policy Alliance. NCD Alliance, you have the floor.
Agenda 18.2. The NCD Alliance and the Africa NCD Network appreciate the opportunity to make this statement on progress against the regional alcohol action plan. Alcohol use is a preventable NCD risk factor. While the global alcohol action plan and safer package provide cost-effective measures, implementation in Africa remains slow amidst growing industry influence. Member states and WHO Afro should accelerate safer implementation, particularly taxation, marketing, and availability restrictions, while protecting policy from commercial interference. We respectfully call to the member states to strengthen and accelerate implementation of the WHO Afro Alcohol Action Plan by implementing alcohol-based buys, leveraging WHO safer initiatives, prioritizing excise taxes, availability and marketing restrictions, adapting policies to local cultural, religious, and socioeconomic contexts, strengthening cross-sectoral coordination across health, education, finance, and law enforcement, and finally investing in capacity building to scale up the prevention and treatment capacities of health and social care systems, aligning alcohol policy with UHC goals. Thank you very much.
Thank you. Movendi International, you have the floor. After WAPO.
Thank you, Madam Chair. Distinguished delegates and Madam Chair, WAPA, a member of the Global Alcohol Policy Alliance, commends WHO, Afro, and member states for the progress made in implementing the African framework for implementing the Global Alcohol Action Plan GAP. We are encouraged that the region has exceeded 3 of its 4 2025 milestones. These achievements demonstrate growing political commitment of member states and collaboration between WHO, CSOs, and development partners in advancing alcohol control. WAPA urges WHO Afro to enhance technical support to member states to meet the unachieved milestone of reducing per capita alcohol consumption. We also urge member states to strongly consider protecting alcohol policies from aggressive alcohol industry interference in the region. Finally, Madam Chair,
to safeguard present and future generations from alcohol-related harm, we urge the Regional Committee to consider development of a global legally binding mechanism on alcohol control to address emerging cross-border marketing, online sales, and smuggling to succeed the Global Alcohol Action Plan beyond 2030. Thank you very much, Chair.
Thank you. Movendi International, you have the floor.
Thank you so much, Madam Chair. Item Agenda 18.2. Movendi International congratulates the Secretariat and Member States showing that alcohol policy is possible. At the same time, we are the people facing the massive burden of alcohol harms in our families and communities across the continent. Alcohol harm is a major obstacle to sustainable development, adversely affecting 15 of the 17 Sustainable Development Goals. Bringing down population-level alcohol use and protecting alcohol abstention rates in our societies is key for African development. That's why we call for accelerated alcohol policy action as a health and development priority in Africa through full implementation of the WHO SAFER package. Movendi International stands ready to partner with WHO and member states to build the economic case for alcohol policy, protect our joint efforts for alcohol from alcohol industry interference, advance the alcohol-based buys, and raise alcohol taxes to build thriving societies in our region. Thank you.
Thank you, dear colleagues. We will now continue with agenda item 18 on information documents. Kindly indicate clearly which document you are commenting on again. May I remind you to please be brief on your comments. As you comment, you are invited to present on comments on the following under Goal 2, Providing Health, agenda item 18.3 to 18.11. I will now open the floor for member states. The floor is open for comments. Car, you have the floor.
Merci, Madame.
Thank you, Madam Chair. 18.3. The Central African Republic would like to thank the WHO for the progress report on the implementation of the regional strategy on diagnostic and laboratory services and systems 2023-2032. We welcome the progress achieved in the region in terms of governance, national laboratory policies, quality assurance, and capacity building. CAR has achieved significant progress in terms of laboratories. We've drafted a strategic plan, operationalized our laboratory network using the concept of One Health, strengthened technical capacity across the whole of the health pyramid. However, there are still significant challenges we face in terms of funding, human resources, equipment, reagents, and access to diagnostic services in primary health care. Our country gives particular attention to increasing domestic investment in laboratories and diagnostic services, ensuring that we retain the health workforce, especially in rural areas, the reagents and equipment, strengthening quality management services, diagnostic services, developing digitalization and information centers in our laboratories. We encourage WHO and technical and financial partners to strengthen their support to countries that have limited resources to help develop infrastructure, train personnel, and allow for access to diagnostic technology. We support the guidelines provided in the document and encourage their quick implementation. Thank you.
Gambia, followed by Tanzania.
Madam Chair, on agenda item 18.11, the Gambia welcomes the progress report on the implementation of the regional strategy for the integrated disease surveillance and response and commends WHO and member states for the significant progress made in strengthening disease surveillance, laboratory and outbreak response capabilities across the African region. The IDSR strategy remains a critical framework for improving early detection, reporting, and response to public health threats, while supporting the implementation of the International Health Regulations 2005. The Gambia continues to strengthen IDSR implementation through coaching and mentorship during monitoring and supervision, IDSR technical guidelines and other surveillance tools distribution, the regular publication of IDSR weekly bulletins, and the training of health workers at both the national and regional levels. The country has also made significant improvements to operationalize its public health emergency operations center, strengthen rapid response teams, laboratory quality systems, and emergency coordination mechanisms, thereby contributing to stronger preparedness and response capacities. Despite these achievements, challenges remain, including workforce retention, sustainable funding, the strengthening of community-based surveillance, and interoperability of digital health sharing platforms. The Gambia therefore supports continued investments in surveillance systems, laboratory strengthening, workforce development, and digital transformation to enhance epidemic preparedness and health security. The country affirms its commitment to working with WHO and partners to further strengthen disease surveillance and response capacities across Africa. Thank you.
Thank you. Tanzania, followed by Zambia.
Agenda number 18.9, Madam Chair, Region Director, Excellencies and distinguished delegates. Thank you, Secretariat. United Republic of Tanzania commenced and adopted the global strategy that emphasizing survival, thrival, and transformation to end preventable deaths towards Sustainable Development Goals 2030. Tanzania aligns and have demonstrated commitment by increasing the volume facilities, but also increasing CMOC facilities, and also the facilities for neonatal care. And this has been translated into a significant reduction of under 5 mortality rate, teenage pregnancy, also increased institution deliveries, and more than that is 80% reduction of maternal mortality that led to Her Excellency getting the Global Goalkeeper Award and later appointed as an African Union champion to provide leadership in reduction of maternal mortality. So through that, Tanzania endorses the strategy as the vehicle to accelerate the effort towards the Sustainable Development Goals 2030. Thank you.
Thank you. Zambia, followed by Liberia.
Agenda item 18.3. Honorable Chairperson, Zambia welcomes the progress report on the regional strategy on diagnostic and laboratory services and systems 2023-2032 and commends the Secretariat for establishing this valuable regional baseline. Chairperson, Zambia has already achieved full coverage of trained laboratory personnel at primary healthcare level, maintains a dedicated budget line for laboratory commodities and reagents only, has an approved national essential diagnostic list, and regularly reports to WHO on diagnostic systems. Zambia remains committed to sustaining these gains through continued laboratory staff recruitment and equitable deployment, extending domestic financing to cover laboratory services as well, conduct periodic review of the essential diagnostic list, and further formalizing our annual reporting mechanisms. To accelerate implementation of a national quality management system, Zambia is scaling up QMS implementation coverage for public health laboratories from 14 to 100% by 2031. This will be done by expanding the in-house developed minimum QMS package, as well as strengthening internal quality control and external quality assessment. Zambia is also committed to strengthening point-of-care testing systems, decentralizing mentorship, and rolling out in-house development, the in-house development One Health QMS curriculum to training institutions. Zambia is also in the process of establishing the Zambia Accreditation Agency, which will ensure sustainable accreditation services. Zambia calls on WHO and partners to prioritize technical support for QMS implementation to help close remaining gaps and accelerate progress towards the 2032 targets. I thank you.
Thank you. Liberia, followed by Mozambique.
Thank you, Madam Chair. Liberia is reporting on agenda item 18.9. In a spirit of regional solidarity and to change the 70% global maternal death contributed by the African continent, Liberia welcomes and calls for the adoption of the progress report on global strategy for women, children, and adolescent health implemented in the African region. Liberia launched the 365 days action plan to end preventable maternal and newborn death with support from the government and partners. Health and well-being can only be achieved through sustainable health financing. Thus, Liberia makes an effort to pass the Health Equity Fund and the Health Equity Authority Bill into law this year for a sustainable national health insurance scheme. Liberia called for peaceful coexistence of member states at all levels because conflict and fragility are major drivers of maternal and newborn death. Thank you.
Thank you. Mozambique, followed by Angola.
Thank you very much, Madam Chair, for having given us the floor. I would like to speak to report 18.3. We welcome this report on this topic. We are strengthening our laboratory network, improving diagnostic services, focusing on quality management, capacity building of professionals that work in laboratory environments, aware that this is important to detect diseases at an early stage. It's important for public health. We're strengthening our national laboratory network, laboratory surveillance, accreditation in accordance with international rules, and focusing on the One Health approach. And we're also focusing on food-borne disease surveillance. Transportation of samples is another focus, strengthening laboratory capacity, working on the essential diagnostics list, and integrating laboratory information management systems so that we have a better response at a national level. Sustainability, qualified human resources, modernization of infrastructures, equipment maintenance, and improving the supply chain, improving monitoring and report are also areas of focus. We support the progress report and restate our commitment to implementing the national strategy on diagnostic and laboratory services, and therefore recommend the approval of this strategy. Thank you.
Angola for.
Thank you very much, Excellency, Madam Chair. I will be speaking to 18.5. The Angolan delegation would like to thank the Secretariat for the progress report on the framework for the implementation of the Immunization Agenda 2030 in the WHO African region. We take note of the progress achieved and also the persistent challenges ahead as we seek to achieve the targets for the region. We have recovered some of the delays caused by the pandemic, and we have started to introduce new vaccines as well. In accordance with the Immunization Agenda 2030, we're finalizing our 2026-2030 vaccination strategy and preparing the national proposal for Gavi 6.0. The Gavi proposal will also support financial sustainability and the EPI program in selected provinces and districts. We appeal to WHO and partners to provide technical support and predictable finance predictable funds that's differentiated and aligned with national priorities, and to do so on a continuous basis with particular attention given to those that have a high proportion of children with zero doses, and in particular also places affected by outbreaks. We take note of the report and reaffirm our commitment to the Immunization Agenda 2030 so that no child is left behind when it comes to vaccines that save lives. Thank you.
Obrigada.
Thank you.
Thank you, Chair. Le Cameroun va intervenir sur point 11.
Can we like to speak about 18.11? We are establishing our implementing our national plan for integrated surveillance and response 2024-2030 in line with the health sector strategy, the National Development Strategy 2030, and the One Health approach. There's a weekly electronic notification in Cameroon through the HIS2. In addition, we have surveillance platforms that are based on events. During the second quarter of 2026, cumulated completion was 96% and timeliness 82.7%. Net progress, if you compare this to the same period in 2025. Our system is therefore mobilized and facing several events, cholera outbreak, an mpox outbreak that started a few months ago. 111 districts are impacted by measles. There's also a preparedness, when it comes to the possibility of Ebola crossing our border. Cameroon has made achievements that are recognized at the regional level, and we are one of the member states that have mobilized more than 80% of the financing necessary for SMER. Our electronic coverage is more than 90%. We have an emergency operations center that is operational. We have pluridisciplinary teams. There are still issues, for example, interoperability, limited coverage for the events, community surveillance, the lack of financing, dedicated financing. Therefore, Cameroon would like to say that it commits to the 7.7 approach and will extend event surveillance and community surveillance to at least 80% of the districts. We'd like partners to strengthen systematically surveillance and preparedness rather than invest vertically on a single disease. Thank you.
Merci. Ghana, followed by Senegal.
Thank you, Madam Chair. Ghana is making a statement on agenda item 18.10. Ghana thanks the Secretariat for the comprehensive progress report on the implementation of the global strategy to defeat meningitis by 2030 in the WHO African region. Ghana welcomes the progress made across the region, particularly the integration of Menafrivac into routine immunization programs in several member states and the successful catch-up vaccination campaigns that have reached millions of children. These achievements demonstrate the value of sustained political commitment, strong partnerships, and coordinated public health actions. As a country within the African meningitis belt, Ghana recognizes the significant burden that meningitis continues to pose to public health, particularly among vulnerable populations. We remain committed to strengthening surveillance systems, enhancing laboratory diagnostic capacity, improving outbreak preparedness and response, and integrating meningitis control interventions within broader immunization and primary healthcare programs. While progress has been encouraging, Ghana knows the challenges highlighted in the report, including resource constraints, competing health priorities, and delays in the introduction and scale-up of key meningitis vaccines in some member states. Addressing these challenges will require sustained domestic investment, predictable financing, strengthened surveillance systems, and continued technical support from WHO and partners. Ghana supports efforts to accelerate vaccine introduction, strengthen laboratory networks, improve access to diagnostics and treatment, and enhance cross-border collaboration for disease surveillance and outbreak response. We also encourage increased resource mobilization to support implementation of national meningitis elimination plans across the region. Ghana knows the progress report and urges member states, WHO, and partners to intensify efforts towards achieving this goal. Thank you, Madam Chair.
Thank you. Senegal, followed by South Sudan.
Merci, Madame.
Thank you, Madam Chairperson. I'd like to speak on 18.3. Senegal, I would like to thank the Secretariat for an excellent report. We reiterate our commitment to the regional strategy 2023-2032. On diagnostic and lab services, Senegal considers these national systems are an essential pillar for UHC, for health security, and also the antimicrobial issues. And the country is implementing reforms to strengthen its lab network. We have a special program for the development of laboratories. We are progressively deploying a system for sample management and transportation or transit. We're also strengthening molecular biology sequencing and biosecurity, biosafety, surveillance for antimicrobial resistance. We are beefing up that training. However, we lack qualified human resources. There's also the issue of equipment maintenance and improving equitable access to quality diagnostic services. In that context, we would like to make these recommendations. Firstly, strengthening the institutional capacities of national lab directorates, increasing national investments as well as support from partners to strengthen the network, accelerating the implementation of quality assurance national system and the certification of labs based on the ISO standards, strengthening country capacities and promoting integrated systems for sample management and transit. Senegal takes note of the report and the calls on an international cooperation in order to set up diagnostic and laboratory systems that will be more resilient, equitable, and integrated for the health of our African populations. Thank you.
Merci. South Sudan, followed by Sierra Leone.
Thank you, Chair. Agenda item 18.9. Chairpersons, the Republic of South Sudan welcomes the progress report on the Global Strategy for Women's, Children and Adolescents' Health 2016-2030 and commend the World Health Organization Regional Office for the Africa for its continued technical leadership and support to the member states. For the government of South Sudan, this agenda is our core national health priority and an essential pillar of commitment to universal health coverage and the Sustainable Development Goal. Our implementation efforts are taking place in the challenging context characterized by the humanitarian needs, population displacement, flooding, insecurity, recurrent flooding, disease outbreak, and health system constraint. This challenge continues to have a disproportionate impact on the women, newborn, children, and adolescents, especially in the hard-to-reach areas. With these constraints, the Ministry of Health has continued to provide policy directions and stewardship for the implementation of unintegrated RAMCA and nutrition services. The Ministry of Health has placed a strong emphasis on the primary health care and community-based services deliveries. Our priority interventions include antenatal care, skill-based attendance, emergency obstetric and newborn care, postnatal care, immunizations, nutrition service, malaria and preventions, treatment, prevention, mother-to-child transmissions of HIV, syphilis, integrated management of the childhood illness. Therefore, we call for the continued regional and partnership support to accelerate implementation of the high-impact RAMCA and nutrition interventions, strengthen emergency obstetric and newborn care, expand adolescents' response service, improve immunizations and nutrition outcomes. We reaffirm our country commitment to work with the WHO member states and partner to protect the health and rights of women, children, adolescents, including those affected by the humanitarian emergency, and to accelerate the progress towards universal health coverage and sustainable development goal. Thank you, Madam Chair.
Thank you. Sierra Leone, followed by Lesotho.
Thank you, Madam Chair. I'm presenting on Agenda 18.6. Sierra Leone welcomes the WHO Progress Report on the Framework for Integrating Country and Regional Health Data in the African Region. Sierra Leone is pleased to share experience on our National Health Information Hub, which has been completed and officially launched, drawing on the concept of the Health Intelligence Center for Africa. This information hub is government-led and provides national and sub-national views of health system performance. For Sierra Leone, the most important achievement is not simply having better data, but using data to drive actions and save lives. The hub is currently supporting the government's 300 Days 000 initiative launched by His Excellency the President, with the ambition of achieving 0 preventable maternal deaths, 0 preventable child deaths, and 0 dose children. Midway this initiative, Sierra Leone has recorded encouraging progress. Maternal death has reduced by 30%, child death by 15%, and 80% of identified 0-dose children have been reached with immunization. It also now informs our weekly maternal and child mortality situation room, where deaths from preceding weeks are reviewed, causes and system gaps are identified, and immediate corrective actions are agreed. Sierra Leone therefore thanks WHO and stands ready to share our experience as we collectively move from data collection to data intelligence, intelligence to action, and from action to better health outcomes for our people. Thank you very much.
Thank you. Lesotho, followed by Guinea.
Thank you, Chair. The Kingdom of Lesotho we are addressing agenda item number 18.3. The Kingdom of Lesotho wishes to share progress made since the implementation of the regional strategy on diagnostic and laboratory services in strengthening access to essential diagnostics and closing gaps identified in the National Essential Diagnostic List. Particular attention has been given to addressing gaps in diagnostics for non-communicable diseases, where significant unmet needs were identified. The Ministry of Health has mobilized resources for the introduction of priority laboratory equipment and diagnostic services, while implementing recommendations from the 2023-24 Diagnostic Network Optimization Assessment, including optimization of existing analyzers, improved utilization of available equipment, and redistribution. Significant progress is made in strengthening laboratory quality management systems across the whole network, including the private sector since 2023. The country is progressively advancing laboratory towards international accreditation with the WHO Afro-SLIPTA framework. To date, 9 of the 25 laboratories have achieved international accreditation, representing significant progress in strengthening confidence in the quality and reliability of laboratory results. We acknowledge, however, that translating these plans into operational capacity continues to be affected by delays in procurements and limited domestic financing for laboratory commodities. And in response to this, Ministry undertook a comprehensive lab resource mapping exercise to better understand the national financing and resource requirements, and is using the findings to strengthen advocacy for increased domestic investment in laboratory services. I thank you.
Thank you. Guinea, followed by Togo.
Okay, merci beaucoup, Madame.
Thank you very much, Madam Chairperson. Guinea would like to speak on 18.5. The Republic of Guinea takes note of the report on the implementation of immunization Agenda 2030. Despite notable progress, our region is not on track. 6.7 million children are still 0-dose children. Coverage is stagnating, and diphtheria, poliovirus, measles, all of these outbreaks persist. Guinea is directly impacted by these threats. To restore collective immunity, our country has organized 2 national immunization days. We also have a national campaign, communication campaign, television, radio programs to strengthen the confidence of the communities and promote routine immunization. But these campaigns cannot make up for the lack of regular services. Guinea recommends to refocus investments on the low coverage districts with microplans that will be finalized based on advanced strategy data. Let's focus on isolated communities and give them better access to primary health care. With the dwindling international financing, we must increase our domestic resources for immunization, cold chain, health workers, and epidemiological surveillance. Finally, we would like to call upon WHO, Gavi, UNICEF for differentiated support to zero-dose districts rather than a one-size-fits-all based on national resources. Our success will not be measured based on the number of campaigns organized, but it will be linked to the children that we will have identified and fully immunized. Thank you.
Merci. Togo, followed by Liberia.
Le Togo.
Merci, Madame la Présidente.
Thank you, Madam Chairperson. Togo would like to speak on 18.9. Togo would like to thank the Secretariat for the quality technical documents made available to the delegates during the from 2010 to date. Togo has developed several strategic plans for women's, children's, and adolescents' health, as well as older populations. The current plan covers the period up to 2027. The goal was to reduce maternal mortality, 400 in 2017 to less than 100 today. Our goal was also to reduce neonatal deaths, improve ANC. These programs were supported by several approaches, such as the National Program for Support to Pregnant Women. We also had a neonatal program established. We've strengthened our set of activities with different medications that were added to our list of medicine for postpartum management. We have a SciPharm approach as well. Oh, sorry. We have a pool of humanitarian midwives, sorry. We now have a new network of health training. Its operationalization will allow us to reach our targets, our sustainable development goals even. We would like the WHO to support us more when it comes to preserving these achievements. We would like to also support the adoption of this report. Thank you.
Merci. Liberia, followed by Mauritius.
Thank you so much. Honorable Chair and distinguished guests, delegates, building on our experiences from the West African Ebola outbreak and the COVID-19 pandemic, the Republic of Liberia supports the global and regional strategies for IDSR. With our robust national surveillance systems, the National Public Health Institute of Liberia was in February 2025 selected by the Africa Center for Disease Control and Prevention as a regional center of excellence for National Public Health Institute development. Madam Chair, with gratitude to Pan-Africanism and for the good of our continent, Liberia supports the regional strategy for integrated disease surveillance and response. I thank you.
Mauritius.
Thank you, Honorable Chair. I will comment on 18.6. Mauritius supports the Regional Data Hub 2024-2030 as an important instrument for strengthening data-driven health systems in the African region. Mauritius is actively laying the foundations for an integrated national health information ecosystem through its e-health program, unique health ID, and master patient index, DH1S2, LIMS, government-wide data exchange infrastructure, and strengthened data protection safeguards. Our experience demonstrates that regional health data integration requires interoperable national systems, common standards, strong governance, skilled human resources, and public trust. Mauritius is therefore committed to progressing from fragmented and system-specific data exchange towards secure, standards-based, and integrated health information exchange. We look forward to continued WHO collaboration and regional cooperation to strengthen interoperability, data quality, analytics, and the use of health information for evidence-based decision-making across Africa. Mauritius has established the foundations and is now moving towards national interoperability and regional data integration. Thank you.
Thank you. Sierra Leone.
Thank you, Madam Chair. I'm presenting on Agenda 18.9. We want to thank WHO for the progress report on the implementation of the Global Strategy for Women's, Children, and Adolescent Health. We acknowledge the gains made across the region, including reduction in maternal, neonatal, under 5 mortality, stronger RM and CHA, and policies, improved quality of care standards, and greater country ownership. However, the report is equally clear that Africa remains off track to achieve several 2030 targets. With less than 4 years remaining to 2030, Sierra Leone believes the time has come for a focused ministerial dialogue on the implementation and acceleration of these mentioned. We therefore call for the inclusion of a special ministerial session on women's, children, and adolescent health, the RNMCAH, and the sexual reproductive health and rights and stillborn prevention at the RC77 in Guinea. Such a session will provide ministers with a practical platform to agree on what has worked and what should be scaled up, identify the bottlenecks slow in progress, define what ministers can realistically lead between 2027 and 2030, and articulate Africa's contribution to the post-2030 agenda. Thank you very much.
Thank you. Congo.
Madam Chair, Congo would like to speak on 18.5. The Republic of Congo would like to commend the progress aimed at guaranteeing equitable access to immunization at any stage in life. Similarly to other WHO African region countries, we are fully in line with the ambitions expressed in the 2030 agenda, aiming at reducing morbidity and mortality related to diseases preventable by immunization. In this context, we have been encouraged by our progress. National coverage went from 77 in 2021 to 85% in 2025. More importantly, the share of health districts reaching a coverage of at least 80% went from 18% in 2022 to 75% in 2025. The training of various actors and deployment of digital applications, Mangolem and VP, have allowed us to improve immunization follow-up. However, there are persistent challenges such as the lack of domestic resources, limitations when it comes to the cold chain, and many zero-dose children. Congo, therefore, recommends to focus interventions on more fragile districts to strengthen surveillance and preparedness to outbreaks. Finally, Congo reiterates its commitment to maintain its efforts in close collaboration with WHO, Gavi, UNICEF, and all of its partners in order to reach the goals of the 2030 immunization agenda. We want to establish a more equitable, resilient, and sustainable health system. Thank you.
Merci, Congo.
Thank you, Congo.
From Guinea, from same agenda. Wolf. May I remind?
No, Madame la Présidente.
Madam Chair, ladies and gentlemen, we'd like to take the floor on 18.2. On behalf of the Minister of Health, we'd like to take note of the report. 3 out of the 4 midterm goals were reached. Reduction 2.3%, which is very far from the 10% goal of alcohol consumption reduction. This shows that adopting policies is not enough when enforcement, surveillance, and access to care is insufficient. Guinea has a national policy when it comes to alcohol. However, the lack of participation to the 2024-2025 global survey is due to a lack of data, and that is something that we need to rectify. Our country notes 3 priorities: updating and operationalizing the national policy, a multi-sectoral policy, strengthening the regulation when it comes to availability, communication, advertising, driving while intoxicated. We have to integrate early screening and also more services at the primary healthcare level. We also need to control informal production and fight illicit products, because consumption might go towards cheaper and more dangerous consumption. We need to finance prevention, mental health, road safety, and also addiction treatment. We finally would like to call upon WHO to support its to increase its support to surveillance, protection of public policies when it comes to commercial interests. Thank you.
Thank you. DRC, you have the floor. May I remind member states as we open the floor for goal number 2, and when we open for each agenda item, when you take the floor, just take the floor for at one time for the goals under discussion. Thank you. DRC, you have the floor.
Merci, Madame la
Thank you, Madam Chair. Ours concerns the framework to integrate regional data for the WHO African region. We speak on behalf of His Excellency the Minister of Health, who, due to state reasons, could not participate. With the implementation of National Strategic Plan for UHC 2020-2030 and the strengthening of our health systems in Congo, so with that as a backdrop, the optimal use of digital tools is a very important pillar with the development and the establishment of the National Digital Health structure, knowing that their mission is to ensure digital governance of the UHC and to support the development of digital health and clinical engineering in DRC. A process was developed with a corporate architecture for digital health in DRC. The National Clinical Engineering and Digital Health Agency will allow us to have data for the national and international levels, and we'll be able to secure this data. The National Agency for Digital Health
En ce qui concerne
will improve accessibility and youth share confidentiality and security of data. DRC, through this agency, is ready to provide data for 2024-2030 to the regional Center for Health Data. We're ready to respond to any requests for data. Thank you.
Thank you. Now I will pass the floor to observers, starting with member states from other regions, UN and other IGOs, to make your statement. Start with UNAIDS. You have the floor. UNAIDS, you have the floor. UNICEF.
Thank you, Chair. Excellencies, UNICEF supports the Regional Health Data Hub and the Data Governance Framework. However, we would like to highlight 2 points. Number one, the hub can only be as strong as the national systems that harbor them. The progress report rightly notes that many countries still face challenges with interoperability, connectivity, and manual data exchange. Strengthening national systems must therefore be the foundation of the regional hub. Number two, we should focus not only on the value of sharing data, but also on the cost of not sharing. During health emergencies, we need timely answers to 3 basic questions. Number one, where are health workers? Number two, what training and protection do they have? And number three, how can we deploy them quickly? Yet, this information remains fragmented with data sharing arrangements not always operationalized. We therefore encourage the different member states to treat data sharing agreements as a preparedness measure, not an administrative requirement. Stronger workforce data will support better planning, better training, financing, and ultimately faster emergency response. And finally, UNICEF remains committed to supporting member states in coordination with WHO, Africa CDC, and all partners in advancing this agenda. Thank you.
Thank you. I see. Okay. We now move to non-state actors. Drugs for Neglected Disease Initiative. You have the floor.
Thank you, Chairperson. I'm presenting on agenda item 18.4. DNDI welcome this progress report. However, for many neglected diseases, existing tools remain inadequate, and the success of elimination program will depend on having treatment and diagnostic that are effective, safe, affordable, and suitable for use in remote and underserved settings. Recent advances demonstrate that sustained investment in research and development can deliver. WHO's new recommendation for visceral leishmaniasis and post-Kala-Azar dermal leishmaniasis, developed through trial in Ethiopia, Kenya, Sudan, and Uganda, offer shorter, safer, and more practical treatment options for the patient. The report calls for rolling out innovative tools, but is silent on the investment that produce them. We ask the member states to adopt this regime in a national guideline without delay, to recognize research and development as an integral to elimination target, and to ensure financing for neglect tropical disease. Thank you so much.
Thank you. International Pharmaceutical Students Federation, you have the floor.
Presenting Agenda 18.4, Honorable Chair and distinguished delegate, tropical and vector-borne diseases remain a heavy burden in the African region, with malaria, neglected tropical disease, and arboviral infection continuing to threaten millions of lives, worsened by a weak health system and fragmented underfunded programs. IPSF represents over 600,000 pharmacy and pharmaceutical science students and recent graduates in more than 100 countries and support disease prevention through community sensitization on malaria, treatment, adherence, education, and awareness campaign on neglected tropical disease. We call upon WHO and member states to strengthen surveillance, outbreak preparedness, and response for malaria, dengue, and other vector-borne diseases, including across stable and emergency settings. Support effective case management, vector control, and preventive intervention align with global and regional strategies, including through integrated delivery within primary healthcare. Provide technical guidance and operational support to develop, implement, and monitor national plans, including in high-risk, hard-to-reach, and emergency settings. Thank you very much.
Thank you. Stitching Pharma Access International, you have the floor.
Agenda item 18.6. Chair, Excellencies, Pharma Access strongly supports this agenda and welcomes the progress on the Regional Data Hub. Since the framework was launched, rapid advances in health technology and AI have made health data even more valuable. As foreign governments and large tech companies seek access to African healthcare data, health data sovereignty has become more urgent than ever. Optimizing the value of data to finance and deliver healthcare to millions of underserved people in Africa is the next frontier of healthcare innovation. Amid scarce resources, doing more with less is essential, and data is central to that effort. In West Africa, we've supported national health insurers to digitize and analyze health insurance schemes, improving efficiency and helping expand benefit packages at lower cost. In East Africa, we supported the rollout of a digital patient ID, bringing transparency to healthcare delivery, enabling better tracking utilization, and improving targeting of services. Going forward, we believe the most important step will be empowering patients with meaningful control over their own data. We're implementing governance models, including health data cooperatives that give patients direct say in how their data is used. We stand ready to support WHO and member states to advance this agenda. Thank you.
Thank you. World Obesity Federation.
Thank you, Chair. Agenda item 18.8. World Obesity Federation welcomes this report. However, we urge member states to ensure obesity services are integrated into universal health coverage going forward. As stated in the World Health Organization recommendation, obesity is rising fast in Africa. Adult obesity already exceeds 30% in several countries. Obesity is a disease requiring a multi-sectoral response. Prevention policies alone will not be enough to stem the tide. Given that obesity is also a major driver of NCDs, addressing obesity will deliver a double dividend. To ensure obesity health programs are truly effective, it is vital to involve people with lived experience in their design and implementation. This collaborative approach helps create non-stigmatizing patient-centered services that people can trust. World Obesity Federation calls on all who are from members to ensure that obesity prevention and management services are considered essential services and integrated into the framework of sustaining resilience health systems to achieve universal health coverage and promote health security before the obesity epidemic takes hold in the Africa region. Thank you.
Thank you. Medical Women's International Association, you have the floor.
Thank you, Chair. Agenda item 18.9. Medical Women International Association welcomes the progress report and commends WHO and member states for their continued commitment to advancing the health of women, children, and adolescents. Despite progress, the WHO Africa region continues to bear an unacceptable burden of maternal mortality, with approximately 70% of global maternal deaths occurring in the region. Across Africa, cancer is estimated to claim more than 300,000 women's lives every year, merely breast and cervical cancer. MOA emphasized that investment in women's health is an investment in Africa's development. We call for increased investment in women's health, quality maternal and reproductive health services, stronger health systems, and sustained health awareness and prevention campaigns that reach women and girls at community level. Advancing women's health is fundamental to realizing the Sustainable Development Goals and Africa 23 Development Agenda. Mediterranean, which is advancing
advancing women's health and women empowerment to realize the SDGs strongly aligns with WHO objectives and global strategy. MOA stands committed to working with WHO member states and partners to advance women's health, strengthen health awareness, and ensure that no woman or girl is left behind. Thank you very much.
Thank you. You're now invited to present your comments on the following and their goal for WHO corporate outcomes, cross-cutting one, agenda item 1812 to 1814. I now invite member states wishing to provide comments to do so by raising their nameplates. I again remind you to take the floor at once. Ghana, followed by Carr.
Thank you very much, Madam Chair. I want to speak on agenda item 18.14, regional matters arising from reports of WHO internal and external audits. We thank you for the opportunity to comment on the agenda item 18.14, and I appreciate the Secretariat for the reports on regional matters arising from WHO internal and external audits. Ghana recognizes the critical role of internal and external audit mechanisms in promoting transparency, accountability, good governance, and effective use of resources within the organization. Robust oversight systems are essential to maintaining the confidence of member states and ensuring that WHO delivers on its mandate efficiently and effectively. We note the progress made in addressing audit recommendations and strengthening institutional controls, risk management, compliance, and performance monitoring across the region. We encourage the Secretariat to sustain efforts to address outstanding recommendations in a timely manner and to continue fostering a culture of accountability and continuous improvement. Ghana further underscores the importance of ensuring that findings and lessons from audits are translated into practical actions that enhances program delivery, operational effectiveness, and value for money, particularly at country level where WHO supports in most directly affect. We support the continued strengthening of governance, oversight, risk management, and internal control systems, and encourage regular reporting on progress made in implementing audit recommendations. Ghana remains committed to supporting efforts that enhances the effectiveness, transparency, accountability of the organization in advancing health outcomes across the African region. Thank you.
Thank you. Carr, followed by Gambia.
Merci. La RCA va
Thank you. The Central African Republic would like to focus on the agenda item 1812 on research for health. We would like to thank the Secretariat, the WHO Secretariat, for the final progress report on research for health, a strategy for the African region 2016-2025. For our country, health research is very important in political terms. It allows us to provide solid data that allows us to make good decisions, thus bolstering our health systems. We have health research in a number of different domains. However, we have significant challenges: the lack of continuous funding, infrastructural deficits, deficits in skills, and then transferring the results into public measures. So we congratulate the WHO for helping train staff in operational research. We urge you to support, first and foremost, fragile countries, strengthening our technical capacity and our technology, allowing us to have sustainable mechanisms and helping us to create regional research networks. International cooperation is important, but we need African leadership at that level too. We restate our commitment to consolidating our national research system and promoting this work with the support of partners and the WHO. We will continue to work on health research to provide resilient health systems for our African populations. Thank you.
Thank you. Gambia, followed by Angola.
Chair, on agenda item 18.12, the Republic of the Gambia thanks the WHO Regional Office for Africa for presenting the final progress report on research for health, a strategy for the African region 2016 to 2025. We note the progress achieved over the past decade in strengthening national health research systems, while recognizing that greater effort is still required to ensure that research consistently informs policy, planning, and practice. The Gambia recognizes research as a critical pillar of resilient health systems, evidence-informed decision-making, innovation, health security, and universal health coverage. At the national level, the Gambia has made important progress in advancing research for health. The country benefits from a strong research ecosystem, including the Medical Research Council Unit, the Gambia, at the London School of Hygiene and Tropical Medicine, the University of the Gambia, the National Public Health Laboratories, and other partners. These institutions have contributed to evidence generation in areas such as malaria, tuberculosis, HIV/AIDS, maternal and child health, nutrition, vaccines, neglected tropical diseases, and emerging infections. The country has also strengthened ethical oversight of health research and promoted collaboration between policymakers, academia, and research institutions. The Gambia welcomes the report's recommendation on stronger ethics systems, updated research policies and strategic plans, revitalized knowledge translation platforms, and increased domestic investment in research. We call upon WHO and partners to continue supporting member states through technical assistance, institutional development, research capacity strengthening, and innovative financing mechanisms to build sustainable nationally owned research systems. The Gambia remains committed to strengthening research for health as a foundation for improved health outcomes, resilient health systems, and equitable progress towards universal health coverage. Thank you.
Thank you. Angola.
Thank you very much, Excellency Chair. We would like to speak to point 1813. Angola would like to congratulate the Secretariat on this report on WHO staff in the African region and takes notes of the efforts made in a context of significant financial tightening and the reduction in human resources. We acknowledge that human resources are fundamental for WHO to be able to provide effective support to member states. We would therefore like to highlight the quality of WHO professionals working in Angola and the important technical support provided by them to the government, which helps us strengthen our national capacity and provide the requisite response to health priorities in the country. We also acknowledge the challenges being faced as we realign and reprioritize in the organization. This has led to a significant shrinkage in the health personnel in the region. We would like to continue protecting fundamental roles which contain the technical know-how that countries require. We take note of this report on WHO staff in the African region. Thank you.
Thank you. Thank you very much. I see no request from member states for the floor. So now I pass the floor to observers, starting with member states from the other region, UN and other IGOs, to make your statement. You may take the floor. I see none. Now the floor is open for non-state actors on agenda 18.12 to 1814. We start with International Federation. International Federation of Medical Students Association.
Thank you, Chair. We'll be presenting on Agenda 18.12. Honorable Chair, distinguished delegates, Africa cannot build health sovereignty on evidence it does not generate, finance, or use. The Regional National Health Research Systems Barometer fell from 61 in 2018 to 48 in 2025, while only 4 member states allocated at least 2% of their national health budgets to research for health. IFMSA urges member states to establish predictable domestic research financing, update national research strategies, and revive knowledge translation platforms that connect evidence to policy. We further call on WHO to support member states in strengthening ethical governance, equitable research partnerships, and sustainable pathways for early career African researchers. Research achieves its purpose when African questions can be answered with strong African research evidence and used in decisions to improve health across Africa. Thank you, Chair.
Thank you. Wonka, you have the floor.
Thank you. Also 1812. High quality primary health care requires an evidence base that is derived from relevant African settings and populations and not extrapolated from specialist hospitals or high-income countries in other regions. The WHO Action Plan on Clinical Trials highlights the need for more high-quality clinical trials to be conducted in low and middle-income countries and in primary care. The World Organization of Family Doctors in the African region recognizes the need for research capacity building and a pipeline that creates more established researchers in the fields of primary healthcare and family medicine. In addition to the Action Plan on Clinical Trials, research can help implement effective clinical interventions and identify best practices in service delivery, community engagement, and multi-sectoral action. Wonka calls on national research institutions and funders to firstly set priorities for research in primary healthcare and family medicine that address priority clinical conditions, service delivery, supportive health system structures and inputs, as well as capacitation and training of the workforce. And secondly, to fund research that provides an evidence base for strengthening of primary health care and district-level health services throughout the region. Thank you.
Thank you. I see no more requests from the floor. The Secretariat has taken note of your valuable comments. Is the Regional Committee ready to take note of the information document under Agenda Item 18? I see no objection. The document are noted. Ladies and gentlemen, we have now reached to the closure of the 76th session of the Regional Committee. Before we close, I would like to give the floor to the Secretariat for any announcement or practical information.
Distinguished delegates, allow me to remind you that our last side event dedicated to the national data, to the data hub, WHO data hub, will take place in this very room. We would respectfully ask you to remain in the room to take part in this side event, which will be of critical importance for the work of this regional committee session. There will be a visit and cultural activities tomorrow. You will receive information via email with an invitation. Buses will be made available to all delegates. The buses will leave from the United Nations Conference Sector, taking you to the different cultural sites. Thank you very much for your attention.
Thank you, Secretariat. In accordance with Rule 20 of the Rule of Procedures, the Secretariat shall, in collaboration with rapporteurs, prepare a final report of the committee, which shall be shared with Member States for adoption within 60 days. Member States shall have the opportunity to inform the Secretariat of any correction that they wish to make. So now I would like to invite Dr. Fidele Nabazezi, Honorable Minister of Health of Burundi, to deliver the vote of thanks. Honorable Minister, the floor is yours.
Madame la présidente du comité régional, Monsieur le directeur régional de l'OMS, Excellences, Mesdames et Messieurs les ministres, Mesdames et Messieurs les délégués.
Sorry about that. We have reached the end of the 76th session of the Regional Committee of the WHO for Africa, and it is my honor to propose this vote of thanks. On behalf of the Regional Committee, I would like to express our profound gratitude to His Excellency Dr. Abiy Ahmed Ali, Prime Minister of the Federal Democratic Republic of Ethiopia, and to the government and people of Ethiopia for the very warm welcome and exceptional hospitality extended to us during our stay here in Addis Ababa. We would particularly like to commend the quality of organization, the excellent services provided, and all of the measures taken to ensure the comfort of delegates and seamless deliberations. This attention shows the constant commitment or standing commitment of Ethiopia when it comes to collaboration and health in our region. We would also like to extend our gratitude to the chairperson of the regional committee and to the two vice chairs. We thank you for your leadership and the remarkable way in which you led our discussions and deliberations. We'd also like to thank the regional director as well as the secretariat as a whole. We'd like to thank the organizers, the interpreters, and all of the support teams. Your professionalism, dedication, and tireless work greatly contributed to the success of this session. Finally, I would like to thank all of the ministers, delegates, and partners for their active participation as well as their rich contributions. The exchanges, rich exchanges, the spirit of the constructive spirit, allowed us to reach very important outcomes for health and well-being in Africa. I would like to ask the regional director to convey our gratitude to His Excellency, the Prime Minister, the government, and people of Ethiopia. Thank you.
Thank you very much, Your Excellency. May I now request the regional director to address the regional committee?
Madam Chair, Your Excellencies, one lesson stands above all others from this 76th session of the Regional Committee. The achievements we have celebrated this week did not come because circumstances have become easier. They came despite financial constraints, ODA declined by 23.1%, the largest annual contraction on record. They came despite more than 120 public health emergencies across our region. They came despite an increasingly complex and uncertain global environment. They came because leadership, you honorable ministers, stepped forward. They came because you excellencies stepped forward. I have to repeat that. They came because member states chose actions over excuses. They came because member states refused to allow our future to be defined by their challenges. And that gives me enormous hope. Over the past 4 days, we have adopted strategies in those frameworks and embraced a shared direction through Vision 2035. But let us be honest with ourselves. History will not remember what we have approved in this room today. History will remember what changed in the lives of the people because of what we approved in this room. The real test begins tomorrow. The real test begins when you, honorable ministers and head of delegations, return home and defend health in national budgets. When health workers arrive at facilities that finally have the medicines, equipment, and support they need. When every child has an identity and a birth certificate, because how can we say no child will be left behind if the child does not have official ID? When mothers are protected from catastrophic health costs, when communities face outbreaks with confidence because preparedness was strengthened before the crisis arrived. This is where Vision 2035 will succeed or fail. For WHO Afro, let me make one commitment. At RC 75 in Lusaka, you asked for accountability. You asked not only what we planned to do, but what we had actually delivered. We listened. And at RC 77 in Guinea next year, we will report back to you honestly. We will tell you where progress has been made. We will tell you where implementation is still underway. We will tell you where challenges remain. And together, we will identify solutions because accountability is not about blame. Accountability is about trust, and trust is about the foundation of transformation. Excellencies, yesterday I learned a very simple lesson that I will carry far beyond Addis Ababa. What I heard yesterday, and Madam Chair, you are there, 10% meetings, 90% actions. Let's go back home with that. So please, kindly, with all humility, turn to the person sitting next to you and say, let's do more for Africa. Because Africa does not need another year of promises. Africa needs implementation. Africa needs courage. Africa needs results, and Africa needs all of us. As we leave Addis, the cradle of humankind, let us remember that every generation is asked question by history. The question for our generation is simple. When Africa had the knowledge, the talent, the resources, and opportunity to transform health, did we act? I believe the answer can be yes, because I've seen ministers here, head of delegations, who refuse to give up. I've seen health workers serving in most difficult conditions. I've seen communities protecting one another during emergencies. I've seen young Africans bringing innovation, energy to our health systems. And throughout this week, I've seen a continent increasingly confident in its own future. So let us leave Addis Ababa with confidence. Let us live with unity. Let us live with purpose. And when we gather again in RC 77, in Guinea, inshallah, let us not measure our success by the number of resolutions we adopted. Let us measure our success by the number of lives we improved, because people do not live inside strategies. People live inside families. People live inside communities. People live inside hopes and dreams. And that is why we do this work. Excellencies, the future of our continent, health, will not be written anywhere else. It will be written by Africans, written through African leadership, written through African institutions, written through African innovation, written through African excellency, and above all, written through African actions. And when future generations look back on this decade, may they say this was the moment Africa stopped asking what was possible and started providing what was possible. May they say this was the moment Africa took ownership of its own health. And may they say this was the generation that chose actions over excuses, unity over divisions, and hope over doubt. Together, let us make Vision 2035 more than a document. Let us make it a reality. Let us make it a legacy. Let us make it history. And let history record that when the moment came, Africa was ready, Africa was united, and Africa delivered. Madam Chair, allow me to conclude by once again expressing my heartfelt gratitude to all delegates, our valued partners, and the government and people of Ethiopia for making RC 76 such a remarkable success. A special thanks to you, Dr. Daba, for your exceptional leadership and dedication throughout this meeting. I remember we started by Walker Talk. You are smiling all the way. And finally, to my WHO family across all three levels of the organization, thank you for your tireless commitment and hard work. Special appreciations goes to DPM, Dr. Abrahaman Diallo, for this outstanding leadership in delivering RC 76, and your deputy, Dr. Francis Kasolo, for this steadfast support and dedication. From all of us, thank you, Dr. Diallo, thank you, Francis, and thank you all delegates. I wish you a very safe trip back home. Merci beaucoup, muito obrigado, Aish. Safe travels.
Dr. Janabi, thank you very much. Excellencies, distinguished delegates, colleagues, friends, on behalf of the government of Ethiopia and as a chair of this regional committee, I extend our sincere appreciation to each and every one of you for joining us here in Addis Ababa. It has been a true honor and a privilege to host you over the past few days for the 76th session of WHO Regional Committee for Africa. Our discussion has been substantive, our exchange has been candid, and our commitment to health and well-being of our people and for our continent is unmistakable. The insights, the collective spirit, the shared determination that each of you has brought during our discussion and beyond this meeting room, beyond this place, the discussions we shared in and out of this building have made this session really successful. As we leave Addis Ababa, let us carry forward not only the decisions we made, but also the collective responsibility to translate them into meaningful action for the people we serve. To all delegates, the WHO secretariats, our partners, everyone who have been working tirelessly, my ministry team, the country team in here, behind the scene that some you haven't been able to see in front in here, they have been tirelessly working to make this meeting really possible, and thank you so much. It has been Ethiopia's great honor to welcome you. I wish you all a safe travel back home. Thank you, and until we meet again, I declare the 76th session of the Regional Committee for Africa closed. Thank you.
Music, please. Music, please.
Everyone a picture. Everyone wants to be in the picture. How are you? Selam.
Yes.
Okay. We'll stay here.
Let's see. How's the shot of scene? I'm not sure.
Oops. Yeah, it's impossible.
They're finished. They're done. Okay.
Honorable delegates, hello. Hello. Honorable delegates, please don't go away. We have one last thing for you. Excellencies, honorable delegates, please don't go. We have one last celebration for you all. Please don't go.
You're too classy. No one hears you. Scream.
Oh my gosh.
Yeah.
I'm screaming. That's all the screaming I can do. Honorable delegates, please don't go. We have something to close this in style. Please don't go.
You want me to try?
Yes.
Please do not go. There is one celebration for all of you guys. Please do not leave. Dear delegates, do not leave yet. Thank you. Hey, take my picture. I want to make sure they heard me. Do not leave yet. I don't know if they heard me. I think they are tired. But they say it so.
Okay, we're going to start very soon. We're going to start our last celebration very soon. I promise you, it's going to be really exciting. So please take your seats and let's have the launch of the RD Hub, your hub.